All right, thank you so much. And without further ado, here is Dr. Sponaugle.
Good evening. We were going to answer some questions, but we're not going to take questions without being able to talk to folks, and we'll work on the technical side. So let me just go through a talk that I gave last week at the International Lyme Association. And we've done a lot of PET scan work. I want to explain first, I began doing SPECT brain imaging in the mid-2000s and referred patients to Amy Clinic. This is actually an example of a patient who had a severe viral encephalitis. And we're looking at the inferior view. These are the cerebellum. The coordination centers are right and the left. You see a lot of damage here. Now, these are not holes in the brain, the way Daniel set for software all these scans, Daniel England. If the activity was 45% or less than normal, we would see a hole on the surface scans. The deeper structures, you can see loss of the basal ganglia. This is one of the basal ganglia. The basal ganglia are motor regions. There's a right and a left. They contain 3 different motor regions that run on dopamine. The substantia nigra is the Parkinson's region, the caudate nuclei, and the lentiform nuclei. There's 3 motor regions. For some reason, neurologists tend to focus only on the substantia nigra, or Parkinson's, known as the Parkinson's region. You can see that the SPECT scan, we just see that the red on these scans would indicate 35% increased activity. So the PET scans are much more sensitive. The SPECT scan measures cerebral blood flow, and the blood flow does correlate with electrical activity. And when we only get SPECT scans for around the price of $1,000, we did the specs. I have been able to get PET scans down to that price. PET scans are normally $13,000, and in some universities $15,000. Actually, was one of our NFL players who helped me negotiate a better rate, promising a lot of NFL players coming for brain trauma treatment once they settle a lawsuit. So everybody wants to be involved with the NFL, so it helped us get a great rate. On the PET scan, we can see the caudate nucleus, and it's fascinating that I've asked the neuroradiologist I work with why people chose on the PET scan the nigra region, again, within this same basal ganglia. You can see on the PET scan that we are measuring standard deviation, we're measuring metabolism. The PET scans, the glucose metabolism, 3-pound brain, burns 25 to 30 glucose. So they tag the glucose, and you measure how much metabolism of glucose you have, and that correlates much more directly with brain activity. What we can see comparing a SPECT scan, we just see a loss of the red, we see way much more on this region where the right temporal lobe is rotated, etc. You see a picture up here. I'm not much into pictures in college, but that's what radiologists were taught to use. With the caudate nucleus that's circled, we can see that we are 5 standard deviations underactive on the right side. All right, so we got the caudate nucleus, which would be in here. We can't really see a big difference except for loss of the red color on SPECT. But here we can determine that we are 3 standard deviations more underactive on the right caudate nucleus. It's a good example. The temporal association is actually worse. So this right temporal lobe, look at the bottom of the right temporal lobe where this viral encephalitis, this patient also has Lyme disease, etc. But the viral encephalitis destroys so much brain tissue, and we see on the PET scan that we are 3.94 standard deviations more underactive on the right temporal lobe than the left. So the numbers are very helpful. One can see that the infection didn't get back into the cerebellum. This is the indicative of the cerebellum, one of our coordination centers. And cerebellum, we're relatively equal as far as the brain activity. So, So the PETs are a much better way to go. Now we've gotten PET scans down to a very reasonable price of $1,000. It's quite a bargain. And so we've got the largest PET scan study on Lyme disease patients and mold toxicity patients. We most likely have the largest study in the world at this time. I've did an extensive study in the fall of 14. October, November, December went through over 12,000 MRI studies to compare the shape or the morphology of the lesions of what they felt were Lyme infections versus parasitic infections, et cetera. And that was based on spinal fluid analysis of antibodies. So I'm going to present a few cases. This particular patient, 46-year-old CPA, and she was diagnosed with frontal lobe dementia, Lyme disease. We diagnosed her with Lyme disease, Bartonella, Bartonellosis. She had lots of Trichothecene toxicity. And she had a lot of industrial toxicity and questionable neurocysticercosis. Neurocysticercosis is the infection of the brain with various parasites. We're talking gut parasites like dog tapeworms and pork tapeworms and liver flukes, etc. And it's much more common in Americans than we once thought. More recent studies in 2013, 14, and 15 are proving that, and one does not know without using neuroimaging. The patient had multiple symptoms, but these slides were prepared for a 45-minute talk with multiple scans. So 4-second processing learning memory is the first memory, the shortest of short-term memories that goes dysfunctional when patients suffer infection in the frontal lobe. It's really the beginning of the dementia, Alzheimer's, depression, light sensitivity, etc. So we have a lot of names for these things. Mild cognitive impairment, premature dementia. I'm not much into the names. On the PET scans, if one uses colors, we like to see the dark black colors. Again, I prefer the numbers. And this particular patient had a maximum. This particular patient had global, very diffuse light blue activity. If you can, with your wrap your brain around the fact that if you can remove these linear, lesions, the linear, light, almost white, underactive regions. This is and even look at the bottom of the brain, the inferior view, the yellow areas. These yellow areas on these scans, the light blue is underactive, the yellow is more underactive, and we can actually show you some regions that are worse. What we learned from the MRI studies worldwide is that Lyme spirochetes and Bartonella love the prefrontal cortex. Look at the bottom of the brain. These localized infections, localized areas of underactivity is where there is infection, in addition to toxicity. And the morphology or shape of these lesions is very similar to the lesions seen on MRI. The shape of the lesion is the same, whether it's MRI or a CT scan. The difference is a PET scan will actually calculate the decreased brain activity or hypometabolism. This particular patient is probably a genius IQ, a very intelligent woman, but really very difficult to talk to initially because her 4-second processing memory was so infected. Now, if you remove, again, the localized underactive areas that are a lighter light blue or white, or even a yellow, you'll see a diffuse light blue throughout the brain. That diffuse global underactivity is caused by mainly 2 mechanisms: fatty acid oxidation, and that is where these fatty toxins, whether they're petroleum, pesticides, or mold mycotoxins, which this patient had all the above, they infiltrate the fatty tissue and the fatty brain. The brain is the fattiest organ with 60% fatty content, but the myelin sheath on each individual nerve has 80% fatty content. And we have numbers where we measure fatty acid oxidation, but the other mechanism that is more prominent in some people is the shutdown of mitochondria. The mitochondria are the engines that run every cell in the body, with the exception of the mature red blood cells. Brain cells have the most mitochondria per cell, and the retina does as well. The retina is actually part of the brain, and not the eye. And so the mitochondria are constantly attempting to imbibe toxins, fatty acid molecules, as well as glucose, through little microtubules that go out to the bloodstream from the inside of the cell. They're attempting to imbibe these fatty acids, good fats, to burn for heat production, energy production, etc., and for a formation of ATP, one of our major energy molecules. They will mistakenly, if you will, quote, suck these ugly toxins that are floating through the bloodstream into the cells, and the mitochondria will shut down. They're trying to burn fatty molecules they weren't made to burn. It's somewhat analogous to putting burnt motor oil in your gas tank. And one of the first toxins proven worldwide by German scientists to be mistakenly sucked into the mitochondria from the bloodstream is trichothecene. There are over 200 trichothecenes. Those are gaseous metabolites from some of the black molds, the Stachybotrys molds, etc. And when they pull these toxins in, they become dysfunctional. Actually, most of the scientists who focus on mitochondrial function are now saying that all the aging pretty much is dependent on mitochondrial function. And when mitochondria decrease in their functionality below 50%, they fail to go through a process called mitosis and reproduce. And that's when we have what we call apoptosis, or cell death. And so if one can infuse healthy fatty acids into the patient, phosphatidylcholine and alpha-lipoic acid, etc., then when those healthy fatty acids are infused into the bloodstream and then absorbed by the mitochondria will expel these ugly fatty toxins, whether they're endotoxins from the cell wall of Lyme spirochetes and other bacteria, or the E. coli, etc., Lyme toxins, petroleum toxins, pesticides, etc. So in moving this patient from this diffuse light blue picture to the dark black, if you will, that is about reducing the mitochondrial dysfunction, waking up the mitochondria, waking up the brain cells, and by mobilizing the fatty toxins from the myelin sheath, in particular on the brain nerves, etc., and the cell membranes. And the cell membrane of the brain cells and skin cells, heart cells, etc., are composed of 50% phosphatidylcholine. So one cannot get from here to here with the average fatty acid infusion performed in wellness centers. Even in Germany, we have advanced our phospholipid therapy now to levels that are 6 to 8 times higher than what is used in other wellness centers and what was originally used in Germany. The German physicians were the first to use these techniques to actually reverse fatty liver. We see a lot of non-alcoholic fatty liver in our practice. It's caused by a combination of petroleum toxins and mycotoxins, particularly trichothecene. At any rate, the localized areas, what it took to get this woman from here to here is to move the fatty toxins out. And I'm just going to go forward for a moment and give you an example. This is one of the tests we use for Great Plains. You can see that on this testing, a 7,000 level on these methyl-ethylbenzenes actually puts you in the top or worst 5% of patients tested. Xylene, which is ethylbenzene, styrene, xylene dimethylbenzene. These are all benzene derivatives. It's interesting. Benzene will rarely show up as a positive on this testing. And somewhat fascinating is scientists only recently, within the last year or so, were able to ascertain they've been measuring the wrong chemicals in the air and in the water when they measure benzene and toluene, because the benzene, when it comes out of the ground from a gas well or it hits the air, hits the water, it will grab a methyl group, a carbon and 3 hydrogens, or double methyl groups, et cetera, dimethylbenzenes, common denominator. So actually benzene measurement, which the feds were recently doing surrounding the gas leak in Los Angeles that lasted from October to March. One of the actresses we've treated her friends, had children in a school 4 miles from the gas leak up in the hills. And the feds came in and said the benzene level is only 1 part per billion and not a problem. Well, it turns out that if you measure benzene, we may show you that down the road in another case. Benzene is very low, and I have to admit for years I would measure benzene and toluene. Toluene is used in the plastics and phthalate production, but all those chemicals come out of the grandfather or grandmother of benzene. So measuring benzene in the water and in the air, it gives you a false negative. It does the same thing in humans. At any rate, major industrial toxicity as well as petroleum toxicity in this patient. And the petroleum toxins, etc., and the mold mycotoxins were causing all this global, very diffuse underactivity. I've done a study with radiology groups, these are neuroradiologists, attempting to determine if these long or linear, quote, stringy, underactive regions are demyelination. So to do that, unfortunately, requires 2 brain scans, which the neuroradiologist told the studies were never done, where you compare the PET scan findings to MRI. And we did a study, and we found a poor correlation of 1 out of 30 patients that would have actually demyelination in these regions of the brain. And so, unfortunately, we're forced to tell folks that they may well have neurocystic psychosis, which actually is only recently been studied. In fact, the neuroradiologist I work with had never heard of it. I went through the spring of 15 for 3 months looking for studies worldwide. It turns out that the majority of the studies had titles like underdiagnosed, undiagnosed, and neglected neurocystic psychosis, that's parasites in the brain again. And they're suggesting at least 2% and probably 4 to 5% of Americans do have some gut parasites that cross the gut-brain barrier and go in the bloodstream. And we have for years seen larger parasites in the biofilm in the bloodstream. And we can actually, let's just skip a couple slides and show you an example of that. This particular slide is the only slide in my clinic that's not one of my patients. It's an internet slide of a Lyme spirochete, very linear in morphology. And you see that the length of the spirochete is approximately the diameter of the red blood cell. So we don't just look at things and say, oh, that's cute. Let's always analyze and put a mathematical, try to quantify what we're seeing so we can determine other things such as this. This is a blood smear at 400 power on a microscope. And these are red blood cells at 400 power. Obviously, this particular organism that is trapped in a biofilm formation in this patient's blood is much longer than a red blood cell and much longer than this spirochete would be. So it's not a Lyme spirochete. One could argue there's 1 or 2 wrapped up here. There are what we call neurofibrobranchial fibrillary tangles within the brain for Alzheimer's bodies where you can have 2 or 3 spirochetes wrapped up. But this is a very long parasitic organism that is in the bloodstream. My patients and chronic Lyme patients do not have a blood-brain barrier. All the fatty toxins destroy the blood-brain barrier. Not that I needed it, but a study came out of Germany within the last year on trichothecene destroying the blood-brain barrier. Anytime you have fatty barriers and fatty linings, the sinus, the intestinal lining, bladder, etc., those linings are very vulnerable to the fatty toxins. At any rate, when we see these parasitic organisms within the biofilm, they can very easily get to the brain. And probably at this point, in 2011 and 12, we saw these parasites in probably 1 out of 40 people. We see our practices changed. We have a much sicker population of patients than we had in 2011 and 12. We've had to advance our treatment tremendously from then. And we probably see these larger parasitic organisms in 90% of our patients. It's all about the more toxic the patient is, the more immune suppression they have. So at any rate, it's a good chance that these were parasitic in nature. We don't like to tell patients that, but what's fascinating, I've designed a parasite kill that's very effective. It's a combination of herbs, and when you give patients parasite kill, all natural, and they will often point to the same area you see these organisms. The parasite kill also kills the very small round parasites. The protomoxoas, of which there are literally hundreds. There is some work being done at universities now with Dr. Fry for DNA sequentialing, but we don't particularly care which one you have. We will kill it the same way. A, by getting your immune system working, and the first thing you do is get the brain working. We move the brain activity from severely underactive to working well. It activates the immune system, and when you improve the mitochondrial function of the killer cells and antibodies as well, you get much more effective kill power. And so in this particular patient, we had to go after this type of infection. In my own ignorance and lack of knowledge in 2011, I was so turned off by my daughter's fiasco with 4 to 6 antibiotics a day and being treated in 2007 and 8 by a great doctor who has a lot of passion, but a lot of physicians don't understand how destructive these antibiotics can be. And I would have said, and taught a young man who was here in an internship, a young kid who didn't hang out with me for 2 summers, that we should use the antibiotics. It is malpractice, in my opinion, to not use antibiotics in patients with neural Lyme. You don't know until you've done enough brain scan studies that so many people are infected in the brain, and once you get the immune system activated with kill power, much more like God intended, they will bust biofilm on their own. We no longer need to use cesium peroxide drips, which were much stronger than ozonation. We don't use ozonation. We haven't needed ozonation in our history because at this point we simply have learned how to make the immune system work. The greater problem we have here is that once the immune system kicks into gear, like it should, patients will actually dissolve the biofilm quickly and can sometimes release 5 years worth of toxins and organisms at one time. This particular patient had tremendous improvement of brain activity. Let's go back to this slide. When we got to this point, it was in May, I sat with her one Friday evening. We were all thrilled to see the difference in the brain. We had to use 2 different antibiotics to get rid of the 4-second memory infection. You see how the 4-second memory in the lateral prefrontal cortex is opened up. The lady says, "My goodness, my brain works as well as it ever has, as well as it did when I was 20." And again, this entire prefrontal cortex, this lighter light blue, is a combination of petrotoxins, etc. We see little round, perfectly round organ underactive regions. Those are cysts that are formed by protomoxoa. MRI studies worldwide, they've looked at this. They only measured antibodies, unfortunately, to toxoplasmosis, the most common, or what allegedly is the most common protomoxoa parasite in the brains of people in the world. Supposedly 1.2 billion. The guesstimate by the World Health Organization is 1.2 billion people out of 7.5 billion have toxoplasmosis cysts within their brain, within their body. The little cysts are perfectly round. Unfortunately, they didn't look at other protomoxoa antibodies in the spinal fluid studies that I looked at worldwide, even in Germany, only toxoplasmosis. But the protozoa, whether it's Protozoa rheumatica, which one of the protozoa Dr. Fry first diagnosed, or other protozoas, one-celled parasites like toxo, they will form a cyst. We have noticed, and Dr. Fry is one of the physicians who was in my in my talk up at ILADS, and we talked for about an hour afterwards with 30 other physicians who followed me out of the room to ask more questions. And we actually had a 3-hour session after I gave my talk with physicians from Canada and Australia and around America. But at any rate, Dr. Fry and I were talking about the correlation of that I will have now with PET scans and toxo antibodies. And he was saying to the group, my patients have more toxoplasmosis than any of the patients he sees from the doctors. It's simply a matter of having patients that have more suppression of their immune function. But whether it's toxo or Protozoa rheumatica, et cetera, we see perfectly round cysts. And they love the brain, they love the nerves, they love the nervous system. The studies were wide on, again, MRI. There were no PET studies. And it's only very recently that a professor at Harvard, she just began to do a few PET scans. And again, it was cost prohibitive before. I'm sure she has grant money. I've just got a great deal for my patients. But the deal is, these little round, perfectly round areas can be protozoa. The toxoplasmosis cyst, we've noticed when we have patients with high toxoplasmosis antibodies, they always have the smaller cyst in the blood smears, and much smaller cysts. Some of our patients will have 2 or 3 different sizes of protozoa within their blood smears and also within their brain. So we use parasite kill and herbals like Cryptolepis to remove parasites, whether they were liver flukes, etc., or they were protozoa. We used 2 different antibiotics to clear out these guys, and a very aggressive phospholipotherapy with aggressive detox, brain chemistry, hormones, etc., all those things, to get a brain that's functioning very well. Yet, when this woman who felt wonderful and said her brain worked as well as it ever had repeated the PET scan, we saw this medial frontal lobe stuff, and I'm sitting there for 2 hours thinking, well, we treated this, we treated that, we treated everything. And we got this tremendous improvement in brain activity in all these different regions. And we actually had several engineers, because the improvement looks too great, do the calculations. It's simply a fraction of the improvement of where you start, where you are. Now, one thing we do sedate patients with like oral medication in our attempt to get them to a ground zero, because they come in with cytoneurotoxicity. And it depends how overactive they are. I made a grave mistake on Gracie, who's read a great video testimonial where she couldn't move her legs and couldn't talk. And I allowed her to get a PET scan a couple of years ago before I saw her. And then I saw her the next day, and she was having seizure-like activity or just tremors. And she was had so much cytoneurotoxicity that she was a -7, a negative, because hypo is a negative. She was 7 standard deviations overactive in some brain regions. So one thing I learned, and I've discussed with the neuroradiologist, is when an electrical organ like the brain is over-electrified, you will burn more glucose, and then the radiologist will read my callers a normal PET scan. So our goal is just to get the patient to electroneutral. It's somewhat of a guess, and so forth. One of the things that's fascinating then, so I'm sitting there 2 hours on a Friday night with this woman. I said, you know what? The only thing we haven't gone after are mold spores. And I will admit, I like to critique myself. I spent so much energy from 2007-8 trying to educate doctors and patients, trying to move their brain from mold spores, the allergic reaction, runny nose, sinusitis, bronchitis, to the toxins, the more deleterious, lipophilic, fatty, and molecular structure gases or gaseous metabolites produced by indoor molds, that I had a difficult time wrapping my brain around the fact that the spores would cross the alveoli or alveolar capillary membrane. Yet I had several women who chose to remove their breast implants prior to coming here, and those who were in a very moldy house, not a house with hidden mold, a home where the ERMI test is negative. The ERMI test is worthless if it's negative. If it's positive, it's helpful in showing, in validating that you have mold spores floating through the room, in the vents, etc. Anyone should be able to diagnose mold in a room. It's the hidden mold that the majority of mold inspectors will miss. But the gases will outgas from under a windowsill where there's water leaking down through the windows, caulking, or behind the shower tile, etc., in the walls. At any rate, I knew, based on certain markers, one of the indirect markers we use is oxalic acid. If you have imbibed a lot of mold spores from a moldy school, moldy dormitories, etc., or your own home, then you will have higher oxalic acids, a very strong toxin that is a metabolite of mold spores, etc. It's very high in most autistic kids. In fact, we just sent an autistic kid back to Australia who had one of the highest levels, and we had a young 10-year-old whose vision went from 20/20 to 23/50 in 1 year in a house in Alabama. Reversed their vision in 2020. That's Taylor Neighbors. Go to my YouTube channel and look up 10-year-old Taylor Neighbors. Oxalic acid is electrifying. In the 1 year, she became schizophrenic. Emory, pediatric ophthalmologist, told the mother, take the kid home and love her. Nothing we can do for her vision. She's legally blind. The psychiatrist said, take her home and love her, or put her in a home for schizophrenic children. And she developed severe tinnitus that moved from ringing in the ears to screeching in the ears as she became more paranoid. It's all about the excessive electrical voltage caused by the oxalic acid, etc. But it works on the limbs where the gases, the trichothecenes, ochratoxins, gliotoxins, tend to affect the retina more. In fact, I had 2 retinal attachments in a very hideous office where there was hidden black mold. It took me 4 years to find the black mold behind a wall that was 70 feet long. But at any rate, I thought the only thing we haven't gone after, we went after bacterial infections and been successful. We've gone after, except for this, I think there's still some leftover bacterial infection right in that area. It turns out, I said, we haven't gone after mold spores, and potentially they're crossing the blood-brain barrier. The patients remain the best teachers, but you have to know the science. And every therapeutic maneuver in a center like ours, where we have either ER or ICU nurses evaluating patients before and after, and I have a Harvard-trained emergency room physician working with me. I did critical care medicine for years, so we run a critical care unit here during the daytime. We often treat seizures, etc. It's a very intensive program. We have a lot of sick patients. On some given days, we treat as many as 8 seizures. Patients have had seizures for years. But we actually decide, well, I tell my staff every therapeutic maneuver is a diagnostic maneuver if you pay attention. So I told this young lady, well, 40-some-year-old lady, I said, look, come back Monday, we are going to use a drug called amphotericin. Amphotericin is an antifungal antibody that we normally use in hospitals. And I had to think back to what I use it for in the ICU or various places, and it's aspergillus pneumonias, etc. So at any rate, we use the amphotericin. I had used it before on some Australian patients because they had very high titers of certain biomarkers, and they would react heavily when you do kill the mold spores living within the body. We have seen them on breast implants. Plastic surgeons take out the breast implants. That soft plastic is very adhesive. And I tell women, if they have markers that are above a certain level and or the history, that they should have the breast implants taken out. When they do, they always feel even better. And they often would describe, the plastic surgeons would describe a thick biofilm on the breast implants. Now this will not be occurring if you're in a building where you are imbibing the gases, the toxic gases, and not the spores. But if you are imbibing the spores, then they are crossing the capillary alveolar membrane. And because of that, I thought, well, geez, we'll try the amphotericin. The bottom line is, we did the amphotericin. I told the young lady, your job on Monday is to pay strict attention to the medial frontal lobe. This is where the impulse control and judgment occur versus processing, learning, memory out of lateral prefrontal cortex. And she had a tremendous reaction, pain, pressure, etc., but developed a frontal lobe epiphany later in the day. And we've since then treated quite a few patients. In fact, I've gone beyond my old thinking. I would have told you 6 months ago, as every other physician in America, Australia, Europe will, still tell you that amphotericin is severely nephrotoxic. One morning driving in a few months ago, I decided to do a little study. We do studies all the time. I said, let's measure the glomerular filtration rate right before and right after amphotericin, and we would see it drop 30 or 40 points acutely if we're killing Aspergillus mold spores. But once the patient has had 3 infusions, or maybe 5, or it depends on the number, they no longer react. The assumption is that we've destroyed most of the mold spores in the body, and it will destroy candida as well. You can kill more candida in one infusion than you can with 6 months of other herbals, and we actually have a very strong herbal called Gut Cleanse that I've designed. It's multiple herbals, all natural. It's very effective for candida and for killing SIBO, small intestinal bacterial overgrowth. But the amphotericin IV is much stronger. At any rate, we have determined, I'll be writing this up very soon, that this antibiotic that the entire world thinks is nephrotoxic, kidney toxic, it's actually the release of the ochre toxin, the gas metabolite produced by Aspergillus and penicillin molds, that became famous first for kidney failure and even kidney cancer. So I'm just always thinking about weird things. I'm driving home or driving to the office. And so we've done that study now on probably 20 or 30 people, and we have found that the GFR doesn't drop at all, kidney filtration rate doesn't drop at all before and after an infusion once we have adequately destroyed the spores in the body, brain and body. So there's always something to learn, and patients always teach. So we've seen now a propensity for mold spores to gather in the medial frontal lobe. We've got about 15 or 20 folks, and one of them is a young lady named Julia, who is actually one here tonight. I'm going to take some questions from her in a little bit. Came to us in a wheelchair, circa 1920, high school in Miami. She's got a video testimonial on my YouTube channel. We had her out of a wheelchair in 4 weeks. I told my staff, when we go after mold spores in her body, we'll put her back in the wheelchair temporarily, which we did. A tremendous release of mycotoxins when you destroy those mold spores. And I feel somewhat bad. I mean, I'm still ahead of the majority of the world, or maybe the entire world on this, but I feel that I'm remiss in not being more sensitive to the fact that a lot of patients are going to continue to grow these mold spores in their body. And even when you get an immune system, the kill power ramped up to what God intended, and they bust right through their biofilm, they will not kill mold spores on their own. So there's always something to learn. In this particular case, it's made us much more aggressive in certain people in going after the mold spores. That's not something you should do in a general practitioner's office. Again, we have all intensive care ER nurses. We run this place more like an ICU than a hospital, and all the patients who are here will tell you that, especially the nurses. We have 2 nurses here right now from Canada. Now, it's fascinating. We had this patient's fatty acid oxidation down on the line, down to 0. That we need to actually make a slide on that. We threw these slides together rather rapidly for ILADS. But right after we did the amphotericin, the first dose, and we were destroying mold spores throughout this woman's body, but going after particularly the ones in the frontal lobe, she went sky high again. This is about as high as you'll see. When females have this much fatty acid oxidation, they'll often have burning pain in their feet and legs, the neuropathy, which we reverse it in a lot of people, and a lot of patients in 3 or 4 weeks. It would have taken us 3 months in 2013. We couldn't do it all in 2010, 11, or 12. But now we reverse it in 3 weeks usually. But we actually, but by killing and busting so many mold spores in this particular patient, the mycotoxins are in the cell wall of the spores, just as the endotoxins, the LPS toxins, lipopolysaccharide toxins, are in the cell wall of bacteria. So we started sky high again, and after 1 amphotericin infusion, and then we again used aggressive phospholipid to reverse that and get her back down to here. We weren't quite done, but it's fascinating. But if anything, this is the most incredible proof of how the mycotoxins, whether it be trichothecene, ochre toxin, aflatoxin, gliotoxin, the lipophilic, again, fatty and molecular structure toxins created by certain molds will, once they hit the bloodstream, migrate to and deposit in the fattiest tissue, of which the myelin sheath, the insulation of the nerves, is the fattiest, 80% fatty content. I surmised and hypothesized in 2009 that the mycotoxins were causing MS based on the fact that, in biochemistry we know that a fatty toxin will move in to a fatty acid chain and displace an omega-3 or a 6 or a CLA, a medium chain fatty acid, etc. And that's how they end up inflaming the myelin sheath and causing MS. I was mocked and laughed at by neurologists throughout the country, and particularly in Tampa Bay, but vindicated years later by Japanese scientists who have proven that the mycotoxins do cause multiple sclerosis, along with lots of other things we'll talk about tonight. So Channing is a patient here. She's actually helping me tonight. She had 16 years of light sensitivity. There were years when she wouldn't go outside. She wore sunglasses for 16 years. I will show you where the visual area of her brain is affected with infection. She had a subclinical pancreatitis, something undiagnosed in a lot of young ladies. We have 83% females for some reason. There are 5 females here in their 20s who've had pancreatitis for years. Subclinical simply means it's not diagnosed. There are 5 females here who actually have suboptimal pancreatic enzymes. My Harvard-trained ER doctor, Dr. Hellman's a brilliant doctor, but I said to him, you were never taught to look at low enzymes. We were taught to look for elevated enzymes. That's acute pancreatitis. But we have young kids who have been in severe black mold-infested homes or schools or both, and they actually have a burnout pancreas, and their lipase and amylase will be on the low side. We've had 7 have no lipase production. And actually, when we mobilize these fatty toxins from the pancreas and pancreatic cell membranes and pancreatic mitochondria, we sometimes can get them back. And we're actually seeing a pattern where these patients develop an insulin-dependent diabetes, not insulin resistance, and we're actually able to reduce the insulin consumption on the pumps about 50%, never got 100% in some of those patients. So the trichothecene is one of the worst for that, by the way, that I've seen. But the petrochemicals, the benzene derivatives, methylethylbenzenes, xylene, styrene, etc., they all hit the pancreas very hard too. Resting tremors come from the basal ganglia. Again, 3 motor regions within the basal ganglia. The Parkinson's region called the substantia nigra. The caudate nucleus, which nobody's talking about, and the lentiform nucleus. Intentional tremors come from the cerebellum. So let's see what Channing had on her initial PET scan. We see on an initial PET scan, we see first of all, you notice the cerebellum, the light blue being underactive. It's a classic trichothecene pattern. This posterior view is looking at the back of the brain. You get a great look at the back of the cerebellum. There's 2 cerebellar tonsils, left and right, and it's a pattern we'll show you throughout the night. I have espoused since 2000 what scientists have espoused, that these lipophilic toxins shut down the frontal lobe first. That is true, with the exception of trichothecene. We're the first place in the world to prove that trichothecene, let me rephrase it, that the cerebellar Purkinje cells, etc., are more sensitive to tricho than even the frontal lobe. And now Japanese studies have proven that trichothecene and ochratoxin shut down tyrosine hydroxylase, which converts tyrosine to dopamine, or L-dopa to the dopamine. And ochratoxin and trichothecene destroy dopamine factories in the 4-second processing memory and in the substantia nigra Parkinson's region, and really throughout the cortex. There's reduced striatal dopamine throughout the brains of patients who have severe trichothecene toxicity and or ochratoxin toxicity. Again, the ochratoxin is a gaseous metabolite that comes out of the mustier swelling molds. They both cause Alzheimer's. They both cause Parkinsonian symptoms. They both cause, pretty much every cell in the brain is destroyed by the mycotoxins. Now, notice so we have a lot of 4-second memory issues, inability to process, and we see infection. We see some perfectly round protomyxella within these regions, but this is a classic pattern seen on MRI worldwide for Lyme spirochetes. Lyme spirochetes have a propensity for the cerebellum, for the motor strip, which we'll show you examples of later tonight. And this is not based on our research. It is validated by our research for PET scans, but it's based on, again, MRI research worldwide, where they can't measure functionality, but they can show you the morphology of the shape of the lesions. The Lyme spirochetes love the caudate nuclei, which I'll explain again more about that in a moment. We'll show you some good examples. In the visual area, and what's fascinating is we've seen a pattern here where the folks like Channing who come in and they wear their sunglasses forever with the light sensitivity. Now, the light sensitivity, the first thing I do is do a sitting MRI to rule out a Chiari malformation. Now, a lot of our patients have a Chiari malformation, and that's where the brain drops a little bit, and there's increased intracranial pressure and pupillary dilatation. So look at the pupils. Those of you doctors on the phone, there's quite a few of you I met at the meeting. Look at the pupils. If they're dilated, you should do a sitting MRI. You want a sitting MRI for the gravitational effect. You rule out a Chiari malformation, then the increased intracranial pressure can be caused by infection. And the light sensitivity, again, is just some pupillary dilatation, but it can be from infection in the visual area. And we'll show you tonight several patients. Again, this talk was prepared for about a 45-minute talk, which doesn't allow you to teach what you want. That's why 30 doctors follow me outside the meeting and talk for 3 more hours. But usually happens. But at any rate, a lot of infection in the visual area of the brain. Okay, we see infection in the right cerebellar. We see this irregular lesions. We don't see a uniform diffuse pattern in the cerebellum like you'll see if it's just trichothecene only. We can show you that. And we've diagnosed Channing with, of course, Lyme disease, but she's had Bartonella, and all my patients have babesiosis, and all of them have Bartonella. We see way more Bartonella brain issues. In the top rash in our clinic is a Bartonella rash. When our patients, when their immune system activates, which usually takes about a week, if that, all natural, they begin to bust biofilm. And when that happens, you often see a Bart rash. You often see Bartonella show up on blood smears. Did not reveal itself on initial blood smears. And again, in my ignorance, and one of the kids that trained here a couple of years ago, followed me around for 2 summers, will make comments about antibiotics. Because when he was here, I would say, we should use antibiotics. Look, you're a fool if you don't use antibiotics. When Bartonella and Lyme spirochetes, and Q fever and rabbit fever and Rocky Mountain, we see many of our patients have 8 and 10 infections. Dr. Fry, again, told a group of physicians standing outside the conference room that our patients are the most infected in the country, in Canada or America. We have multiple infections. It's not uncommon once the biofilm begins to break open, if you're actually doing diagnostic maneuvers at the right time to see a young kid or an older person come in, and they may demonstrate one infection on an infection panel. They may end up having 8 to 10 different infections. Those of you in the Northeast, it's very common to see tularemia, rabbit fever, and Q fever. You don't need a rabbit, just like you don't need a cat to have Bartonella. You don't need a cat to get toxoplasmosis. So, at any rate, we have worked diligently. Channing rode horses a lot as a kid. Her father would tell you she was always in a house that had black mold issues, and they now have ascertained, her parents and grandparents, that she was in a black mold house. Even in the womb, she was toxic. And one of the things that I've been able to ascertain is just correlations, is the idiopathic jaundice we see in so many kids. When you understand that trichothecene is quite a bit more liver toxic than alcohol, and you understand that it causes idiopathic jaundice. If a mother is jaundiced, the liver doesn't mature in detox capability until age 13. The fetal liver detoxes nothing. So when trichothecene, extremely liver toxic, crosses the placenta, a fetal liver will not handle it. They'll come out with the bilirubin elevated and jaundice. And that once the cord is cut, the liver begins to detox, and it's been 4 days, 10 days, whatever, in the neonatal. I've had kids that have been in the NICU for 40 days with jaundice. Those are the most severe cases, and it always correlates with the trichothecene. So anyway, we're not finished with Shannon at this point, but we see a lot of decreased infection. See a lot of improvement in the visual area. The sunglasses have been off now for quite a while. Compare this deep infection in here in the visual area to this infection. We're not done, but we've got a lot of improvement. A lot of improvement in this particular area compared to here. And actually, since we like numbers, let's look at numbers. For the visual area, is at 67% improvement in the right and 62 in the left. It's actually some of the least improvement, and the most difficult thing we've had with her and many patients is getting the sunglasses off. We've got a lot of kids that have been wearing sunglasses for 5 and 10 years. The sensory motor strips, she improved tremendously. Shannon's one of those young 20-year-olds that came here and couldn't drive a car. These people, it's amazing how sick some of the young kids are here. It depends how infected they are. Medial frontal lobe, great improvement. And cerebellum, again, intentional tremors. The left cerebellum, let's look at initially, we had pretty much equal downregulation of electrical activity in the cerebellum. Again, we're trying to get these people, when they first come in with excito-neurotoxicity, the glutamate gamma ratio is off kilter. We're trying to get them down to just electrode neutral. We have to guess. We try to use a medication like Klonopin or whatever, just enough to get them to electrode neutral. Otherwise, you get all these negatives, and you cannot see the shape or morphology of the lesions. If you can't see the shape of the lesions, you can't determine if it's protomyxoid infection or Lyme infection, etc. Young kids that was here as an intern, and now made a comment recently, insinuating that we're over-medicating people to get better results. We're trying to get people down to, you can see we're not even down to ground zero. We're still a negative, hypos and negative. We're trying to get the patient to electroneutral. I saw Kurt was on the phone. Kurt came here in 2013, and he was so over-electrified he wore sunglasses. He had to wear a cap to hide the sun from his eyes, and he actually, on his before and after PET scan, he was a negative everywhere because we had not yet learned our lesson. We're not that smart. We learned the hard way. That we have to medicate people down to ground zero. The goal is to be at a zero level. These are standard deviations. You're either each standard deviation you're like 33% overactive or underactive compared to men or women your age. So, and actually the cerebellum proved with SPECT scans, the first functional scans used that were much cheaper, at least initially, the cerebellum should be 35% more active than the rest of the brain. You'll notice on our patients the cerebellum is always more underactive than the majority of the rest of the brain regions, and that's a trichothecene effect. At any rate, we've had tremendous improvement in her, and her parents actually cannot believe how much improvement we've had, but it's not been easy. Back to the sensory motor strip. Let me just show you some numbers. One of my theories going back 3 years ago, what started with Kamea to 2013, is that the toxins are going to shut down the brain regions left and right equally. They're going to go equally. But I theorized that the infection would cause asymmetry, and that was based on having years of experience treating patients, whether it be in the OR and seeing bacteria seed in one spot or the other, even a heart valve. Why do we see bacteria seed one of the 4 heart valves, not all 4? And my patients have proven through PET scan imaging that to be the case. When you have equal downregulation or shutdown of brain activity, we will assume that it is toxins. It can be an infection in toxins, but when you have asymmetry, where a left or right side is way more underactive than the other, it's infection or proven otherwise. And it's panned out in every patient. We can show you examples of that. In fact, here's a great example of where the sensory motor region is now asymmetrical. It's not the best one, but the left sensory motor region is more active. A negative is a positive than the right. So the right side has some infection. Well, let's see if we can find it. You see the right sensory motor strip comes down through there. We see a little bit of a problem. I've got better examples we'll move to. But trichothecene pattern, typical Bartonella, Lyme pattern, or protomyxoa. I'll move along just to speed up so we can take some questions. We've got a lot of scans to show you. This is actually one of Channing's scans. We have on our biofilm page lots of patients you can look at and look at the biofilm. Carol, who's on the page, came in 2012, had 6 years of IV Recephin, and still had all this disaster. This is one of Channing's slides. There's one tiny little dot of Bartonella. There's just hundreds of Bartonella in there. That's an example of a protomyxoa. This is 1,000 power on a microscope. And notice it takes us a month at this point. This is without doing vitamin C or peroxide drips, which in 2009, 10, 11, 12, even 13 we used. We've gotten so good at getting the immune system working, and I use myself as a guinea pig to advance the phospholipid therapy to see what does it take to reach a ground zero. It takes a lot more than the single doses of phosphatidylcholine alpha-lipoic acid used in Germany, where the initial treatment started, where they were reversing liver cirrhosis and fatty liver years ago, which we do all the time now. We've advanced much farther than that, but to do so, you have to use megadoses of glutathione. You have to be ready to rescue, to grab. If you cannot use enough glutathione to conjugate all the toxins that are mobilized from mitochondria throughout all the muscle cells, heart cells, liver cells, etc., and the lipophilic toxins that are mobilized to the bloodstream from the fatty tissue, then you will do more harm than good. So it's not for amateurs, and it's a guess. It's an estimate against an art. One of the doctors that followed me out of the lecture room last Saturday, Dr. Lance up in Boston, was a referred patient. She's a brilliant Lyme doctor, an integrated doctor. But she said to one of the folks in my team that, geez, I didn't know it. I was talking to the doctors. Obviously, it's an art, and it comes from experience. But we use a lot of parameters to measure. But you have to know, you can't just flippantly start mobilizing these toxins. And it depends on the patient. Some aren't that bad. There's a little Bartonella, just for example, but just a disaster. It wasn't until 2012 that I was able to prove, the first doctor in the world to prove that the toxins are sequestered in the biofilm. And it was on Carol from Jersey again, who's on the biofilm page, that we were able to prove by busting this type of a biofilm formation with C peroxide combo that the trichothecenes, ochratoxins, petrotoxins, pesticides, all those toxins are wrapped up in biofilm. Now, Alan McDonald, who recently gave me some kudos on email, who's a brilliant pathologist from New Haven, one of the first to prove the bugs are spinning the biofilm, of course mocked and laughed at like I have been many times. He has recently, he told me in an email that, good Lord, he's now proving. He was too smart to retire, I knew that. So he's back at it, proving that the ticks are carrying worms. So some of the worms, if you will, we see in biofilm may be carried by ticks. We don't see any in this particular stain. But lots of protomyxoa. There's one example of a larger one, a smaller one, trapped in this super glue. Lots of Bartonella. And you'll see all kinds of various things in this. And over here you're seeing the red blood cells. No sign of Bartonella. No sign of protomyxoa, etc. That does not mean that this patient won't have biofilm formation, that they will, as they continue to attack biofilm with their, and the way that you get rid of this is with antibodies and killer cells that actually work. Killer cells and antibodies, macrophages, of which the functionality is not suppressed, downregulated by mitochondrial dysfunction, et cetera, et cetera. So one of the patterns we've noticed, and again, we cannot stick a needle in the brain and biopsy the brain. We could. I've done thousands of spinal taps. I could do more spinal and fluid analysis. We're not going to go there at this time. But we may. I may be doing some stem cell injection in the spinal fluid soon for some of my MS patients. I'm working with some physicians. I've been invited to work with some physicians from the University of Miami now for a couple of years on that. And so I won't get into it, but umbilical stem cells are the way to go to heal neurological diseases. You can use intrathecal if you and get better results per se, but you don't have to anyway. But the point I would make is that antibiotics barely get through the 4-layer wall that the microbiologists discuss. For those of you who want to learn more about biofilm, the Montana State University Biofilm Center for Engineering is probably one of the best. They've added a lot of information to their page. The World Health Organization, which used to follow the CDC, they've gotten too smart for that. They're talking about biofilm. One of the 400 studies I read just last April, we have sitting in front of us here, they said, oh my gosh, good heavens, all this antibiotic resistance we've worried about for the last 15 years is caused by biofilm. And now the biofilm experts, the microbiologists, are talking about biofilm as a cause of otitis media. So the inner ear canal, it's everywhere. It's in the gut, it's in the brain, it's in the mouth, etc. But we look at the bloodstream. Just because we remove the biofilm from the bloodstream, which most places cannot, the majority of our Lyme patients now are chronic Lyme patients who have already been to multiple Lyme doctors. They come in with massive biofilm. We used to feel really good about this. I still do, moving this patient from here to here. And Dr. Fry would tell you that nobody else that uses his lab can do that. But it doesn't mean that you've gotten rid of all the Bartonella. And I'm not sure we ever eradicate Bartonella or Lyme spirochetes, and certainly smaller bacteria like mycoplasma, from all the cells in the body. But if you can at least eradicate the biofilm and kill all the organisms within the biofilm, then you don't have a chance. And what happens is, we have at any given time 20%. 1 out of 5 patients here are Canadians, and it's becoming almost 1 out of 10 now are Europeans. We recently sent a girl back to England who the top Lyme clinic in Germany turned her down. And of course, the first day she was here, she began to have seizures in my workshop before she was even technically a patient. But she wore me out all summer, but it was worth it. But the point is that antibiotics will kill what's outside the biofilm, and all they do is they will seep through the 4-layer wall just enough to agitate the bacteria and make them spin more biofilm and make them somewhat resistant. Now, the microbiologists who worldwide who specialize in biofilm will tell you that all the organisms within the biofilm have become polymorphic organisms. That the bacteria, the Bartonella, the Lyme spirochetes, the Rocky Mountain, all these rickettsias, etc., that they're all stealing single RNA strands from retroviruses, and they're all in there mutated, and they've developed organisms that antibiotics will not kill. Well, that's true, and it's not true. If that were absolute truth, we would not be able to use antibiotics to eradicate the Bartonella and spirochetes, etc., that are busted out of biofilm formations in the bloodstream, hit the brain, and will suddenly cause a Parkinsonian tremor by hitting the caudate nucleus, or cause a seizure, or cause a foot drop by hitting the motor strip. So if you come to our clinic, and you folks who are thinking about coming, just come for a day pass. You'll find all of our patients will talk to you and tell their stories. I would advise you to spend 2 days, and you'll see us stop really ugly-looking seizures and treated paralysis, a foot drop in 10 minutes, unless we're having a significant problem, we'll eradicate the foot drop. If these organisms were absolutely resistant to antibiotics, as the microbiologists suggest at this point, the problem with microbiologists are they're in a rat lab. I have humans, and so I know the difference. I would suggest to you that you cannot kill these organisms with antibiotics. unless you have an immune system that actually works the way God intended. So we do treat patients every day who, as they're working through the layers of biofilm, and if you think about it, as I did driving home several years ago, a couple of bugs will spin the biofilm formations from inside out, and they keep spinning. So, but you're attacking from outside in, and you got to think three-dimensional. So it's like tree rings. You go back in time as you work your way to the inner core of biofilm. And we see this all the time. We have a patient who's been treated for 40 years by Lyme doctors intermittently before he got to us. And his first tick bite was age 6, and he's like 50 years old. And it wasn't until we got back into his teenage years, suddenly he started popping high pesticide levels out of the biofilm. And he and his wife immediately told me, oh yeah, from age 10 to age 16, I was in charge of spraying the apple orchards. There's always a story, it's a different story, different toxins and different histories, but it's a fascinating deal. It will be for my books. So at any rate, the biofilm determines how long you're going to be here. We have no difficulty getting rid of it, but every time you think you're clear, the patient will surprise you with more. So you're done when you're done, and it's difficult. Let's talk about, again, another example of global shutdown of the brain. Dennis' video just went up. Unfortunately, people who did it have him sitting around talking in our VIP room, the video room. They don't show him, they don't show till later that he couldn't lift a spoon. His wife had to feed him with a spoon. He's now slalom skiing. He was curling 50 pounds when he was in my clinic. Dennis is a brilliant gentleman who works for BP. I've treated so many of his friends down in southern Louisiana. The BP spill was a disaster. The methylbenzene levels walking in the door of 42,000, notice 7,000. Put you in the worst 5% of people tested. And realize that this test is not done on healthy people, so you're in the worst 5% of sick people. The styrene was sky high. We don't have it here. We have it in our workshop. If you come for our workshop, you'll see that his benzene levels were negligible. Methylbenzenes, etc. So again, scientists just this past year figured out they've been measuring the wrong chemicals for years. That's why they've had these lower levels of benzene in the air around gas wells, etc. And so I don't blame the feds as much as I used to for the BP deal. It's a lack of knowledge. The scientists are constantly learning as well. It turns out it takes benzene seconds once it hits the air to grab a methyl group. A carbon and 3 hydrogens is a methyl group. So methylbenzene, ethylbenzene, there's dimethylbenzene again. So this is hot off the press news within the environmental toxicity community. But 42,000, this will give you a global underactive brain, and you'll notice if you can, again, with your brain, and your visual area in your brain, remove the infection, this localized yellow, 4-second memory was totally shut down. Notice perfectly round protomyxoa and irregular areas both. And we go with serology and correlate with Lyme spirochetes and Bartonella, etc. Notice if you can remove the yellow, which is more underactive than light blue, and lighter light blue is more underactive than a lighter light blue and more than a black. You want to see the black. Now, this is just 3 weeks of treatment. All we did. My attempt is to mobilize the fatty toxins from the brain tissue, and then one can see more clearly what you're infected with. But if you'll notice, removing the yellow, which is infection in addition to toxin-induced downregulation or shutdown of electrical activity and glucose metabolism, that the entire frontal lobe is more light blue than the rest of the brain, and even the cerebellum. Now, trichothecene was a factor, but the cerebellum down here, back, look at the back, are less underactive than the frontal lobe. And one of the things that my PETS research has proven, it's the first in the world, is that the petroleum toxins that are in everything that's not God-made, everything man-made is made with petroleum toxins. Everything you're looking at in your home right now, if it wasn't a rock or a log, it's made with petrochemicals. Even the medications, when Rockefeller got control of 90% of the petroleum in the world, he started giving money to medical centers. And that was the initiative to move from natural medicine to petro-based medications. But don't be an idiot. Naturopaths, I've written books for naturopaths, chapters. Look, they can be idiots, like MDs on the other side. My naturopathic friends say MD stands for mentally disabled. And the MDs say the naturopaths are mentally disabled. Look, it's like politics. Integrated medicine integrates the best of both. You need to use medicine sometimes, but we use them the least we can. And only don't use antibiotics when someone's got a brain infection. You don't know until you look. And I was remiss in refusing to use antibiotics in 9, 10, and 11 on patients that were busting biofilm, or we were intensely busting their biofilm, because they had bugs that were swimming their way from biofilm formations to the brain. You don't know that why until you actually treat the most severe neurological cases in the world. And so this frontal lobe is terribly infected, but this light blue, this is the beginning of the prefrontal cortex, and it is way more sensitive, a lighter light blue diffusely than the rest of the brain. If he was just trichothecene toxic without the petrochemicals, you'd see the cerebellar downregulation. We'll show you pictures of that in a moment. So I'm very proud of the fact that in 3 weeks of treatment, we were able to move this brain to this brain. And I told Dennis's wife the first day I met him, when he couldn't grab the words, a genius. He's a very competent businessman. He works actually for BP Shell, and he was stuttering the first time I met him. So weak, you'll see in his video testimony, just go to look at my YouTube channel, Dr. Rick Sponaugle, look at Dennis. He could not lift a spoon at one time laying in bed. I'll put him up against any of you guys out there on the football field right now. He's 51 years old. But the inability to grab words, folks, everything starts with a 4-second processing memory. The lateral, see lateral, right lateral, left lateral. Lateral, dorsolateral, we call it prefrontal cortex. It runs on dopamine. It turns out, actually there's one Japanese PET scan study that proves that Lyme spirochetes love to congregate in the prefrontal cortex. That's a bottom-up view. The medial, right medial, left medial, you can see more. Sometimes one has to differentiate trauma, which affects the lateral, not the medial. And you'll see that this possibly trauma, this has played a lot of athletics. This underactive area, we don't see infection hit the parietal lobes that much. If it's real smooth, it's going to be trauma. But when it's irregular, like this, you see the round podiumexoa and irregular areas like we saw with the MRI studies worldwide. I went through 12,000 in a 3-month period. Weekends and nights didn't stop, determined to plow through them. Unfortunately, again, there was one Bartonella study from Germany. When they measured Bartonella antibodies in spinal fluid, it wiped out the entire left temporal lobe in a patient. Otherwise, they were all Lyme spirochetal antibody studies. So, moving the toxins out of the brain, decreasing the fatty acid oxidation, which I think we have a picture of here somewhere. Let's see. Yeah. Reducing mitochondrial dysfunction. Now, when Great Plains brought this test out, a 1.9 on this numerical biomarker, triglycine, puts you in the worst 5%. Do we have another one? No, we don't show it. No. After 12 weeks of my patients entering the database, this moved to 8. It required an 8 to be the worst 5%, and it went to, now it's at 11. So, at the request of one of my nurses, Gary, he said, Doc, you know it's our patients that shifted the entire bell-shaped curve on mitochondrial dysfunction nationwide. Great Plains is actually in Canada as well. And so I called Dr. Shaw for the first time, who runs this company. And he had another scientist in the room when speaking to them, and I said, hey, first question, was it my patients that shifted the bell-shaped curve? And they started laughing. They said, where the hell do you find these people? When Dennis was here for an 8, we had his friend who came later, was an 9.5. We had a young girl from England who lost her soccer career because of a probably 200-year-old high school. It was all tricho in her case for the most part. She was from Manchester. There was some petrochemicals. She was a 15. They never seen those kind of mitochondrial dysfunction. I told Dr. Shaw, I said, I'm not trying to be a smart ass, excuse my French, but, there's a lot of things that can cause mitochondrial dysfunction. But if I am focused, we do many things. We do nutritional, obviously we do intravenous nutritional, correction of nutritional deficiency. We obviously do a lot of things, but regarding infections, we weren't trying to kill anything. In fact, Dennis didn't go into a spontaneous kill in a week. He did not for 3 weeks because his CD4 T cell count was 50. It wasn't HIV. My research, I began to prove in 2009 that trichothecene will shut down the CD4-CD8 ratio far below an HIV level of 1.5. And when we get you down to 0.14, your mitochondria are kicking butt. Okay, that's where you want to be. So when you do that, again, the brain cells have the most mitochondria per cell. And that includes the retina. Again, you folks that have developed night vision issues, it's your retina. The contrast is your retina. And again, it's fatty acid oxidation, and it's mitochondrial dysfunction. Let me see if we got fatty acid. Do we have fatty acid on him? No, we probably don't have this. We didn't do complete case studies because we knew we couldn't show as many scans. But if you come to the workshop, you'll see bigger case studies. But you see the difference again. Major improvement. I want to show you something that I think is a great telltale for infection. So when I meet Dennis, again, cardiac nuclei, there's left and right. He's down 1.5, almost identical downregulation of activity in both left and right cardiac nuclei. Again, I asked Dr. Fabian, the neuroradiologist, why and who chose nationwide, worldwide, to look at caudate function versus substantia nigra function. It unfortunately requires a DAT scan to look at the substantia nigra dopamine activity. But all these motor regions, the three of them, caudate nuclei, lymphiform nucleus or nuclei, and substantia nigra, run on dopamine. But he's down evenly. So I actually thought, well, geez, maybe it's just the toxins. Notice, though, when we're simply pushing the toxins out of the brain very aggressively, it would have taken us in 2013 or even 14 3 or 4 months to do what we did in 3 weeks. Okay. Notice he comes up 90% improvement in the left caudate nucleus, but the right one came up 50%. The right caudate had infection. Let's go back and look. Isn't it fun? Once you learn to use, it's like any test. Until you've got enough data in your database, you really don't get much out of it. So the caudate nucleus will show right here. It's medial, right medial, left medial. Notice that round deal there. Louisiana, I joke. I love my Louisiana patients. And actually, Dennis ended up bringing, one woman had 22 MRIs, it was, I think, laying in bed to die. Another woman was 22,000. We'll show you her PET and her visual infection. She's now 2020. But look, we get some of the sickest patients from southern Louisiana. This area is about an hour south of New Orleans. They were hardest hit, one of the epicenters of the BP spill, but there's also lots of chemical factories down that way. I spoke down there in July. But look at the caudate nucleus. The right is still underactive. You don't see any. Look at the left, black. If you want to use the colors, that's what radiologists use again. I like the numbers. It's black. There's no underactivity. But look at the right. All that underactivity. See the difference, guys? Right caudate nucleus, left. So see, we have to kill the infection in there to get the right caudate nuclear activity. So when the right caudate is way more underactive, we're back here, than the left, you'll see a resting tremor. It's a Parkinsonian tremor. When they're both down, you can see resting tremors on both sides. Why every neurologist in America, Canada, Europe, they're focused on only one of those three motor regions, the substantia nigra, I do not know. Cerebellar activity, 97% increased brain activity, 87% medial frontal. Didn't do so well. Why? Infection, look, medial frontal, see? So it's still there. We weren't going after infection the first 3 weeks. So this should help you guys see how powerful these are. but only after you learn what the hell is going on. Kurt, you're on there. I see when we did your PET scan, you were so overactive. Your PET scan looked perfect. The radiologist read it as normal. They knew no better, but you had all kinds of infection. So when Kurt's before and after PET scan, you should go on our page. We actually have decreased activity, decreased metabolism, or increased because negatives because he was so over-electrified in particularly in the visual area. So this is a great example of infection, a great example of medial frontal. You don't get the improvement. Now look, great improvement, of course. Terrible shutdown in the medial frontal. This is judgment, impulse control, versus processing, learning, memory in the lateral on the outside, okay? So we have great improvement, but we don't get what we get in other areas because he didn't have a lot of infection in the cerebellum. There's a little infection in there, these isolated local areas. So the major infection up in the frontal lobe, lateral, 4-second processing memory, and medial frontal. So let's, just a great example, but again, removing the yellow infected areas, that's infection, protozoa, Lyme, Bartonella, in addition to the toxin shutdown, and so it's more underactive, indicated by yellow. But again, notice the prefrontal cortex in general, because of major petrotoxicity, is shut down more than the rest of the brain. And here it's shut down more. Notice the black in between. We push the toxins out of the tissue, mobilize them to the bloodstream, pull around the body. There's a lot of infection that you can more easily see. Let's move on to another example. Chris came here. Mitochondrial shutdown. When your mitochondria is shut down, you can't burn calories. It's 100 pounds different. Chris is another young man who couldn't drive a car, and he had trichothecene levels that were good God 10s, 20s. He hit a 50 on one day. He was diagnosed. He had, I forget how many Lyme doctors, one at Columbia, I think, multiple Lyme doctors in the Northeast. He was diagnosed with babesiosis, Bartonella, chronic Lyme, treated 2 years prior to us, and then we diagnosed him with severe trichothecene toxicity and, of course, mitochondrial dysfunction. Brucellosis, which is back in America, and rabbit fever tularemia. On one day, busting biofilm back in 14, Chris popped a 51 tricho. If you don't know how to rescue these people, they're not going to make it. They'll get pancreatitis, the liver will shut down, they get capillary leak, which I treated in the ICU. The intensive care training, you think it's for one thing, but God had a plan for another. Truthfully, naturopaths have no business treating people like this. If you get the immune system working well enough to bust biofilm, if it is saturated with trichothecene, this much pops out at once. You can't wait 10 days for the test to come back. You've got to move fast, and you've got to know. And trust me, we weren't always astute enough back in 11 and 12 to know the difference. We had a model from Australia bust a 520 benzene on LabCorp, which would be a 200,000 on methylbenzene, just with a 25,000 C drip, and you get a pancreatitis right away. Who would have thought she'd have that much benzene? She was from Melbourne, Australia. That's the Pittsburgh of Australia. You got to be careful. You got to be able to rescue these people. It takes 100,000 milligrams of glutathione to conjugate all that toxin level. In 2011, Dr. Hooper from Real Time and David Strauss, who was chairman of microbiology, were so excited. And after my research for years, I got all the numbers that correlate these levels to about 400 other biomarkers. But they were so excited that I reduced two sisters from a 12 and 11.47. They were from Jupiter, Florida, down to 0 in 3 weeks. We didn't test for 3 weeks. This was one day. One day, we dropped this kid from 51, and again, 0.2 parts per billion is the government toxic level. You do the math on that, you know, it's 5, it's what, 250, 260 times the government toxic level. Our record for tricho is a kid from San Diego who had 20 years of severe abdominal pain. I told him the first day I proved it's tricho. It was all in the biofilm, and he was a 149 tricho. He might be on a low toxicity things, I don't know. Anyway, but one day we popped him from 51 to a 1.74. This much tricho, they'll blow up like a pumpkin. They get capillary leak, just like a burn patient. My chairman invented PEEP, and most of the knobs you turn on a respirator we invented at the University of Florida under the anesthesiology department, but it was the intensive care, that's what I went there for. In the burn unit, the patients had capillary leak, and they all had wet lungs. And that's why I was part of these studies for the super PEEP, to pop the alveoli open and push the water out of the way so the alveoli membrane would come up against the capillary. Well, these patients that pop this kind of a tricho level, even a 30, will get swelling. A lot of patients, some of you people have a grandma, or maybe it's just you or your mother or whoever, who's got a lot of swelling in their ankles and their lower legs. They either have a lot of petrotoxicity, petrochemicals floating around the bloodstream, inflaming the capillaries, or tricho, or usually both. The aflatoxin wasn't much. The ochratoxin wasn't that much. And notice the difference in the lethality of trichothecene versus ochratoxin. And the ochratoxin, again, comes out of penicillin and aspergillus molds. And this is the kidney failure guy. And it was thinking, driving in one morning again, what did I ever use amphotericin for in the hospital? Every nurse on the webinar and every doctor knows that amphotericin is called amphoterrible. Well, guess what? It isn't the amphotericin. And we've probably now got about 40 patients. We've proven that in the amphotericin will not drop the GFR, but when it was used in the hospital, by those of us who were able to use it, it was used for aspergillus pneumonias and severe fungal infections. So you got to constantly be thinking, and you disprove so many myths in medicine, myths you believed yourself for years. Aflatoxin is the toxin that's produced by penicillin mold that actually ruptures the cell membrane on bacteria, and that's what Fleming said, was mocked and laughed at, and died in the late 30s. It wasn't in 1944 first mass production of penicillin came. Real time is now measuring gliotoxin, and we'll soon have mycotoxin levels from Great Plains as well. Anyway, so Chris had severe cerebellar ataxia. He couldn't drive a car. Bilateral intentional tremors. Those of you who know medicine know intentional tremors come from the cerebellum, and discoordination, etc. I could go on with, again, we were trying not to, this kid had all kinds of symptoms, frequent stumbling, severe cerebellar shutdown. He also had resting tremors, which do not come from the cerebellum. They come from the cardiac nuclei, substantia nigra, or lentiform nucleus. Light sensitivity, wore the sunglasses for 3 years, not 16 years like Channing. Tinnitus, ringing in the ears, I was able to figure it out in 2006. By accident, of course. Had an old codger from New York who took all his Xanax, and he said, call me back with, Doc, you got rid of that 20 years of tinnitus. How the hell did you do that? Well, I didn't know. And to think about what causes tinnitus or ringing in the ears. It's the little hair fibers in the middle ear that are moving to sound waves. And they send electrical impulses, micro impulses to the brain. But if you are over-electrified from cytoneurotoxicity, they'll give you buzzing and then ringing. And in the case of Taylor neighbors, again, go to YouTube, my YouTube channel, and type in Taylor neighbors, 10-year-old, who went from 2020 to 2350 because of mold spores, because of oxalic acid melting the lenses, which also caused excessive voltage among all the other things, and caused them to become schizophrenic and screechy in the ears. Chronic fatigue, migraine arthritis. Brucellosis makes Lyme look like a day at the beach. Brucellosis was supposedly eradicated from America. It's back. Ticks are carrying it. But most of my patients get it from eating unpasteurized goat cheese. You naturopathically oriented people. And it's ironic. I was getting ready to start eating unpasteurized goat cheese. We all want to get back to the way it was. Pasteur was a pretty smart guy. There's a pattern with my Europeans. They all eat unpasteurized goat cheese. They all have brucellosis. And I diagnosed way more young females in my clinic with brucellosis. There's several here now. They don't hunt. You can get it from skinning elk and deer. They hunt in the mall. So I looked it up. I have to go to Google like you guys and study every night. And guess what? They call it Malta fever in Europe because it's very common in Greece and Mediterranean countries. But it hits every joint. If you have a patient, some of you Lyme doctors on the webinar, who has what's been diagnosed ankylosing spondylitis, and they've got joint pain from cervical 1, from the axis all the way down the spine, you better be looking for brucellosis. It won't be Lyme hitting all those joints. And I've had some of the most severe cases ever seen in the labs. And we get letters from the health departments of every county in America. There's no brucellosis in America. Well, yes, there is. And actually, I think Chris was one of the first letters we got from Jersey Health Department. The labs, Quest, LabCorp, etc., they were required by law to report brucellosis. The federal government spent billions of dollars trying to eradicate it from America because it caused a lot of abortions in cattle. It's back with a vengeance, and people who have an immune system shut down by trichothecene and other toxins cannot kill it. So Chris had all the above. And just to show you a SPECT scan, this is a 2010 kid from Kansas City, and his trichothecene level was only 3.2. Now, only Dr. Hooper used to get all excited about a 3.2. His meter in Dallas went to a 20. Before my patients kept busting his meter, he went to 40, and then he finally gave up. But a 3.2 is enough to shut down the glutamic acid decarboxylase. I'm the first doctor in the world to prove the cytoneurotoxicity. The glutamate excess is not a leakage from the vesicles in the brain cell storage units, as I was told by German scientists in 2006. It's actually a shutdown of glutamic acid decarboxylase that converts electrifying glutamate to GABA, and you get this increased red activity. Daniel Amen would call a ring of fire, the bipolar diagnosis. But I want you to notice on a SPECT scan, you'll see it was proven years ago in the 90s, cheaper scans using Technetium 99. The cerebellar tonsils are the most active brain region. The way Daniel set the software, 35% more active than the rest of the blue areas. Basal ganglia, some of the deep limbic system. Notice this kid's cerebellum is downregulated from red to blue and even to black. It's a ratty-looking cerebellum on a SPECT. That's what I call it. Now, ratty-looking because it's not homogeneous. Tricho would downregulate in a homogeneous fashion. But it causes so much leaky gut syndrome. The best research of how trichothecene destroys the gut lining is at the University of Marseille. The first study I read was in 2008. They got repeat studies in 2013, how it destroys they've done it down to the microcellular level, how it destroys the intestinal transporters in the gut lining. When I read those studies, I knew in 2008 it's causing Crohn's and ulcerative colitis. We've proven that, and we reversed it in multiple people by pushing the tricho out of the cell membranes of the intestinal lining, okay, and out of the mitochondria. It doesn't come easy, but we're accustomed to seeing patients whose amino acid levels are in the bottom 1% of people tested because of this nasty toxin. At any rate, when you leak enough gluten, and everybody talks about gluten, and every wellness doctor is gluten crazy and celiac crazy, but none of you people are talking about the brain. The gliadin molecule that comes out of gluten is identical, pretty much, in molecular structure. It's called mimicry in medicine for you non-medical people, to the Purkinje cells in the cerebellum. So when you pass enough gliadin across the intestinal lining to the bloodstream, you make excessive anti-gliadin antibodies, and they attack the cerebellum. They give you a more ratty appearance, where you're red, you have some red, some white, overactive, coordinated kid at once, some blue and some black. Now, this is by colors. And again, I use these SPECT scans from 2004, I think the first ones I did, and I correlated these to tricho levels and petro levels and all kinds of stuff. But again, a PET scan will give us the numbers. And the cerebellum is 1.12 and 1.25 standard deviations. So that's 33% plus 40%, whatever, more underactive than the ground zero. But again, the cerebellum, a great example, folks, should be the most active brain region. Proven years ago in the early 90s, okay? But the numbers are a beautiful thing. And I try to like radiology as a fourth-year student. I signed up for a month like everybody else, the fourth-year elective. I stayed a week. I couldn't do the shadow deal. I need numbers, so I went back to the ICU. I said, don't be offended. Now, Chris had infection, localized infection. But forget the protomoxoa, little round infection. Again, the protomoxoa guys, it's what I saw through 12,000 MRI studies. God, I didn't sleep for 3 months in the fall of 14. Blew up my laptop one weekend. Wouldn't take any more studies. But anyway, so I was determined to find more studies, again, but they only looked for Lyme antibodies in the spinal fluid. Didn't look for brucellosis. Didn't look for Bart, Hue fever, rabbit fever, Rocky Mountain, none of the other rickettsias, etc. So I can't tell you whether this localized infection. I can tell you that the Lyme spirochetes, the morphology, the shape of the lesions was irregular like this. The toxocysts were perfectly round like a dime, and that's what you see in the blood smears again. And the protomyxoa in the MRI studies love the cerebellum. They love the caudate nucleus. See the left medial caudate nucleus. See that protomyxoa? And see that round? See it's infected in there. The right and the left are down. That's the right caudate nucleus. Look at that. 1.1, 1.7. The left is more underactive by colors. A radiologist can read that. I have trouble reading shadows. But even I can see the left is more underactive than the right. Are you with me? I wish I could see your faces. You go to lateral view of the cerebellum, left and right. Posterior view, looking at the back. You see infection more in the right, potentially, but this is infection. These localized areas of increased underactivity, less active, more underactivity, localized areas of infection. Homogeneous, diffuse, shut down, and we'll show you some of those, I think, down the road here. You're going to see it's a trichothecene only. Notice the frontal lobe, I'm sorry, up here. I hate to say it, Chris is probably on the webinar. Smart kid, frontal lobe looks pretty good. Got a little bit of stuff there. But notice with tricho only and not petrochemicals, we see the cerebellar shutdown. And again, I've probably got, I don't know, maybe 100 of these now that show the tricho pattern. You find somebody who doesn't have a lot of petrotoxicity, tricho only, you'll see cerebellar shutdown. But the infection is there. We don't have Bradley here. He's on the website from Australia. Bradley refused to let me use antibiotics. You'll see how we cleared a bunch of nasty yellow infection out of his cerebellum, but he picked up some infection in the frontal lobe, which I told him he would do, because he was busting infection out of biofilm. And I love the kid dearly, and I'm kicking myself for letting a 20-some-year-old kid who had ticks, couldn't drive a car, his neck torticollis, ticks, couldn't even hold a cup of coffee for 20 years, and we got rid of all that, the killing infection down here, but he picked it up here. So you want to always pay attention. Once a patient is busting bugs out of biofilm, you damn well better be thinking about an antibiotic, because they're hitting the brain, because these patients have no blood-brain barrier. So I don't want to use antibiotics, and when I have to, and I know that I was remiss years ago in not using them on some of the people. We hold off till we see neurological symptoms and or evidence. We don't hold off as much as we used to, because now we're so far ahead of the world with our PET brain imaging. We know darn well when you do repeat scans and people who are continuously busting through layers of biofilm, they will pick up infection very quickly in the brain, and you better be on top of it. And Bradley cleared tons of infection, way more than that in the cerebellum, without one antibiotic. But he picked up infection in the frontal lobe, and we're going to bring him back and treat it at some point. Caudate nucleus, and left is down more than the right. 0.6 standard deviations and more underactive. Notice that he had, on his resting tremors, the right was greater than the left. Why is that? It's always the contralateral side of the brain, like a stroke. So the left caudate nucleus is more underactive. You're going to see more of a resting tremor on the right side, docs. Okay? Cerebellum down somewhat equally, but different infections. And you cannot say, again, I am not going to stick a needle in my patient's cerebellum and suck tissue out and say, is that brucellosis? Is it Lyme? Is it Bartonella? But I will tell you, the Bartonella infection that I saw, the one that wiped out a temporal lobe, it's very smooth. Think about Bartonella being so small, a dot on a red cell, compared to a long linear bacteria the length of a diameter red cell. And that's why I think the Lyme lesions in the brain, the morphology was more of a jagged look. medial frontal pretty equal, medial parietal. I'm not too concerned about this. Sensory motor. Sensory motor, the right, negative, negative. Hypometabolism is a negative. So a negative is a positive. So the right sensory motor strip is more underactive than the left. This is not enough differential to see particularly left-sided weakness, but you may. And the motor strip comes down through here, and you see there's some issues there. I'll teach you more about that with some other scans that are better examples. Leah, who is a physician assistant, worked ER for years, a brilliant PA, and came here. She was running triathlons with her radiology fiance, whatever, and climbing 14ers and very active, but always camping, hiking, but doing great until she went to a dermatology office that was full of black mold, and even within several weeks she developed some sinusitis. If you develop if your patient or you folks develop sinusitis or bronchitis, then you've got mold spores in the room, and that's a different deal than having mold hidden behind the wall where you're only breathing the gases. And the only person I don't give a flip who does the testing for your home. And we've had multiple people do it, but the only guy I found that can find the hidden mold is a guy named Alan, and he's now trained like someone, finally. He's OCD about his work like I am. He wants it done right. So, but he's finally got somebody he trusts. He never left Florida before I treated Suzanne Summers' granddaughter, who couldn't even sit up from tricho. And I said, Alan, I don't need you to remediate. I need you to find the hidden mold throughout America, because my patients were sabotaged by mold inspectors who would measure mold, suck air into a tube in a home, and send it to a company, and they said there's no mold in the air. That's a worthless test. If it's negative. If it's positive, it means there's mold in the room, spores floating around. But if it's negative, it doesn't mean there isn't hidden mold in many places, and the gases are outgassing. So you can be destroyed from hidden mold. And most of my patients don't sit around looking at mold, unless they're from Australia or Mississippi or Louisiana, where they joke it's decorative. I'm very serious. Not Dennis, but other people from Louisiana. Now, so a very coordinated athlete noticed the tricho effect. She did not have the major petrochemical issues. Notice the global diffuse. If you remove the light protomyxola type infection and the Lyme infection, she had high Lyme antibodies and a lot of Bartonella. We see more of a pattern like this. We see a lot of Bartonella on blood smears. We don't have major Lyme biomarkers. It's kind of a BART pattern we see frequently in the frontal lobe. I'm not sure that's what it is again. I'm not going to say it is. But here's an inferior view. Look at the bottom up of the cerebellum. You can see more of this localized infection in the right cerebellum, different types of infection. Notice in the back, again, posterior view, look at the back of the brain. We get a great look, a lot of little round guys. Someone who goes out camping all the time gets bit by mosquitoes. By the way, you folks wonder why you get bit by mosquitoes, your husband doesn't, vice versa. Mosquitoes like the sweet smell of lactic acid. The higher the lactic acid, the more mosquitoes love you. So the sicker you get, the more inflammation you get, the more hypercoagulability, excessive clotting, the more decreased blood flow to microcirculation, the more lactic acid buildup you have. And heavier people who are overweight, have higher lactic acid levels. So at any rate, but if you're just outside all the time, as this particular lady had been, just always camping, hiking, you're going to be bit by more mosquitoes. I had two identical twins in 2013. Their mother was the president of one of the biggest Lyme.org in the Northeast, and two 23-year-old females. I looked at her blood smears the first day and said to one of the twins, you will be here 6 weeks because you're the inside girl, and the other one, you'll be here 6 months, won't be enough. And I was right. The one kid was treated for 6 weeks. It's about being, if you're inside, the inside girl playing the piano, going to poetry, whatever, versus the outside person who has more exposure. So that's a play. But on the other hand, if you're outside and have a good immune system, cowboys didn't have benzene, methylbenzene, dimethylbenzene coming out of the tailpipe of the horse. And they didn't have airtight, energy-efficient homes that trapped the mycotoxins that shut down the immune system. Do you think they didn't have ticks crawling all over them? You got to use common sense, folks. It's about the immune system. We have so many chronic illnesses that did not exist before we decided to remove all the windows and doors that allowed homes to breathe. And that was after the Arab oil embargo of 73. About 1980, we had pretty much gone around the country. Same thing in Europe. It's worse in Europe. The most mold toxic people I see come out of England. It's humid. England, Ireland, oh my God, and they get in buildings, they work in buildings that are 200 or 300 years old, and those buildings all breathed before they went around those old buildings and have had water intrusion for 200 or 300 years, and then they put in airtight windows and doors. And once the trichothecene shuts down the cytochrome P450 liver enzymes, you cannot detox all the other 87,000, I guess we're up to 84,000 synthetic chemicals we made since 1930. But another trichothecene pattern, if you remove the localized underactive regions, and this very coordinated athlete now has a cerebellum, and she's 1.7 standard deviation shut down on emission. So that's 33%, another 0.7 to 33. So that's about 50% below what she should be on the right, and less on the left. Some asymmetry. And you can see more infection, more yellow in the right. We see some frontal lobe stuff, but this particular PA, my God, she took care of half the patients here. Her 4-second processing memory in the lateral prefrontal cortex was fine. There was no infection there, maybe a touch over here. So she was a genius the whole time she was here. We tried to hire her. We hope she'll get bored with dermatology and come back. But she talks to some of our patients now. She may have talked to some of you guys. But she went from climbing 14ers and running triathlons to bedridden from this damn trichothecene. It's such a lethal gas. Our Pentagon decided they couldn't use it for biological warfare. And, those guys are a little crazy. So we won't go into all tangents on that. But once it shuts down the CD4-CD8 ratio and you don't kill, your killer cells just watch the infection float by, destroys the Peyer's patch in the intestinal lining so you don't have the antibodies. We see trichothecene drop the IgM antibody levels to 18 and 10. Good God, it should be, 150. Very sad that when LabCorp went out a couple of years ago and we tested people, they dropped the low on the IgM antibody from 60 to 28. I'm watching the downregulation of kill power in Americans. Now, it's very, very sad that the young doctors and nurses won't know the difference. The normal white count for years was 4,000, 11,000. The new norm, the new low on the bell-shaped, 95% bell-shaped curve is 3,400. So now you're normal if you have a white count of 3,400. That was considered leukopenia for years. And what's more aggravating or frustrating than just watching the immune systems of Americans being shut down, the TNF alpha, the primary messenger of the immune system, trichothecene destroys it. I read that 8 years ago in German research, and methotrexate destroys it. Enbrel grabs it, conjugates it, and deactivates it a week at a time. But it activates the kill power. So tricho is extremely, it's much more immunosuppressive as one toxin than the HIV. HIV will shut down the killer cell ratios, but tricho destroys the production of antibodies, the factory, the Peyer's patch, kills TNF alpha. It does all kinds of nasty things to shut down the immune system. And we've seen patients coming with a white count of 2,000 with trichothecene levels as high as 8 and 10 walking in the door. At any rate, so a good example of cerebellar shutdown, some visual infections, some light sensitivity issues, again, and for some reason we are seeing a correlation with people who have lots of Bartonella rashes that break out, or Bartonella on blood smears. I'm not saying there's a black and white double-blind study, but we're seeing a correlation where we see more, the more dramatic Bartonella blood smears we see, repeated Bartonella, refractory Bartonella. We're seeing just a pattern, a correlation with the visual area. Not saying that's a scientific deal, but a lot of times the correlation is just like correlating idiopathic jaundice with the kids that are, and we, by the way, the kid from London that had the 15 mitochondrial triglycine shut down, she had was told by doctors in London that she had genetic liver failure, or Gilbert's disease. We see that quite a bit. I was so thrilled to send the normal bilirubin back to her parents once we pumped the liver out and pumped the mitochondria. Now, the liver has the most cells per organ. And those cell membranes are 50% phosphatidylcholine, but when the liver mitochondria is shut down, it doesn't detox anything. And then you get the high bilirubin. She had a bilirubin of 2.7, I think, wasn't it, coming in the door? And they've been told since age 13, when she moved into Moody High School, that she had genetic liver failure. So fatty liver, non-alcoholic fatty liver, we're reversing it in a lot of people. We're seeing it in a lot of people. I saw an 18-year-old yesterday, first time looking at CT of liver. We cover like 10 specialties here. You better know which scans to get. You really need a medical school education, and you need to be thinking constantly to treat these folks because they have multiple organ failure. You see the shutdown in the green here, the cerebellum. You see these areas of infection localized, these green, yellow, and the different slice on the scanner. Notice the sensory motor region, some asymmetry. It's not terrible, but we see some asymmetry in this region. We'll show you some better examples of that in a second. Rachel, Mississippi, referred by Amen Clinic. They're one of the brightest doctors they have, Dr. Philaday, who is talking about coming here. He was the medical director of the Whitaker Clinic for a long time. She had cerebellar ataxia. This young lady was a gymnast, and when you move from being a gymnast and can do university gymnastics to you can't walk through the door frame without bumping into it, and you're walking sideways, that's significant. Bilateral intentional tremors. Where's it coming from, folks? The cerebellum. Severe discoordination and unilateral resting tremor in the right hand. And I'll show you why. Bartonellosis, brucellosis, she was diagnosed with Lyme disease by Dr. Philaday using Ogenics out in Amen Clinic, and she had a speck. I think we put it in here, yeah. So a speck scan, on her speck she's overactified. Notice her cerebellum. She's got some red, but she's dropped to black and blue. This is an extremely coordinated kid who's now very, got a lot of discoordination and ataxia. And you see that the right cerebellum was more underactive at the time they did the SPECT scan. And again, I did hundreds of these. Those are the basal ganglia, by the way, on a SPECT. It's easier to teach you folks on SPECT than PET. And that's the anterior cingulate gyrus looking from the bottom up. It's overactive. It's more of a serotonin issue. It's a classical thing with Lyme disease. The Lyme spirochete will still tryptophan and make a toxin called kynurenic acid, which actually will block glutamate from the receptor and will downregulate the excess voltage from excess glutamate activity. But it does cause overactivity in regions that are serotonin sensitive, i.e. the deep limbic system and the anterior cingulate. But the basal ganglia are heated up because of excessive histamine from excessive inflammation. I taught Daniel Amen that years ago at an NFL meeting. We were both speaking the night before. I told him that the majority of these people that had these overactive basal ganglia did not have excessive dopamine production as he once predicted, which is a reasonable prediction if you haven't measured the neurotransmitters. I've done over 11,000 neurotransmitter tests and correlated them to everything. And histamine is in molecular structure almost identical to dopamine and activates dopamine receptors in the brain. I told Daniel at the 2009 NFL meeting that leaky gut syndrome was a major cause of overactive basal ganglia. But when you have major infection and or toxins floating around the bloodstream, for you folks who are non-medical, every time your antibodies grab a foreign body, a toxin, a food particle, a parasite, or a Lyme spirochete, etc., anything that doesn't belong in the bloodstream, there is a release of histamine from mast cells. Some of you have mast cell deregulation. Genetically, you release more than others. You're the people who would turn red when you were back in the 8th grade when you were still healthy. And you have to go in front of the class. And you turn red. When you get angry, you turn red. And so your histamine levels will go much higher than my other patients with the same level of infection or toxicity. That speaks to some of you. You'll pass that downstream. Now, if you're Asian, there's a gene that runs within the Asian community. We're starting to see more Asians now. We're seeing people from all over the world. And the Asians have a deficiency of an enzyme that metabolizes histamine So they have excessive histamine, and you often see overheated basal ganglia, and then you don't see a red flush on them because of their darker skin. They have more MSH hormone. Anyway, so compare SPECT. Doesn't tell you near as much as PET. So on a PET scan, we actually have measurement. Now, Rachel, this is in 14, and I have not yet learned my lesson. I'm a slow learner. That if you do not give the patient who is suffering from excito-neurotoxicity, glutamate too high, GABA too low, excess histamine, sometimes excessive phenylethylamine, when trichothecene or ochratoxin downregulate the activity of tyrosine hydroxylase, you'll see dopamine drop, but the tyrosine will convert to phenylethylamine. And on my mold toxicity page, you'll see a scan from 2010. And you'll see a PEA of 275. And that was what was causing more bipolar than its glutamate of 64, which should have been 20. PEA should be 50. Anyway, I'll do a whole brain chemistry talk in a webinar maybe next week or the week after, okay? I'll put 18 twists, 18 angles on every neurotransmitter, and your doctor doesn't know what they are because we looked at 4 of those a day. Everybody's doing neurotransmitter testing, but there's multiple angles on the neurotransmitters, why one's up, one's down, enzyme downregulation, etc. At any rate, let's see what correlates with neurological symptoms. Well, so a very coordinated gymnast is now very uncoordinated, and look at this pattern. No petrochemicals, but major tricho, and you see this, now again, remove from your brain the yellow, the perfectly round cyst. Where the cyst, where a protomyxoa of some type, Protomyxoa rheumatica, that Dr. Fry was first to diagnose, or one of the many protomyxoas, like the one in horse troughs that causes equine encephalitis and takes a racehorse from racing to lying down and dying, okay, to toxoplasmosis, okay? So they all love the brain. They love the nerves. They love the muscle. They are forming a lot of plaques in the carotids, etc. I don't have you pay to differentiate which protomyxoa you have because my parasite kill will wipe them all out anyway. My parasite kill would not work if I did not get your antibodies and killer cells working the way God intended, which I could not do in 2009, 10, 11, 12, and 13. I had to use vitamin C. The killer cells, by the way, some of you smart women know this. You guys, you ladies always impress me. The longer you've been sick or your daughter's been sick, the more you know. You know way more about how the body works than we're taught in medical school. So some of you know that the killer cells have 70 times more vitamin C than the other cells, okay? But it's not the holy grail, you know. Dr. Levy, I admire him, but the vitamin C guys, like Dr. Levy, think vitamin C is everything. Rhoda Barnes was a brilliant doctor who said the thyroid was everything. Everybody's got one thing that's the thing. Well, it's just one of the things, okay? The protomyxoa causes ALS. And there are some doctors who think it's the cause of ALS. Well, all my ALS patients have protomyxoa rheumatica. Guess what? They've all got mycotoxins that destroy the lateral horn. Look, my patients have everything, and you people have everything. I've already looked at your questions. Those of you who put questions in, all right? So it's not one thing. Now, but what we see here, unlike Dennis, who had major global diffuse light blue below the yellow areas you saw, and even the Maria you saw, we don't see downregulation of frontal lobe. Rachel's brain worked fine. Her frontal lobe, she didn't show brain fog symptoms. I didn't mention brain fog over here, remember? Oops. Are you getting the difference, folks? Now, she'll say she had some brain fog. But I'm saying, was it near as bad as the folks that I showed you their 4-second memory is hammered? Whoops. Their 4-second memory is so infected in these regions here, okay? But her cerebellum took a hit. This young lady left Mississippi State, went to work in the governor's mansion. I won't mention the state. And after 9 months in this old, moldy governor's mansion, she's walking sideways. I hope this is hitting home with you people. Because I looked at the questions. Good God, you're all severely mold toxic. And guess what? It is not enough to pull the toxins out of the bloodstream. That's what I was doing in 2009, 10, 11. You've got to mobilize them from the tissue. And by the way, trichothecene causes glioblastomas. I'll show you a glio I diagnosed in an Australian patient. Okay? It causes astrocytomas, glioblastomas, stomach cancer, liver cancer, and they're just getting started. I have said for 8 years, they will prove, and they always prove what I say eventually. You can ask anybody that works here. They will prove that trichothecene is causing breast cancer. Trichothecene has some molecular structures similar to benzene, and benzene's been known for over 30 years to cause breast cancer. We know estrogenic pesticides cause breast cancer. Well, guess what? When your killer cells do nothing, you're going to have cancers. When your TNF-alpha is nothing. I looked at 4 new patients already this week, and their TNF-alpha was all less than they can measure. The high end is 15. They were all less than 1. They all have a story. They all have a story, a black mold infestation. You've got to get the tricho out of your tissue. You've got to get it out of the mitochondria, but you definitely got to get out of the brain tissue and the nerve tissue. So we can move more mycotoxins and petrotoxins out of your brain in 3 weeks than anyone in the world can do, and I'll say it. If it irritates or agitates, I have no problem with it. The proof is in the numbers, and the proof is in the results. We've taken 27 people out of wheelchairs in the last couple of years. I think, well, how many are going public now? 15, 17, whatever. And, you know, we reversed a lot more dementia. The Alzheimer's dementia people don't go public. They don't go back to the neighborhood Christmas party or Hanukkah party and say, well, you know, I had dementia. Dr. Sponaugle got rid of it. You didn't know. I just talked last year at the neighborhood party. But everybody knows if you're in a wheelchair. So, you know, we've had Billy Austin, one of the greatest writers for country music. He saw the miracles here back in 2011 when we knew nothing. We knew nothing in 2011 of what we know now. But we were still producing some miracles here, and Billy Austin called Glenn Campbell and met with him and said, get your butt down there. And then Fuzzy Zoller, you'll see his son, Miles, on our before and afters. We treated a bunch of folks in his family. We treated one of his relatives with dementia, reversed it. Fuzzy, when his family called Glenn Campbell, because I knew Glenn Campbell was a big golfer, and said, come here. Why do you think Glenn Campbell wouldn't come here? Because the folks, the neurologists at universities, wherever his mecca is, who can't reverse dementia, because you can't do it with drugs. I'm sure said, don't go to the quack in Florida. Well, you know, you got to have 20 people with dementia before they believe it. And so we could get more, but we got more people. We got 2 more people out of wheelchairs. They're not even, you won't even see the, not even on the, 2 more or 3 more. They're not even on the wheelchair picture. They will be soon. There's a young man here. Well, he's younger than me. Everybody's younger than me. I'm 60. But a young man here, Tony, a paramedic from Canada, had the top 3 ALS neurologists in Canada for 2.5 years. Couldn't walk. He'll walk with me tomorrow. We'll do a little picture. Don't forget the video of him tomorrow. He's leaving tomorrow. The visa time's up for this gentleman. He's been walking. He walked around here. He's still got some spasticity. We need more time, but he couldn't walk when he came. He was told by the top 3 neurologists who are the top 3 ALS specialists in Canada, come down and walk again. We're used to that. Look, God didn't read the book, not the book that man wrote. When you get patients back to Garden of Eden state, get the bad stuff out of the brain and nervous system and the body, and get all the nutrition and the good stuff back in, it is amazing. It's amazing. I am astonished and humbled that God made a brain and a body that will heal. Did I ever think we'd reverse MS? Are you kidding me? Not possible. Well, it's not possible. You don't know what causes it. You can go to Mayo Clinic, Duke, Stanford, all these universities, the meccas, and read their MS page, and they would tell you immediately, we don't know what causes MS. I find it very irritating that we pay all these tax dollars, me, you, all of us, and these people waste our tax dollars, and they can't, not one neurologist sit on his butt in his professor's smart office, driving his smart car to work, I guess, but too smart. Not one neurologist of all the thousands of them who work on tax dollars in America or Canada can bother to read a study in the International Journal of Molecular Science, It's a little deeper than JAMA, the Journal of American Medical Association. It's mostly big pharma ads. It's deeper than Lancet, which is a better journal, British journal than JAMA. But good God, you would think one neurologist at Mayo Clinic or Stanford or Harvard or Duke would read a study that proved in 2011. I did not find that study in 2013, but proves, validates what I said in 2009, that mycotoxins are causing MS. It's common sense that the fattiest tissue, the myelin sheath, which, by the way, is 25% cholesterol. So all you folks who have a moron for an internist who's giving you cholesterol medicines and bragging about getting your cholesterol down to 140. Some of my best friends are internists. I love them dearly. God, I want to smack them silly on the tennis court. They're bragging about getting everybody's cholesterol down to 140. I have said since 2000, maybe 2003, the brain is suffering with a cholesterol below 180 to 200. 180 to 200. The myelin sheath, the insulation on every nerve in your brain and body, is 25% cholesterol. So go back and tell your family doctor or internist who's killing you with those drugs. By the way, German scientists prove the number one cause of excessive cholesterol and triglycerides is excessive fatty toxins overburdening the liver. And guess what the number one toxin was? Trichothecene. I hate to sound like a tricho nut, but it's just the way it is. It's the beginning of all the bad. So here we go, cerebellar shut down. So now this kid can no longer practice gymnastics, no longer do anything. Notice she had a right-sided resting tremor. Back to the symptoms again. There's so much I want to teach you guys, and it's all intertwined. So unilateral, one-sided, resting tremor, right-sided. So left-sided, motor region, look at that. Is that a gorgeous example? No infection in the right caudate nucleus, but the left caudate is infection in it. So the left caudate is 1.7. Oh, God, help me. Some of you want me to calculate to 0.07. I've worked all day, so get over it. So let's say she's 1.7. Standard deviations more underactive on the left caudate than the right. That's why if she has a resting tremor, a Parkinsonian tremor, it's going to be on the right side. It is typically in the right upper extremity. I have seen these, obviously, in the right lower extremities. So that's a gorgeous example. God, I wish I could see all your faces to see if you're getting this. The cerebellum, 0.57, 0.38 standard deviations underactive, but you got to get this. We did not give this patient enough sedation to get her down to ground zero. Look at all this negative. Her medial parietal, a negative, hypometabolism negative. So see, I have not yet learned a hard lesson. Kurt, when you did yours, I did not medicate you down. The reason you want to medicate a patient down to ground zero, again, is that if you want to know, is it a protomyxoa, infect in the caudate, is it an irregular lesion, is it a long cystic worm? If you want to see the morphology and the shape, you damn well better get them down-regulated to zero. So, posterior cingulate, IQ hub. And she's a brilliant kid, but still, she's over-electrified. You saw on her SPECT scan how over-electrified she was. Red versus blue on the specs, the way Daniel Amen set the software years ago, is 35% more active. Now, the blood flow follows electrical current. So it's an indirect measurement, but the more over-electrified the brain region, you'll see red versus blue. But an over-electrified brain, but see the cerebellum are supposed to be. So SPECT scans, like Daniel Amen's research and university guys before him and after him and during his whole deal during the 90s, proved is the functional scans that were cheap enough. This is basically the same scan you'd have for a thyroid stress test. It's Technetium 99. The cerebellum is the most active brain region it's supposed to be. So remember, it should be 35% more active, or a standard deviation more active than the rest of the brain. But you'll notice all my patients, because all my patients have trichothecene toxicity. I've never seen a chronic Lyme patient that didn't have trichotoxicity, didn't have the mold toxin genetics of different levels. They could not effectively remove the mold toxins. When you read the German research I read years ago, but then I've got better research than they do. Their research was in rats. I've got more research than all the universities in the world combined on how correlating over 6,000 trichothecene levels to CD4-CD8 ratios, TNF alpha levels, to antibody levels. And, it's not the only thing. But Lyme spirochetes, the Lyme toxin, would downregulate the CD57 lymphocyte. Trichothecene would downregulate production of CD56s and 57s. You should always measure 56s and 57s. And if you see them, they're suppressed equally, then it's not a big Lyme factor. But there's other markers for Lyme, like quinolinic acid, when it converts tryptophan to quinolinic, etc. I won't get into all that tonight. It's too deep for this particular talk. But tricho pattern, infection, cerebellum infection, and elsewhere. But she's so over-electrified in the frontal lobe, we can't even see infection in there. But we can up here, because this should be all orange. That green is infection in the frontal lobe. I can't see it here, so we did not give this patient enough sedation to get her down to just neutral. So if you know that the cerebellum should be a standard deviation more active than the most active brain region, and we won't use the anterior cingulate gyrus, because my research with SPECT scans years ago, and Daniel Amen's proved that serotonin deficiency will cause it. I taught Daniel Amen in 2007, estradiol deficiency will cause it, because an estradiol level below 60 to 80 pGs per ml, serotonin receptors will not receive serotonin. Serotonin receptivity is decreased. But her cingulate was overactive, 2.7, from other women her age. That's what this is about. Now, she had serotonin deficiency because she had been treated by Lyme doctors. Lyme doctors cause more serotonin deficiency than anyone else except pediatricians who treat the kid who's got a suppressed immune system, usually for mold toxicity, with multiple antibiotics. They amoxicillin syrup, they bleed pink amoxicillin, okay? They're a pediatrician every 8 weeks, okay, for ear infections. They get the tonsillectomies, they got the tubes in the ears. But the Lyme doctors, again, and you should, and I was wrong when I said you should never use antibiotics. I'm willing to admit when I'm wrong. And you don't know that until you've treated enough people with Lyme. And the truth is, I say Lyme is always a brain disease. American research says 20% of the patients have Lyme. Well, guess what they just proved in Copenhagen, Sweden, and Germany? They say all pediatric Lyme is brain Lyme, Lyme. They all get a slight meningitis. But remember, the blood-brain barrier is not yet fully developed in pediatrics, nor is the frontal lobe. But they say at least 80% of Lyme in adults is Lyme. But the Borrelia garni in Germany and Europe is supposed it can dig its way into the brain and through the blood-brain barrier better than Borrelia burgdorferi. So they do have a different Borrelia for the most part in Europe, and it is more of a Lyme animal, or brain-involved animal. So we look at the top of the brain, a superior view, we see some of this. This is trauma. This is trauma, guys. This green is, yellow is underactive, green is severely underactive. This girl was a gymnast. How many times do you think she hit her head popping off the bars and all the other things? Very active, athletic kid. You have to have some common sense to differentiate trauma. Lateral view, you'll see trauma. You don't see the trauma inside so much. This will be trauma. Temporal lobes will very commonly see trauma lateral versus medial. You don't see the trauma on the medial. It's common sense. Some of you will get it, some of you won't. If you're a physician, you have most of the common sense thrown out of the medical school. You can see the motor strip and some foot drop issues. We'll show you a scan or a map of the brain here shortly. Sensory motor is overactive, but it's not as active as other parts of the brain. Why? We got motor strip issues. Foot, leg, trunk, arm, hand, face. I'll show you that in a moment. I'll show you why we see so much foot drop in our clinic, the most common problems we see. So you can see the cerebellum doesn't look that underactive by numbers, but if you know that we had left the patient too over-electrified, because I was back in 14 sending these people for a PET scan before I calmed them down to ground zero. If you get all these regions down to a 0, then you can actually see how underactive the cerebellum is. So if you add 0.6 standard deviations, okay, to 2.5, so 0.5 and 2.5 is 3. So her cerebellum is 3 standard deviations more underactive than it should be. I can back into these numbers all day long. It's painful for me to do this with you unless you're a math-oriented person, as I am. And it's, you know, we have a lot of math-oriented people. We have a lot of engineering husbands, and it's very helpful. Or women who are math-oriented, but a negative is a positive again. So we leave you, if we leave you over-electrified, and I had to teach neuroradiologists this, but I had to think. You have to think constantly. Why did Gracie, who couldn't speak, and of all things, I want to see her speech area, area 44, which is about right in here. I want to see, is it a Lyme infection? Or is it toxins causing her slurred speech? Everybody on the webinar, if you've not seen Gracie's video, I made him make it a 4-minute video. God, for God's sakes, you can watch it. 15-year-old kid, watch her dragging her legs, trying to move them in Canada before she got here, and watch her trying to talk. You'll see her ride around my clinic on her pink bicycle. And she articulates perfectly, thank you, Dr. Sponaugle. Now, there was a lot of hell and high water between her not being able to talk. I had her speech back to normal in 3 weeks. It was toxins, not infection. But it took a lot of biofilm busting. We've taken 7 people out of wheelchairs in her region of Ontario. It's down about an hour southwest of Toronto. It's that freaking Lake Ontario. It's the most toxic lake in North America. All the lakes drain into it. The Detroit River drains. It is so full of petrochemicals. And a bunch of those wheelchair girls you see in Canada, Mariah, Kamea, Alicia, Shelby, Gracie, they had massive petrotoxicity, and they all had hidden black mold infestations. And the Trichothecene shut down their liver enzymes, the cytochrome P450. In phase 1, there's 7 enzymes, and phase 2. And by the way, for you docs on the phone, on the webinar, Tricho shuts down the cytochrome P450 enzymes way more than the genetic testing that's become so popular. So stop telling your patients that they're sick because they got genetics for cytochrome P450 shut down. Scientists cannot even tell you whether those cytochrome P450 enzymes, 7 enzymes in phase 1 detox, are they shut down 20% or 70%? They cannot tell you. Look at Teresa's video, Canadian. I forgot we did the video of her in 14. She held her enzymes up. She had 4 out of 7 that were genetically shut down or less effective in detox. And she was told by multiple wellness integrative doctors in New York, because all the Canadians go to New York after they get nothing in Canada, and they're told that the genetics is the problem, as was Julia, who just popped out of a wheelchair recently from Miami. And Julia told me she came here because she saw the video testimony I did with Therese. Therese was perfectly healthy till age 40. So common sense dictates it wasn't her methylation genetics. She had it since she was a baby. She did the work of 3 women for 40 years. Lectured all over North America, wrote books, raised 3 kids. Common sense, my God, it's missing. Stop telling patients they're sick because of methylation genetics they've had since they were a baby, and they played soccer, they played volleyball, they played basketball, they ran marathons, they were perfectly healthy. Until they're 30 or 40, when they moved into a bad office, as Therese did, into a 120-year-old university building full of mold, and went to hell in a handbasket in 6 months, or they had a flood in their basement, whatever, okay? Stop telling them the methylation genetics, now the 6677 isn't good, and you should be on methylated folic acid. But if you have a 6677 and you were perfectly healthy, and you were a great athlete in high school and college, do you really think that's what made you sick later? God, common sense is missing, and these wellness doctors who can't do their own research, I'm just going to tell it like it is. They can't do their own research, but they go learn facts. I call them factoids. And it's sexy. Genetic testing is sexy. But common sense dictates if you have shut down liver enzymes, you've had them your whole life, it is not what made you go down at age 40. And Julia came, thank God, and came out of her wheelchair because she saw Therese, who was 62, hold those enzymes up I don't even measure those enzymes anymore with Genova. If you want me to do it, I'll do it. We don't even do that testing anymore. Why? Because the epigenetics is greater than the genetics. Okay? Phase 2, the absence of glutathione S transferase. I used to think, oh my God, by 2014, I'm like, oh, that's the holy grail. It means you need more glutathione because you can't conjugate glutathione in your liver kidneys. But guess what? We've recently seen a young kid from Austin reverse that. True epigenetics. We pumped Tricho out of that kid. Oh my God, I mean massive levels. Kid was diagnosed with MS at 50. We get her at 20. $1.2 million to clean the black mold out of her house. How's that for a big house with lots of black mold? And guess what? Pumping Tricho out of her liver mitochondria reversed the genetics, the expression of the bad gene for glutathione S transferase. So, you know, that is what scientists talk about, the epigenetics causing expression of bad genes. I've gone much deeper than that in proving specific enzymes that are shut down, like glutamic acid decarboxylase, like methionine synthase, converts homocysteine to methionine, et cetera, et cetera. But it is exciting to see that when you pump the nasty Tricho, and that particular kid was full of petrochemicals, because they had a house on the Gulf in Texas, and that BP spill went for hundreds of miles. And I told people after April 2010, do not eat the fish out of the Gulf, and for God's sakes, don't eat the shellfish out of the Gulf. And guess what? In February of 2015, I decided to back off in my workshops. Oh, go ahead and eat the grouper, eat this and that. And then coming back from an airport in Denver, I picked up a Scientific American, and a scientist from NIH went down to the submarine. Oh my God, the oil spill still goes for miles. 5 years later, folks. But the good news is the oil slick is down from 30 feet to 15. So do not eat the oysters out of Apalachicola. I'll probably have a bomb under my car tomorrow. and the oil slick, look, the kid from Austin, they had a beach house on the Gulf in Texas. And every time they took her out kneeboarding, the boat came back with black film. I had patients in Jupiter, Florida in 2011. Their boat came back with black film, but they took it out to the Gulf Stream, which picked up like scientists said, picked up the flume that went down around the Keys and went up to the East Coast. But anyway, so if you live in Louisiana, Mississippi, Alabama, Florida, don't eat the fish out there right now. If you have a little benzene withdrawal, I had some benzene withdrawal. I hadn't eaten grouper for 5 years. I had a grouper sandwich. I told my family I'm in benzene withdrawal. I ate a little benzene. The fish probably isn't so bad, but don't eat the shellfish. Look, God told Moses 6,000 years ago, don't eat the shellfish in Deuteronomy. Just like he told Moses in Leviticus, if the mold comes back on the wall a second time, remove it. I don't think they had airtight buildings that would trap the mold mycotoxins back in Moses' time. But God, he gives us this information, and we're too stupid. We're so geniuses, aren't we? It took us 6,000 years to prove shellfish are scavengers. So don't eat the shellfish out of the Gulf of Mexico. They're going to be full of petrochemicals. The closer you get to the epicenter of Louisiana, the worse it is. And you'll see all these things. We've seen patients from Texas all the way around to Naples and the Keys that have been hit. But the worst hit people are southern Louisiana. And we showed you this as one example. We got lots of folks from southern Louisiana with MS. I said 6 years ago, we're going to see a surge of MS, ALS, and Parkinsonian symptoms and cancer in southern Louisiana. And that's where I spoke in July, and we've seen it. And I've got all the data to prove there should be a huge lawsuit. Thousands of people from the medical side, not the business side. They gave away money. So anyway, again, we're the first people in the world to prove that Tricho will shut down the cerebellum before the frontal lobe, and I was surprised. I espoused for years. I've got enough PET scan data. You have to have enough big enough imaging database before you can say what's going on. Because she was over-electrified, cerebellum, over 3 standard deviations. The 3 standard deviations were underactive. So that's why. So when you look at this number, you say, well, geez, why was she so uncoordinated? Why was she walking sideways? That's not that bad. You have to back into the numbers. This is why you want to medicate someone down the ground just to even in these other regions so you can see the truth. I can tell you she's 3 standard deviations more underactive than the left cerebellar tonsil. That's this one. And that's this one. You can see it more underactive than the right. You see it by numbers. I can tell you add the 0.5 to the 2.5, but you know I really detest have to do this for hours with families. It's much easier to get to ground zero on these other brain regions. Now, this was one of her smears, massive Bartonella. So see that she comes in diagnosed with Lyme. Look, Lyme. I like to say Lyme is in vogue. Like Epstein-Barr was in vogue. A lot of people who went down with mono, I've said for years, actually they had Lyme. But now Lyme is so in vogue and such in the spotlight, it's like everything. It's not everything. It's one of the things, and it's often not the worst thing. People come here for Lyme disease when actually, in my opinion, Bartonella is a much bigger factor in most of the brain infections. By the way, the Bartonella DNA PCR testing will be negative when it's all wrapped up in the biofilm. One would think the DNA would have memory, and we have DNA tests for immune memory. We still see negative Bartonella. So negative Bartonella antibody testing means nothing. The whole idea of the biofilm, the bugs spin it to wall themselves off from the antibodies. Antibody testing will be negative. Dr. Fry will show you one tiny little Bartonella, it's a little dot. A dot on a red cell versus a Lyme spirochete that is the length of the diameter, about 7.5 to 8 millimeters. So which organism do you think crosses the blood-brain barrier easier, Bartonella or this bigger guy? Now, it's true, proven most better research by Germany, but some research in America, how the Lyme spirochete will screw its way, no pun intended there, will screw its way through the blood-brain barrier. It's a spirochete. It's like the syphilis spirochete. You know, the reason all the kings in Europe had the crooked little nose, the enzyme that the syphilis spirochete, the trepospirochete, it's like the Borrelia spirochete, they have an enzyme that eats cartilage, and the kings all had syphilis, or a lot of them did. That's why they got paranoid eventually, but it's medical history. It's not some joke. They would lose the cartilaginous tissue in their nose. I'm sure they had a lot of knee pain they didn't talk about. You know, we see the pictures of their curved nose. But the Bartonella, huge, thick wall, and we see the protozoas in there. If you look around here, you'll see different sized protozoas. You can actually see the different sized one-celled parasites in the biofilm on this Jimson stain than you can on the other stain, quite frankly, even though the other stain, the blue stain, is what Dr. Steve Fry actually used, first diagnosed Protozoa rheumatica. Notice these smaller protozoas. And until I actually didn't meet Dr. Fry personally, talked 3 or 4 times on the phone over the last 6 years until Saturday night. He joined the group that followed me outside after my lecture, and we had a lot of fun talking about it. And again, he said, your patients, the majority of them have toxo, yet we don't see the toxo antibodies show up on a lot of them. We have several kids, lately they're playing with stray cats. Please tell your kids and you adults, don't play with stray cats. They've all got Bartonella. They've all got toxo. And your cat has toxo too, maybe. Maybe not. But your cats that are inside, I swear to God, they've got Bart. Have them tested. Look, the good vets will test cats for Bartonella, but not Lyme. They'll test dogs for Lyme and not Bartonella. They need to test for both. The veterinarians were way ahead of us on zoonotic illnesses. By the way, a recent study proved that 50% of Florida Panthers have Bartonella, but it's antibody testing. That means 100% have it. Again, hardly any of my patients test positive for antibody testing on Bartonella. The Bartonella article I wrote about, to be provocative, to get the military to test our soldiers, it was based off a study by University of California, Davis, in the military, where they tested Iraqi dogs and said 47% tested positive for Bartonella antibodies. So one night laying in bed, I wrote this little thing. It's on our website somewhere, the blog or Facebook, and it's hanging up here. But playing around, I wrote an article, is the Iraq War increasing the prevalence of Bartonella in America? Because we knew the sand fleas, desert sand fleas, were carrying mycoplasma, which is one of the few bacteria smaller than Bart, to our American soldiers in Gulf War I. And Bartonella is this tiny little rascal, so tiny. I said, surely the sand fleas are carrying bark from the dogs to our soldiers, and bark is surely crossing the placenta. So it's surely in the sperm. If Lyme spirochetes, again, the length of the red cell are in sperm, been found in vaginal fluids, and cross the placenta, all proven now. By the way, I've been saying since my daughter laid in bed in 2007 that mosquitoes are carrying Lyme spirochetes. It was finally proven by University of Frankfurt. The study came out in November of last year. Look up University, go to PubMed, look up Lyme spirochetes, mosquitoes, University of Frankfurt. Those doggone Germans. That's why they build the best cars, I assume. Although the Japs are coming on with some great PET scan studies. And so are folks in Madrid on the brain. So a lot of protozoa, a lot of Bartonella. The doctor in Philadelphia, Mark Philadelphia, who's I think a very bright integrative doctor, tested her for Lyme, which is good. But she had way more than Lyme. And Bartonella was much more of Rachel's issue, in my opinion. But we also diagnosed her with brucellosis. And when I diagnosed her with brucellosis in the fall of 15, somewhere in 14, I'm sorry, she's one of the girls. I knew she only hunted in the mall. We had 3 or 4 other girls. I'm like, good God, they're not skinning elk and deer. And by the way, you men out there, if you're hunting, you're skinning deer and elk, please glove up. You do not want brucellosis. Now, deer don't have Lyme. They have immunity to it. Most of you women probably read that and know that. Hopefully you doctors know that. Deer meat probably is the safest meat we can eat. Regarding spirochetes, I always wondered how hot you have to heat the meat. But if you're eating venison, you're probably safe from having spirochetes. But veterinarians did a study in Jersey probably 12, 15 years ago with antibody testing, 80 out of 90 horses scattered geographically throughout Jersey. 80 out of 90 were positive for Lyme spirochetes on antibody testing, which we now know. We now have proof from Drexel University, hallelujah, an American university, Drexel, up in Philadelphia, proved that antibody testing, Western blot, has 70% false negatives. So most of you folks come to me with IGenics. We used to have a test from Germany that was really good until it went bad. And so, at this point, I don't want to spend more money until you get here. I don't care what you have. We have no trouble really killing it. We'll help you kill it. Your immune system will kill it. We will add some antibiotics when we need to. But when you start busting this biofilm, and you'll see people that have been on antibiotics for 6 years, Carol, on our biofilm page, 6 years of Rocephin, IV. 6 years of IV Rocephin. Biofilm in the whole smear will not penetrate. But the Bartonella inside the biofilm will have resistance to the Rocephin or whatever antibiotic you've had from your previous Lyme doctors. Now, again, microbiologists, Montana State and other places say these organisms have developed resistance and you cannot kill them with antibiotics. Well, you cannot. You cannot normally, but you can here. If you couldn't, we would not be able to treat a foot drop and get rid of a foot drop in 10 minutes or in 30 minutes using an antibiotic. Someone who develops a foot drop because they pop the biofilm open, you have to be able to visualize that once we get your immune system working the way God intended, your killer cells and antibodies are constantly chipping away at the outer layers of the biofilm, 24/7. And you can watch women walking in here normally and talking to their new BFF, because in my practice, it's like a family. Everybody becomes best friends. You make the best friends of your life here. Every time people want to do a picture with me, we do their, what's the eyeshadow thing called?
Concealer?
Well, whatever.
Under eye concealer.
The eyeshadow thing, we do it 5 times. They're crying. They're leaving my staff, mascara. They're leaving their best friends. But they'll be talking to their best friends, sitting in one of the IV chairs, and suddenly they'll have a foot drop, or the worst ones that have a lot of brain infection might have a little seizure. You'll see me walk around this clinic and treat 9 people with emergencies in 2 hours on the worst days, and I love doing it. That's what we do here. But if the antibiotics were not effective in killing these polymorphic organisms that have stolen RNA and DNA from other bacteria, and viruses, then we wouldn't be able to do that. So my point is, microbiologists are correct that these organisms, they will tell you. You will read this on the Montana State MSU Center for Biofilm Engineering. Look it up, folks. Write it down, please. Okay? Go and read. But they will tell you these polymorphic monsters inside of us, the antibiotics were never meant to treat these organisms that have been in biofilm. They call each other into the biofilm. It's called quorum sensing. But those studies are done in people whose immune systems don't work. And so the antibiotics that we would have used wouldn't have worked either back in 2011. Okay? Because we didn't know how to unload the mitochondria from a 9 dysfunctional marker to a 0.17 like you saw in Dennis. And when you get the killer cells and antibodies don't work. If the engine in your car doesn't work because you've dumped a bunch of burnt motor oil in the gas tank, that's what it's like when the mitochondria suck these ugly fatty toxins in, and the mitochondria shut down. And by the way, the scientists who specialize in mitochondria will tell you that when the mitochondrial function drops to 50% or less, the mitochondria no longer go through mitosis. Did I say it tonight? It's all blurred because I've talked to people, 40 people today. All right. And that's where the aging occurs. You want to look young? Come look at me now as compared to a picture 10 years ago and 20 years ago. And people who knew me said, my God, you look younger every year. Well, my retinas, which detached in 2009 because of tricho in the Moldy Hospital office, my retina specialist says, my God, Rick, your retinas are getting better every year. That doesn't happen. Yes, it does, if you do my program. So look, aging occurs because the mitochondria inside your cells no longer go through mitosis, reproduce, and the cells die. It's called apoptosis. And now they're suggesting that this beginning of cancer starts in the mitochondria. So mitochondria are everything except for these guys, the red blood cells. The only cells in your body that don't run on mitochondria. Fascinating, huh? Always something to learn. Now, a map of the brain, front, the back, cerebellum coordination center. There is a tract from the frontal lobe to the cerebellum. We've known about that for several years. One more thing I want to mention. We go backwards to Rachel's caudate. The caudate nuclei, motor regions within the basal ganglia, and the basal ganglia are these guys. You can see one specked again. The newer news came out about a year and a half ago. There's always something new to learn about the brain. That the caudate nuclei are also a relay center from the midbrain to the frontal lobe. When one or both are underactive, you develop OCD. Now, this is part of the pandas picture. And no one ever says that. I met the pandas guru from NIH at the ILADS meeting, and she didn't know that, but she's a pandas expert. And I've been treating pandas since 2008. The original pandas was based on a brilliant scientist, Valdani, out in immunoscience out in California, where a strep B13 infection looks like the serotonin, the strep B13 bacteria looks like the serotonin receptor, and you make antibodies to that strep, and you make antibodies to serotonin receptors, you beat them up, and the geometric shape of the serotonin receptor is now distorted, and the serotonin molecule no longer fits well, and you get a severely overactive anterior cingulate gyrus, which gives you OCD. And I didn't know why I had some patients. Some of the Asperger's patients that I treated, I reversed Asperger's, I don't advertise for it, I guess we should, and autistic symptoms, in quite a few patients. I don't advertise for it, I can't fill my clinic with them. I will take them from the family. I've already resurrected someone else from the dead, I'll take the patient. We may start making patients, I just don't feel like writing more website pages. Here's the deal. I couldn't figure out why some of the people I treated in 10, 11, I could not get rid of their severe OCD by calming their anterior cingulate, and I would raise the serotonin to 1,500, where the average American needs 600 to 800, not what you see on the testing is an optimal level, to calm the anterior cingulate gyrus based on neurotransmitter studies I did comparing the overactive anterior cingulate with SPECT scans, which you can see on Rachel here, a little bit, overactive anterior cingulate, look at the bottom up. There's a curved region up here. And I wonder why I couldn't get rid of the OCD symptoms. And now I knew when I read that study about a year and a half ago. I'm like, oh my God. So with pets, I can see the underactivity. So the OCD traits that some of you folks have or your children have can be from a caudate infection. And now, when the caudate was shut down equally bilaterally, I had a kid from Alabama who had severe OCD from age 7 to age 20. But her caudate nuclei was shut down about 2 standard deviations. We didn't put, I'll tell you later who it is. I told her mother the first day the caudate was shut down equally, about 1.7 standard deviations. And I said, that is toxicity versus infection. And when I got her serotonin optimized and her estradiol optimized, one day I did a maneuver where I did a 6-fold phosphatidylcholine with 6 syringes of major glute, 60,000, whatever. In about 12 minutes, I reversed the OCD symptoms of 17 years. It was a very exciting thing, which unfortunately you only got half of it on a video. She was sitting with all these other young kids in my IV room. I said, my God, you kids will always have those cell phones out. Get them out. But anyway, one of my patients bought me a GoPro so we can video some of these things. But it's fascinating. Now, if that's infection, it won't happen. You will not get rid of OCD caused by this underactive cingulate, or caudate, by pushing toxins out only because it's obviously asymmetrical. Asymmetrical, left versus right, is going to be infection. It was my theory. My patients have now proven it. Okay? So if you have weakness on one side versus the other, it's going to be infection. Bell's palsy, usually it's one side. You can't hit both. It's always a combination of toxin-induced downregulation of electrical activity through fatty acid oxidation and mitochondrial dysfunction, but it's in addition to normally infection as well. And you don't know until you know. You don't know until you move the toxins out, and then you have still the asymmetry, just so you know. These are all things that I've ascertained over the last few years, working 80 hours a week, and most of these severe neurological cases keep me here on nights and weekends. Fortunately, I've now found Dr. Hellman, who's a brilliant Harvard-trained ER doc, and he's tired of ER, and so hopefully I'll be able to take vacation again. Motor region, the very top, foot, leg, arm, right hand, face. Now, you don't know if the Bell's palsy is caused by motor dysfunction in the motor strip or whether it's caused by the cranial nerve 7, there's 12 cranial nerves, or whether it's peripheral. And there's plenty of studies from Germany, Sweden, the best and the latest on neuroborreliosis, where we have dorsal horn infection that'll cause pain, i.e. trigeminal neuralgia, the 5th cranial nerve, but pain. In the lateral horn, ALS can cause motor dysfunction. So you don't know whether you have peripheral nerve infection or brain infection. And when I see somebody come in the first day and they've got a foot drop or they've got one-sided weakness, I don't know until I performed a PET scan. If you rule out localized underactivity in the motor strip, then it's more of a peripheral issue. Does that make sense? I wish I could see your faces, at least you docs. You see how I use deductive reasoning and process elimination to do my own research that no one's done. You have to, and then you have to pay attention to the patient. Okay, so we'll show you some things fascinating. These brain maps, and you'll see visual area, etc. We should put up the left side just for kicks and grins on the next one of these. We didn't do it for the meeting. Let's talk about David from Texas, left foot drop. Right side of brain, right side of motor strip. Look at that underactive region. Where's it at, folks? Go backwards one slide. Foot at the top. For some reason, I cannot tell you why, but the #1 paralysis we see is a foot drop. I saw an 18-year-old recently and didn't have a foot drop. But you ask him if he ever catches his left foot, because he had right-sided stuff here, but it wasn't this dramatic at the top of the motor strip. If he's walking up steps, he'll catch the left foot. But if you push down the foot, and use one finger, docs, I teach my nurses, look, if you use your entire hand, you may miss a weakness. Use your finger, okay? And they can't push up as strong. It's the dorsiflexion that, for some reason, that you'll see first. I can hear a woman, if she's got hard-soled shoes, I can tell by the sound walking through my clinic if she's got a foot drop. And a lot of times, if it's just a partial foot drop, they don't notice it. They don't notice that right or left foot is lifting all the way. But classic, beautiful. Is that gorgeous? I mean, what's gorgeous, folks, is a correlation. So the underactivity right there. Now the motor strip, sensory motor. The right entire sensory motor strip, let's go back here so you know what we're talking about. Okay, with me? With me, without me, like Tom Cruise said, right? With me, you're going to make it. Without me, you won't. All right, so foot at the top. Notice the entire sensory motor strip is 1.5 standard deviations underactive. It's essentially 1 standard deviation more underactive than the left. Now this patient had left-sided weakness. Notice this whole area. It's a little bit more the color change if you want to use colors. And again, I'm not a radiologist. I prefer the numbers, but a moron can see this. Even I can see that. Okay? Left side, at the foot region, look, it's dark. Perfect. No underactivity. So, beautiful correlation. I can show you 100 of these, okay? But we can't stay here all night. But this hopefully shows you. That's why Lyme doctors throughout the country are now referring me to neuro Lyme cases. And Corson. I consider one of the best Lyme doctors in America. Refers me one of her best friends. Lori, who you see around here jumping horses again. I consider Ann one of the top, just peripherally, never met her. Look at the natural medicine she uses. She refers me the severe mold toxic and the severe neurotoxic people. Look, if they just got joint pain, keep them. But you know, if you screw around with Lyme patients, they will eventually get neuro-Lyme. In fact, the German studies and Copenhagen, Sweden studies will suggest that it takes 2 years of a Lyme infection before you see the worst of the neuroborrelia symptoms. And it's once you get the cranial neuritis, encephalitis, encephalomyelitis, you know, it's just better to get here before it happens. A lot easier, you'll be here less, and you know, you screw around. Because what happens in the biofilm, the bugs keep having babies, and they eventually bust out. When the Canadian singer was a big deal, what, a year ago, whatever, in spring of 15, good God, I had 90 people here, and 100 people from, once Kamea's video went viral, from July of 13 to May of 15, we had 90 here and 80 waiting. I just cut off the flow because I couldn't find the doctor to do it right. I'm so thrilled Dr. Hellman is here. Now he's brilliant. And but at any rate, when I had like 25 Canadians here, it's always 1 out of 5, 1 out of 4. They're like, oh, we'll call that Canadian singer. I said, no. She thinks she's better. Because they use antibiotics to kill the bugs outside the biofilm. And they will kill the bugs inside the brain tissue. Like somebody I saw today got better with IV Rocephin for a while until they got worse again. But those bugs in the biofilm continue to have babies, and in my opinion, they will eventually, well, I won't go back there. Well, here we are. They'll eventually pop out of there. You see it all the time. I saw a woman today, it was very obvious that when she moved out of the mold pit in Connecticut to home in Naples, which actually was way better than her, the mold pit she was in Connecticut, and her tricho levels gradually reduced. She started popping biofilm. Of course, now when she pops biofilm, she gets nausea. Those of you, a little pearl for you, those of you that have nausea, more nausea in the morning, we kill more at night. As medical students, we were taught 30 years ago. More than that, I hate to say it. I was graduated medical school in '82. But I have better brain power and physical power now than I had as a medical student at 25 because I was toxic then. At any rate, we were taught that to look for night sweats for TB. Why night sweats? Why not day sweats? We kill more at night. And those of you who have the babesiosis, you have more night sweats at night, more sweats at night. And we bust more biofilm at night, in my opinion. It's not some double-blind study, which most of them, we can't have one guy jump out of the plane with a parachute, one without, double-blind. Double-blind studies, even a lot of the university professors are now saying that the anecdotal studies, whether or not a patient gets better is actually a better study. You know, it's been a big debate in medicine for years. The bottom line is, who gets patients better? You judge a tree by the fruit. And, you know, you can do all kinds of studies that don't mean squat. What matters is whether you get people better. And that's the studies we use. At any rate, these guys are having babies, they keep growing, but sometimes you just get healthier. And a lot of times you do various herbs that will bust enough biofilm. But those of you who are getting nauseated, and you blame your Lyme doctor for making you worse, and everybody here will tell you they got worse with their Lyme doctor, but it wasn't exactly their fault. If they actually used some herbs that helped you melt biofilm, if you had a lot of tricho in the biofilm, you release tricho, and there's a pattern where you will be more nauseated. And a lot of you have a subclinical pancreatitis. Have somebody draw your pancreatic enzymes if you have nausea every morning, and you probably have some elevated amylase or lipase. Don't wait till you've already burnt the pancreas out like a lot of the folks we see. Sad to see 25-year-olds who've been nauseated for 15 years every day, and they get burned out of the pancreatic enzymes, and we see it all the time. David, foot drop, most significant thing with him. Notice he's got posterior cingulate. Back in the back of the brain is an IQ hub. It is shut down some. It's right in here. He's got some infection there, but the visual area is not bad. The visual area extends out through here, but that's ugly looking infection. Look how localized it is. In the right or left medial parietal lobe, the parietal lobes, when they're hit hard, it's an Alzheimer pattern. The parietal association, overall, we have asymmetry. Left is not nearly as underactive as the right. If you do percentile, the right is twice as underactive. But let's look at the medial parietal, which I wish they would put up here with parietal. I don't know why they do that, but they do. Medial parietal is evenly underactive, 0.69 standard deviations underactive. Medial and medial look about the same, right medial, left medial. But we see more underactivity overall in the right, so you look at the right parietal region versus the left. And notice there's more black, which is good, light blue is underactive, yellow is terrible. So this is a problem, but see this region, again, is the infection. And this gentleman's a very smart guy. He actually went to Mexico 20 years ago for some integrated medicine. He could not get in America then, because you know how it is. If we do natural medicine, where the medical boards want to take our license. But this is the difference. This infection, motor strip, but even back here, it's more underactivity than you see here. And you can tell, on the other hand, if the medial parietal is equal and not so bad, but you see a lesion up in here, and the parietal right is one standard deviation, or left is one standard deviation more asymmetry, it's what you see with trauma. So the trauma is going to be on the lateral versus medial, and it's just common sense. This is a case from 2014. I think one of the most profound cases. This gentleman is a medical person who was so angry when he saw his PET scan, because the PET scan shows the entire motor strip is destroyed, caudate nuclei are bad, the deep, when you look at the top of the brain superior, you got to look down on the side view to see if what you're seeing goes down in the middle, okay? If it doesn't, it's more of a trauma deal, okay? This gentleman had 4 neurologists at the University of Texas. He had the top guy at NIH, who's a consultant. He's on a lot of cases for some reason. With a Lyme doctor in Dallas, and he was on Rocephin IV for 2 years, but he had no kill power. So the Rocephin did nothing, even though it supposedly crosses the blood-brain barrier better than the rest of them. But guess what? It doesn't work without an immune system that works. We'll show you what we do for the CD4-CD8 ratio. But this guy, the story is this. Now notice the sensory motor on the right, or left, excuse me. 2.5 standard deviations underactive. 1 point, is that a 9.193? But the story is, 2 years before he came to me, infection started right here. Again, black is good, light blue is underactive, yellow is more underactive, green is more underactive, and orange is just a freaking disaster. It's just terrible. This infection started here. The first thing that happened to this gentleman is his right foot dropped. Let's go back here, guys. Where is it? Oh, my bad. too impatient, I'm getting tired. All right, so left foot area is the right foot drop. Okay, so with me? I wish I could see you guys. Where we at? All right, so infection started here. Right foot dropped, then his right leg went limp as it went down through here. Then there's the trunk. Nobody notices the trunk. Who notices the trunk? Intercostal nerves, you may have some problems exhaling if you have emphysema, but otherwise you're not going to notice truncal paralysis, or maybe your abs don't tighten up as much. But the right arm went limp, you notice that, so he progressed. Right foot drop, right leg, right arm, right hand. Now, being treated all the time with IV Rocephin, but his CD4-CD8 ratio was a disaster. CD4 helpers say go to war, let's kill. CD8 suppressors say don't. It's a Bush-Obama ratio. My Texans love that. All right. You better move on. So anyway, the second year, 1 year before I get him, the infection crosses over the solstice, and then the left foot drops. The left leg goes limp, the left arm, left hand. Is that not a profound story? So the guy comes to me acting like a quad, essentially. He's got bilateral resting tremors, but notice the left caudate is down a whole standard deviation more underactive than the right. So the Lyme, he had massive Lyme markers measured monogenics long before I got him. Even the guy at NIH agreed he had Lyme. I mean, you guys all know, I hope and assume, that the CDC apologized to the world about 1.5 years ago, said we were wrong. And they actually said forget the testing. That's kind of going too far the other way. You know, that's what radicals do. They go from one end to the other. I mean, you ought to see some antibody. But here's the deal. If you have an antibody to one protein or a Lyme spirochete, you probably had a Lyme spirochete in your body. Why they ever required the 2 IgMs or the 5 Igs, whatever, this is all nonsense. And now they've said it. And I hope you know that. Unfortunately, the Canadian government and everybody in the world gated off the CDC. I think they're moving away from it. At least WHO is moving away from it. Thank God. And at least Tom Friedman, who runs the CDC, the top MD, admitted they script the Ebola thing, so they want to script the Zika thing. I don't know what the problem is, but government is government, isn't it? So anyway, this guy, obviously, for some reason, his Lyme infection hit the left side of the brain first. This area was more of a trauma deal. You don't see it coming down through here much, a little bit. And he played a lot of football. He played a lot of sports. Soccer, actually, folks, you mothers, for you, is worse for your brain than football. I've treated a lot of NFL players. They have less brain trauma than most of you, and most of my patients. Helmets work. Don't get me started on this whole NFL gig. The people that get the ALS, you got thousands of NFL players. The ones that get the ALS and get the bad stuff, they've all got massive mold toxicity. I've treated a bunch of them, and we have one go public. Bernie Kosar had some of the worst brain trauma of any NFL player I treated. Look at his before and after PET scan on my website. He had massive mycotoxins, mold toxins, terribly bad house in Fort Lauderdale, bad house in Cleveland, major petro, no infection. He only had 16 days of treatment. If you don't have brain infection, you're just full of toxins, mold toxins, and petrotoxins. We can do everything we do, and we can transform your brain in 2, 3, 4 weeks. The infections changes the equation. His Lyme markers were negligible, and all his other infectious markers. At any rate, the NFL players that have some serious problems, they've got Lyme, Bart, protomyxoid infections, and they've all got severe toxicity. I've treated quite a few of them. The ones that have just as much brain trauma, play just as much, crack just as many heads. Think about it, guys, common sense. Look at the ratio. 17 out of thousands get ALS? Come on. You know, it doesn't make any sense. All right, let's move on to that. So this guy has problems. He was so frustrated that 4 University of Texas neurologists never did a scan. At least do an MRI, which is kind of worthless compared to this, because it gives us the numbers. Cerebellum, equally down. You see the cerebellum in the back. You see infection, localized infection. You see some perfectly round protomyxoid cyst, which he wasn't, of course, diagnosed with. But he had lots of on his blood smears. You'll see in various places. By the way, the kids that play with the stray cats and have a lot of high toxo markers, we should, next time we do a webinar, show some of the kids. We got several, I got mine. And they've got little cysts all over their brain. I mean, it's amazing. And when I put them on my parasite kill will kill, it's very strong, and it will kill the protozoa in your brain. It will kill Babesia. You don't need the toxic mepron that has 2 benzene rings on it. If we have to add some eucalyptus, there's a protozoa. So he had protozoa, he had a lot of Lyme. He didn't really show a lot of Bart and the other guys, but he had massive Lyme. The MRI studies worldwide, again, I went through 12,000, October, November, December of 14, and Lyme loved the motor strip, loved the motor regions, and loved the cerebellum, which gives you again, coordination. So resting tremors, again, right, greater than left, because the left caudate was shut down way more. The sensory motor is obvious, and the cerebellum was equal, and you can see that. He had trichotoxicity. Now, we pumped tricho out of this guy, out of this doctor. Okay, here's his hygienics done before we got him. And he had a 31 band, which is a major. This one's syphilis or Lyme. You guys know it's always Lyme. I've never found syphilis. I used to measure, used to prove it to some of the wives or husbands, whatever. But I've never had a syphilis patient. I'm sure they're out there. 41 band is a syphilis, spirochete, borderline. But if you have antibodies to any of these other guys, you've had the spirochetes in you. So this is what Dr. Who's this Hamill did in 12. We got him 2 years later. Okay, he was treated by this guy, 2 years of IV Rocephin every day, progressive paralysis, et cetera, et cetera. And what a beautiful example on the pet. So that's what I call refractory Lyme. We diagnosed him with brucellosis, which he wasn't diagnosed with, of course. It's big in Texas, by the way, for you Texans. We have, I think Houston's our number 2 or 3 state. Ontario is our number 2 state now. California and Texas fight. California, Texas, New York, and Connecticut. Little Connecticut is still in top 5 usually, but New York, Massachusetts, Texas, we have a lot of Texans, a lot of California patients. Severe immunosuppression. His tricho had shut down a CD4-CD8 ratio. And just for kicks and grins, we want to show off a little bit of ILADS. Comes in for CD4-CD8 of 1.7. You should be 2.5. If you got infection in the bloodstream, that'll be 2.5 to 3. This is him at 2.5. That's what happens when you get the toxins off the bone marrow and you get more production of CD4 helper killer cells. In bilateral foot drop, weakness, ataxia, etc. Let's move on. 63-year-old female, a lot of cerebellar ataxia. These people move from being so coordinated, 5'0" tennis players, to they can't walk through the doorframe without bouncing off the wall, and they can't write, etc. Bilateral intentional tremors. You medical people have intentional tremor, and some of you folks have had your neurologist or your family doctor have you move your finger from your nose to their finger. That's intentional. That's cerebellar. Lack of coordination, severe imbalance, requiring a motorized wheelchair. So sometimes the wheelchair is because they can't, no balance. But a lot of our younger kids that have MS, they actually have a paralysis. When the myelin sheath is saturated with these toxins, it changes the EMF and it shuts down the voltage. And I saw that years ago in people, and the young kid I've been picking on all night, who's probably on the webinar, after I taught him a bunch of stuff one summer, he actually learned in his biomedical engineering course at Florida State that they proved up there what I'd been seeing, that when the myelin sheath is saturated with toxins and inflamed, it changes the EMF and it does shut the voltage down, which I would see clinically, but I couldn't prove it. They prove it in their biomedical engineering lab. Notice engineering, not rote memory, pre-med stuff. Bilateral resting tremors is right greater than left. So guys, she's either got shut down, down-regulation activity in the substantia nigra or caudate. OCD, either anterior cingulate overactive or caudate underactive. What do you think it is? Sensory motor symptoms. Isn't this fun? Intermittent left foot drop. Left-sided weakness. So let's peek. All right, so much fun. So left-sided weakness, right side. Now again, we didn't get her medicated down all the way. So to ground zero. It's hard to know when you guys have excitoneurotoxicity. All I'm trying to do is get you to neutral. So I don't have to do double back up into the numbers and show you that your cerebellum is actually on the right side. Ooh, ugly. Look at all that lighter light blue. Look closely, guys, and you can see little round guys everywhere. Protomyxoa. Mosquitoes love this woman. When I look at your blood smears, I tell you the first 5 minutes I see you. Mosquitoes love you. And if you're from Louisiana, you say, oh, they eat me alive. If your husband's with you, he will say, oh, Melinda is my mosquito repellent. I mean, you have to have some fun with this deep science. But protomyxoa love the cerebellum. They're all over the place. This would be the Lyme with an irregular deal, but there's all these little round guys, protomyxoa. Which protomyxoa? I'm not going to tell you. If you want to pay lots of money, Steve Fry told me at the meeting he'll soon have DNA sequential testing, and you can spend a fortune to know. And look, if you want to know, you got lots of money, we'll do it. But look, you learn in medical school, don't do a test unless it changes your treatment. Whether your protomyxoa is protomyxoa rheumatica, or whether it's toxoplasmosis, or one of the many other protomyxoas, I don't care. I'm going to give you the power to kill it. And when you add my parasite kill, and maybe cryptolepis, and maybe some other herbs, you will kill every gut parasite you will kill, you don't know you have, and you all have them for the most part. 95% of my patients have them. Not because they're dirty, and not because they eat dirt, and not because they go to Guatemala on vacation. They're in them. It's because you can't kill the parasites on the food. The number one cause of the rise of neurocystic sericosis, gut parasites in the brain, is everybody's on the fat of eating sushi. So all my California girls think sushi is the only health food you can eat, and New Yorkers, Texans don't eat sushi. They just let the dogs lick them on the face. And that's the larvae you can't see get through the mouth to the intestinal system. And they cross your leaky gut to the bloodstream and to your brain. We don't see any sign. These may be some of those. We're not going to go there in her. But at any rate, lots of little protomyxoa, Lyme infection. She had very positive IGeneX testing before she got here. So here is where we have severe ataxia, discoordination, handwriting, can't walk toe to heel, etc. All right? It's a tricho pattern in addition to infection. So when you add the downregulation of electrical current caused by the mitochondrial downregulation and the fatty acid oxidation caused by trichothecene, you see this classic tricho pattern. In the localized lighter light blue or white or yellow is infection in addition to the downregulation of voltage through fatty acid oxidation, myelin sheath, brain cells, cell membranes, etc., 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 etc. All right? So medial frontal lobe stuff. And but notice the cerebellum is down 2 standard deviations, but we left her a little bit over-electrified because of glutamate GABA shifts and everything else, and we're just guessing what it takes before we send you to get you to neutral. If we don't get you to electroneutral, we'll miss these. Again, you'll be all black. I mean, it's just the radiologist. Well, the radiologist now, I taught them about the numbers. They'll read the numbers, but look, I've had a lot of these originally read perfectly normal. It's all black. Kurtz was like that. All looks perfect. Kurtz still on there? We'll start taking questions in a minute. Anyway, sensory motor region. Left is more, oh, wait a minute, negative, hypo is negative, so the right is shut down almost a whole standard deviation more than the left. And you can see it, the right is got more shut down than the left, and again we had some left-sided weakness. We had a left intermittent foot drop, which would be up here. Again, we'll beat the dead horse. Caudate nuclei. Beautiful example. Wow. The right is down 0.6 standard deviation, but the left is down double that. The left caudate, look at that yellow infected area. Yellow being way more underactive than this. The left caudate. Right in the middle of the brain. That's why you look at medial for caudate. So we've got cerebellar infection. We assume it's Lyme. We didn't see markers for Bartonella and brucellosis and Q fever and rabbit fever and all the other things you guys can have hidden in your biofilm, etc. We had Lyme and we had lots of protozoa on the blood center. So, again, that's what we're going by. But major shutdown of the cerebellum, but if you add the 2 standard deviations of underactivity to the 1.5 over, the cerebellum here is shut down 3.5 standard deviations. It's more underactive than other women her age. Okay, that's what the standard deviations are about. 1 standard deviation, 33% more underactive or overactive, 2 standard deviations, 66, etc. So, classic example, severe shutdown of the cerebellum causing imbalance, ataxia, etc. Sheridan from Australia went on her senior trip, spring break, to the outback, and that's what they do in Australia. They go to the beach, they go to the outback camping. And she came back. She was a great basketball player. She starts dribbling sideways. Look at the ugliness in her cerebellum. Ouch. All this infection, deep infection. Now, she had been treated for like 8 years before I got her in Australia. We were pulling her out of her wheelchair. And something kept gnawing at me in my soul, in my chest, my heart. I need a pet. I need a pet. Didn't want to do a pet. I said, you know what? I'll pay for the pet. Got to have it. Well, turns out this area, there's hypermetabolic and underactive, light blue is underactive, yellow more underactive. The cerebellum, massive infection, worse, and we've been killing it, and she's starting to get out of the wheelchair, but darn, this area within the underactivity is overactive. A tumor burns more glucose. That's why sugar is bad for cancer. You're taught that. Mercola teaches you that. Everybody in 3rd grade wellness teaches you sugar is bad because cancer cells love sugar. We're measuring glucose, sugar metabolism. So this hypermetabolic area within an underactive cerebellum was a glioblastoma. Now, she was severely trichotoxic. Another trichothecene pattern, forget the yellow and the green and the orange, which is major Lyme infection. In addition to the tricho shutdown of the cerebellum, notice the frontal lobe's not shut down. She didn't have petrochemicals. She lived out in the country. The little pearl is if you have well water and you live on a ranchette, you got a diesel tank in the ground, be careful because they rust out. You see them rusted out gas tanks when you drive by a gas station. A pattern I see here in my Texans is they got a little ranchette, you got a diesel tank on one side of the barn and a well on the other side, and they'll have major petrochemicals. We've seen that way too often, just a little pearl. For you people with well water, be careful with having a diesel tank in the ground. Get it out of the ground, put it up on some wooden whatever so you can see if it's rusting out on you. Because it starts leaking slowly and it saturates the ground, and then you've got major petrochemicals in your drinking water. And by the way, the petrochemicals, it's not about drinking. They go right through the skin. It's about bathing in the Ohio River water in Cincinnati. And most of the water in America, the city water is full of petrochemicals. They're not measuring methyl ethylbenzenes. They don't know. But anyway, try a glioblastoma. Now, if you get a glio, you're dead in 6 months, supposedly. Ask any doctor, any neurologist, why is Sheridan 2 years later still alive and doing well? The hardest thing I've had to do in this practice is walk in the room and tell 26-year-old Sheridan and her sweet mother that she had a brain cancer. It was a very difficult thing. I said, look, you got to go back to Australia where you have socialized medicine and let them cut this glioblastoma out of your cerebellum. And the neurologist who had been working with her for years was shocked she was starting to walk and doing well, but the bad news was, and she was from Sydney. We don't see a lot of petrotoxicity. You do in Melbourne. Mia, who we took out of a wheelchair, came out of Melbourne. It's the Pittsburgh of Australia. We've had several people from Melbourne, and now they're all petrotoxic. She wasn't. Major trichotoxicity, a major Lyme infection. But here's the deal. We got our immune system working. And when you get the immune system working, you don't die from a glioblastoma in 6 months. I have a sister-in-law, redhead, of course. I never met a redhead who didn't have the mold toxin days, and she was a school teacher in Philly. None of a glioblastoma at 37. I wish I had known then what I know now. And I'm not saying trichothecene is the only toxin that causes glioblastoma, but when it shuts down the immune system, you can't kill any cancer. But so anyway, Sheridan, I found out recently, is still on Facebook, which I'm not, because I'm an old guy, with Gary, one of my nurses, who was her nurse. Isn't that cool? So I'm thrilled, and the word is she wants to come back and do some more work. But anyway, so that was a save, and so sometimes, whether you want to call it the Holy Spirit or intuition, God, something just gnawing at you that you need a PET. If we hadn't got the PET scan, we'd have never known she had that tumor. And I give Dr. Tom Fabian, the neuroradiologist I work with closely, the credit for. I said, "What the hell is that, Tom?" And he said, "Oh, it's a tumor." And she said, "Probably a glio," and that's what radiologists do, and it was. So anyway, we look at her cerebellum downregulation, and so she's like Rachel, who was a gymnast that starts walking sideways in the governor's mansion. She's dribbling a basketball after she gets a Lyme infection, walking sideways. I don't know how long this was there, but they're fast-growing tumor versus astrocytomas are very slow-growing. But she's doing well, and I'm hoping she never has an issue. But once you have a glio, it's known to metastasize quickly. At any rate, it's all about the immune system. When I tell patients in the workshop, look, when we get your immune system working, you will not only kill Lyme and BART and viruses and Epstein-Barr and all the stuff you couldn't kill before, you'll be killing cancer cells you don't know you have. We all start developing cancer cells early on, and it's more than ever. One of the big reasons is besides the toxins being direct carcinogens, is the downregulation of the kill power. Notice her visual area had some infection in it, and her visual area was down here, and she had some light sensitivity, wasn't as bad as some other people. So Denise, Louisiana, 22,000. How about that for a can't see? Some really ugly, stringy stuff. Major petrotoxicity. Look at the visual area, down 2.4, 2.2 centimeters. Notice the visual area is downregulated in activity more than any other brain region. Wow, look at this mess in the visual area, right, medial, and left. And she left here 2020, but she also had some cataracts prematurely, as I did, which comes from oxalic acid and mold metabolite. These are long, stringy guys. A lot of our women here, and men, but 83% I think females in the last study, do have these longer, stringy things, which microbiologists and radiologists at Northeastern universities would tell you, again, that 2% of Americans, and they're saying that's not even the real story, 13% of Hispanic immigrants in Southern California, 13% were proven through neuroimaging to have neurocystic seracosis. It can come from sushi. Look, sushi is raw fish, and we have a video, which I told somebody again, a video of this, the worm pulling out of the sushi in the restaurant here in Tampa. I want to play it downstairs. So people, but microbiologists, not just what Sponaugle says, but I've said it for years, microbiologists are saying the number one cause of the rise of worms in the brain are so many people eating sushi. It might be okay to eat raw fish if you have an immune system that works. You don't if you live in industrialized countries. If you live in England, Canada, America, forget it. You do not have an immune system with the kill power God intended unless you come here. So most likely, when you see these things on PET, and you put this patient on my parasite kill, they will point to that area and say, "Oh, I got a sharp pain there," versus lots of little protomyxoa around guys everywhere. And remember, in Louisiana, the state bird is the mosquito. They always have lots of protomyxoa and blood smears. They'll say they got lots of pressure everywhere in the brain. But this was based on the biomarkers we had, Lyme infection, major Lyme infection in the visual area, and the visual area is way more underactive. And these people, Denise told me on the first day, she said, "I can't see 2 feet in front of me." It was funny. She left here a couple weeks ago. I think, whatever. She's sitting next to her husband, and she started to cry as she was leaving, and a lot of tears of joy here. And she said, "Hey," I looked over at her husband, I said, "Now that you can see it, you going to stay with this guy?" And she said, "Well, now that she can see, she's going to never leave me." But, I'd forgotten, sometimes I forget how sick you people are when you come in for a consult. You people who aren't this sick, get here before you get this sick. You know, if we can correct all this mess, you people that aren't nearly this sick, we can get you out of here a lot faster than you get better anywhere else, that's for sure. She has some other temporal lobe stuff here, whatever. This is inferior, some other infection, frontal lobe, medial frontal. She always seemed to have it. She's an IRS agent, actually. And her 4-second memory was still some pretty decent activity there. Medial frontal had more infection in it. But wow, what a disaster that was. And you see it with the numbers. That's why I love the PET. The numbers mean so much more. Sensory motor, asymmetry. Now, it doesn't look terrible, but do the math percentile. She's 3 times more underactive on the right than the left. And you can sometimes see that up in here, and sometimes you can't. But this is more about showing the visual area. These people will typically have the sunglasses on until you kill the infection in the visual area. Just a little hint for you docs out there and for you patients. Quentin from PA, this, I don't know why this is so fuzzy. Major visual shut, look at the visual area. Cardiac nuclei was shut down. He had a lot of OCD. Cardiac nuclei were shut down to the left, 2.5 standard deviations. He's from that area in Pennsylvania, west of Philly. We get a lot of patients there. These people swear in Westchester County and just west of Philly. God, they swear they walk outside on a Sunday afternoon walk, and they got 5 ticks on them within a 2-hour walk. I have one of those patients here now. I said, why don't you move out of that area? I don't know why you would stay there. A woman told me yesterday she put tape on her kitchen windows above her sink, and she just watches the ticks land on the tape. I don't know. I'd be moving out of there. So visual area is the worst. This is some brain trauma. This kid played a lot of sports, and this is, we decided he had a big smack right here. A lot of times you show people areas that are up on the top of the brain, on the lateral area, more diffuse like that. We don't see infection hit those areas as much. They'll tell you exactly what happened. I got a bunch of these. When you say, one guy had a line right across like a ruler. I said, did someone hit you with something? My brother hit a baseball bat there when I was 15. The stories were hilarious. I once saw an indentation right in here, and the guy said, yeah, I had a baseball that I was pitching, got stuck in my eye. My eyesight, you see all kinds of stories. Trauma on top of the brain. This kid, his mother said he was Action Jackson, was always falling off and everything as a kid. Without the functional scans, we did not know, you do not have to lose consciousness to have bruising of the arteries. The way it works with brain trauma is that with enough G-force, the brain slams up against the skull, and the arteries will bruise. About 7 weeks after the G-force event, head to the windshield, hits it here, ice skating, you hit back of the head, you fall down, whatever. This is trauma in the back of the head, a diffuse pattern. You don't see isolated infection you do in there, not out lateral. If the arteries bruise and the blood flow, then the arteries scar down, and you decrease the delivery of dopamine and glutamate excitatory neurotransmitters, and you get underactivity. We treat a lot of brain trauma here as well. And so you get treated for all those things. This is the back of the head posterior view. Look at this area on the occiput. That is, if you fall down absolutely perfectly backwards, this is why Bernie Kosar. Look at Bernie Kosar's scan on my brain trauma page, and you'll see that the worst of his trauma was right on the occiput because he always got slammed down the back of his head. And this kid, he fell off a ladder. He fell off a roof, I think it was. I think they owned a roofing company. And he fell off a roof when he was helping his father once. Well, that's not funny. It's just the stories are hilarious. He fell in the back of his head, and I think he went to the hospital. Now, if you do fall, look, CT, CAT scan will not show you these types of fancier things. However, the actress who was the parent, the mother on the Parent Trap with Lindsay Lohan, what was her name, had a skiing accident in Quebec a few years ago, did not go for CT and died from a hematoma. If you fall and have a hard hit on your head, please go to the ER, let them do traditional CT, and rule out a hematoma. Because if it keeps expanding, an epidural hematoma, your brain will herniate, and like the actress, you would die. And so please go get that. You won't know for 8 weeks later how much downregulation of brain activity you have. Okay? So these are just some of our wheelchair people. We have a couple that aren't up there. And every one of these patients had severe mold toxicity. I actually treated 4 of these kids from British Columbia. Their house was so bad, they burned it down. Mary Lindsay is a sweetheart. She's from North Carolina. Her video is on my YouTube channel, but the people who did the video, they messed it up. They didn't show her trying to walk and falling down, so you watch her talking. And I know you people are impatient, so if you watch the whole thing, you'll see her trying to walk, and you'll see her running. You'll see Julia running and jogging now and whatever. This was, in my opinion, 80% mold and mold toxins paralyzing her, etc. And whereas more mold, and some of these people had more infection. Kamea had her right motor strip had Lyme infection, and so her left leg would dry. And so various stories. This guy couldn't sit up in his wheelchair for 3 years before he came to me July 15th of 2013. He had my record still of doctors, 211 doctors. A lot of these folks have Dr. House. There is a real Dr. House up at Rutgers. Doesn't figure that out. This woman he married later, actually he met my IV room. She's in that West Philly area where everybody has Lyme. But I told Michael, who couldn't sit up in the wheelchair for 3 years, if I do get you walking, it'll take 2 years. I don't know how long you'll be here. If you're just toxins, massive shutdown of toxins, I can transform your brain and body, have you out of here in 4 to 6 weeks. If you have a lot of infection, it can take 6 months. You don't know. I told Michael it'll take 2 years to get you walking if I can. He came July 15, 13, left at Thanksgiving. On his Facebook, he's ballroom dancing with her. He married this woman. So there he looks a lot better. When he rode in sideways in a wheelchair that first day, I'm like, good God. I asked the office manager, did I agree to take this guy? Oh, yeah, you did a webinar. Amy developed great video testimony. Amy Byers on my YouTube channel decided to do the Christian thing after Katrina went down to help the victims. They were moving into a dormitory that had been closed up for 15 years. There was mold growing all over the walls and the ceiling. She talks in the video how they were bleaching the mold, and within a month she developed Parkinsonian tremors, and she couldn't walk. Her husband had been carrying her for years. She was referred to me by the chairman or chair lady of integrative medicine, a woman I consider one of the most brilliant doctors in America, Jeannie Driscoll. Look her up. She's currently got a study using megadose vitamin C IV with chemo for ovarian cancer. She runs the integrative medicine department at the University of Kansas. But she refers me to the severe neurological cases. She recently referred me a doctor who actually went down with the Iraq deal, and I think he had a lot of petrochemicals. He flew choppers over those burning oil fields, Iraq 1, and went to hell in a handbasket at age 40. At any rate, I get him years later, but referred by Jeannie, her husband carried her from the car to my IV chairs. And I'm like, good God, it would take a year. She couldn't walk. See, the motor regions, the Parkinson's region and the caudate, when they run on dopamine, but when they shut down, you get the resting tremors. But when they shut down even more, you get the rigidity, the robot walk, like the grandmas in the nursing homes who put on Haldol, which blocks the dopamine from receptors. But when you're shut down completely, you're locked up. And she was on major Parkinson's meds, had to take her Cinemet every hour and a half. But she is a brilliant woman, and I told her, good God, if I can get you walking, it'll take 2 years. She was here, I think, a total of 16 weeks in 2014. Amy Byers, so you type that into my YouTube channel, you'll see her jogging when she left here after 16 weeks. You know, I never know. This girl was here, I think, 8 weeks. She popped out of a wheelchair. She was massive mold toxicity and petrotoxicity in Lake Ontario. Bathing in Lake Ontario water, not a good idea. So she took way less time than her colleagues like Shelby. Where's Shelby? There's Shelby from the same area. Shelby's grandfather said, none of these people from Ontario can tell you that lake's the dirtiest lake of all of them. He's a funny guy. Mia from Australia. From Melbourne, major petrochemicals, the Pittsburgh of Australia. So a lot of petrochemicals and all these petro people. Till came out of a wheelchair, that was November of 11. Severe mold toxicity. She had 5 years and $450,000. I won't mention the names, but the top LLMDs in America. She moved to 2 different cities for 3 years after the first 2 years in Colorado. And they actually had her so shut down. She still holds a record for cortisol out of the adrenals. She had narcolepsy. We had to wake her up for this picture. That was 3.5 weeks, guys. I just cleaned up the mess they made from trying to kill for years. Now, they may have saved her life with all the 5 years of antibiotics. Of course, they didn't diagnose her mold toxicity. She was so sick she had to go to the mall for 3.5 years, a 17-year-old. This is November 7th of 2011. That's December 2nd. And she went to the International Mall the night before. Was so excited. Most mothers won't get excited their daughter wants to go to the mall. Her mother was. But we just cleaned her up. We didn't have to kill anything else, per se. Major mold in her basement in Colorado, in Longwood, Colorado. Anyway, Mariah and Alicia actually put on the Lyme walk that I spoke at in June up in Hamilton area, Hamilton-Magna area. Mariah was on here 2 weeks ago. I'm trying to get her to go to medical school now. Look at her now. These girls all had black mold issues in their homes, schools, and so forth. Mariah is now doing backflips everywhere, and I had dinner with her and her parents Saturday night after the Lyme. I spoke at the Lyme walk, and she was working in a climbing wall now. Isn't that phenomenal? 4 years in a wheelchair when I got her at age 14. So these people, the commonality is, yes, Lyme disease, but they have major Bartonella and Lyme in most of these people, and protomyxoa and all the other bugs. But the common denominator is the trichothecene toxin, outrageous levels in these people. Crazy, slurred speech. Watch her video, it's a quick one. You know, between here and there, she popped so many petrochemicals out of her biofilm. They shut down her frontal lobe, and she would go out into like a fog, like a frontal lobe coma. The diesel chemicals, the petroleum chemicals I showed you earlier, those are the same metabolites you see come out of the isoflurane using general anesthesia. And I've had several kids from this area. Another kid, his father was a dentist up in St. Catherine, Ontario, and he went into several of these frontal lobe comas when they popped the biofilm. They're sitting there talking normally. Now, this is not what most people do. We've had probably 10 people do that. You better be ready to handle these people. You think you want to get their immune system working? You better be able to handle emergencies. I had to use 100,000 milligrams of glutathione on her probably 8 times, and that pulls it out of the bloodstream, but you got to pop it out of the frontal lobe, the nerves. I have to use megadose phosphatidylcholine, not what you're going to get in the average wellness center, not the PK protocol. I admire Patricia Kane, but you cannot heal these people with those levels. When they pop major petrochemicals and tricho out of biofilm all at once, they'll have seizure activity because the glutamate was surged from normal to 20. The record here now is 24,000. The old company, Neuroscience, went to 180. My patients continued to bust the meter. Years ago, they went to 250, then greater than 359. I talked to Dr. Data into doing it 2 years ago, and they now go all the way, and we have a young kid whose petrochemicals popped out of the biofilm. It was a natural gas furnace leaking in Aspen, and her mother was a neonatal nurse, thank God, brilliant woman. I treated 5 people in the family ultimately, but when the kid popped the methyl-ethylbenzene natural gas stuff, you know, us men don't want to listen. We're in denial. The wife told the husband for years, 2 years, I smell natural gas. Well, you know, we deny everything. You women always fight us and say, oh, you know. Anyway, she popped the methyl-ethylbenzenes out of her biofilm. This kid holds a record of 24,000 glutamate. The kid sitting in front of me, Channing, that you saw earlier, she's a patient, but she's a tech whiz, started working with computers when she's 4, and she's twice as smart as I ever was. She just doesn't realize it yet. She's not a genius. She's a prodigy. But she, what was your record? You had 11,000 last July when you popped a bunch of petro and tricho. It was 8 weeks ago. 11,000 glutamate. And if you don't know how to treat those people, and that's why I have, we run this place like an ER ICU. Not everybody does that. But the ones that do, here's the problem. I can, somewhat of an art, but I can guesstimate based on some markers how much, how saturated your fatty lipophilic tissue, brain, myelin sheath throughout the body, etc., liver is with toxins, with some numerical biomarkers. I measure, what is it, 520 roughly numerical biomarkers in every patient. The consults usually take 2 or 3 hours. Through process elimination, I show you what's really killing you and what's not killing you, and things you think are killing you aren't, whatever. But when I am clueless, as much as I'd like to be clueless, not be clueless, is how saturated your biofilm is with these toxins. And again, I'm the first doctor in the world to prove that the toxins are sequestered in the biofilm as the bugs spin that web. And I didn't ascertain that until April of 2012. And when I first figured out it was Carol, she's on the biofilm page. And the way I do these things, I intentionally busted her biofilm. And her husband was a PhD in mathematics. So we measured the mycotoxins and the petrochemicals immediately before and immediately after I intentionally busted her biofilm, and they skyrocketed. And we've proven it now in thousands since then. But now we don't intentionally bust it. We make your immune system work, and you start to attack it. And you can't get better unless you do get the immune system working. But problematic, and the Houston people are the worst. Everybody in Houston, they break the records on the benzene, hippuric acid, metabolites, the creosoles, because of the oil refinery smoke. And as a gentleman told me today, a friend of a patient from Connecticut, I didn't hear this before today, but you learn every day from your patients. He said all the refinery smoke in Jersey blows over into Connecticut, and I suppose it would. I didn't know they had any refineries in Jersey. I just knew that Newark was a hellhole, and they always have high petrochemicals. But where I used to say that Pittsburgh and Newark and Cleveland, Chicago were the worst, I would tell you that Southern Ontario, around Niagara, again, and it's about the bath water, ladies. Charcoal filtration is what you need, but putting on the drinking water will not protect you. You women, the sicker you get, the more you bathe in hot water, trying to open the pores of these toxins. But you're bathing in city water. If it's saturated with petrochemicals, they're lipophilic, fatty. The cell membrane of every cell in your body is 50% phosphatidylcholine, fatty, so these toxins go right through your skin, and you absorb one of these toxins bathing or showering and drinking. You've got to wrap your brain around that. So now if you live in Scottsdale, I don't see it. I don't see it in Steamboat Springs or Aspen upstream. Okay? It might be natural gas furnace, like the kid I talked about. But if you live in Cincinnati, you come down here clueless, that water that you're bathing in comes out of the Ohio River. I make your husband go prove it. And then I tell you, do you realize that that water went through Pittsburgh before it passed 20 chemical plants on the Ohio-West Virginia border, before it got to Huntington, where in Huntington, West Virginia, the Canal River from Charleston, Cancer Valley, 40 miles from Charleston, West Virginia to Huntington, DuPont carbide, they dumped so much in the water there. I had a kid there recently that burned his skin off his forehead when he took a shower. They give away free money every so often to everybody if you're 1 month old when they accidentally dump chemicals. So those chemicals dump in the Ohio River. You want to be upstream. I grew up upstream, the Potomac River, which is a disaster. My DC people are full of petrochemicals because their bath water and shower water comes out of the Potomac River. The southwest Potomac River started on our farm on top of the Shenandoah Mountain. I didn't appreciate living in Podunkville, but I live in one of the cleanest places in America. You know, you don't appreciate it when you're farming and throwing hay bales. But we had all of our beef was free range. We didn't know anything different, and our water was clean. So downstream is bad news. The arsenic levels of the Mississippi River in New Orleans are 155 parts per billion. All the pesticides, the arsenic and pesticides rolls into Mississippi from both west and east. In Minneapolis, the Mississippi River arsenic levels are 55 parts per billion. St. Louis, 25. St. Louis, I think 75. That's an old 15-year-old study, guys. But New Orleans, 150. But think about the petrochemicals that roll in all the way down the Mississippi. And you wonder why New Orleans has more bipolar people, even before Katrina. Because the petrochemicals shut down that glutamic acid decarboxylase. I've proven that in hundreds of people, thousands, I guess. So the glutamate, the electrifying glutamate can convert to GABA. Okay? And so it's causing all this cytoneurotoxicity, bipolar. I've reversed bipolar in over 3,000 patients. 1 out of 1,000 will have an elevated dopamine. Yet all the dopamine drugs are bipolar drugs or dopamine blockers. I have said for over 10 years. They're causing suicidality in all these patients with bipolar because they're blocking the wrong brain chemical. They're clueless. They being psychiatrists, neurologists, family doctors, whoever. Well, guess what? I found the study. It's on our counter in the IV room. And the study came out, when was that study? Very recently. And now the #1 cause of death in American kids between age 15 and 24 is no longer motor vehicle accidents. It's kids killing themselves after they put on bipolar medicines by the morons, psychiatrists. I've seen psychiatrists destroy so many people. They have no idea how the brain works, and they destroy people, and they're killing people. And I've said it for years. I have no idea. There was a study proving it. If you want a copy of that study, email the coordinator, and we'll email it to you. I didn't know they knew. I've been saying it for years. Any patient who's been here since 2005 can tell you I've said that. But I found that study, I don't know, several Saturday nights ago. The link between teen suicide and psychiatric drugs. Good God. Leading cause of death in children aged 15, 20. It makes me so damn angry. These morons are so stupid. But if you don't measure the brain, the neurotransmitters, you don't know. Zyprexa, Geodon, Resperdal. All right, so I got to get Catherine Bell, who brought a friend here, the actress. She spoke out against this nonsense. Did you ever email Catherine? I mentioned you didn't have time. I need to email her and get her to speak. You got to get an actress to speak with you so you get some traction. We got to stop these psychiatrists from killing these kids. They're too stupid to measure the neurotransmitters. The dopamine is normal or even low in a lot of these people. They are bipolar, over-electrified because of the glutamate GABA shift. I'm the first guy in the world to prove it. I cannot help I'm the first guy to prove a lot of things. A lot of people stole my research and put it on their website, and they pretend they can do what I do. Be careful where you go. I was a center in Naples. The kid stole all my research. He worked with me for 2 summers. He almost killed a patient went down there on the front end. Oh, it's great if I've already done all the hard work and you're through 90% of the biofilm. But if you're busting biofilm on the front end, you've got to be very careful. At any rate, here's the deal. If the dopamine level is normal, the dopamine runs the nucleus accumbens, the reward center. If you block the dopamine from the receptors, the happy D2 receptors, go to my depression page and learn more about it. They go into a suicidal depression. And most of you folks on the phone have a relative who's bipolar, because every patient downstairs has a relative who's bipolar, because you've all got mold toxic relatives. And I've seen more kids become bipolar in moldy dormitories or when they move into a basement. Do not move your kids into the basement up north when they turn 16. I know you want to get away from their friends and their music. I've seen more kids become bipolar and use drugs like OxyContin and Xanax to try to turn the voltage down to normal after they move in the basement, or they move into a moldy dormitory where the air conditioning is turned off all summer and the mold incubator just grows tons of mold, and then they move in there. In fact, the bipolar SPECT scan is a kid from 2010 from Kansas City. Bradley, you see the tricho level of 3.2. He was normal in August. By February of his freshman year, he's bipolar and crazy and suicidal. I treated Bradley and his sister. In fact, their mother is the person who introduced me to Jeannie Driscoll on the phone. So actually it was 2009, because I was going to send my daughter to Jeannie for treatment Lyme. And after Jeannie and I met via the phone call, she said, you don't need to send her to me, you're doing everything I can do, whatever. So listen, all right, we taught you a lot of stuff. I want to get through this, because I promised the people here we're going to get through this with ILADS. Okay, so people who had good questions are not on here anymore, and that's fine. Because if they didn't feel like they were learning something here, I don't want to treat them anyway. I mean, really. So or maybe they had to go, but here's the deal. I promised everybody in this clinic I was going to show them all this presentation, and it's very important. So what do you want to do? You have some people with questions. Anybody left?
Well,
not, we'll call tonight, because I'm done. I'll answer questions.
It looks like some people are on. I'll have to take the mask to evaluate.
Okay,
but my
this?
question was if it would be better to get everybody at once in a follow-up webinar at another time.
No.
Okay.
We can do that next week if you want. I don't care. But if you want to, if you have a question, email. Raise your hand on your, and we'll take it. Otherwise, we'll call it a night. I promised over about 55 people here I would work through this entire thing. And what we didn't focus on enough was the brain fog, maybe. The people have in frontal lobe. And we have a bunch of those scans. They're not in this presentation.
Right. I can
They were
get
in
to
a
that.
webinar about 6 months ago. So we'll do that. So if there are no more questions, if you have a question, raise your hand.
Give me 30 seconds.
Okay. And I will answer questions until everybody's had their question answered. Otherwise, we're going to call it a night. And we will do a webinar next Thursday. And we'll just take questions all night. That's what we did 2 weeks ago. That's what we talked about during the night. But I really, so many people in the clinic wanted to see this ILADS presentation, so we did that instead. So we need to. We'll do a follow-up next Thursday. We'll let everybody know now. We'll let send emails out tomorrow. We'll answer questions. So we're waiting.
I'm just trying to get back in touch.
You're trying to get back
with
into
people
it? That's
that-
okay. So, all right. We can go backwards and show. You need the mouse.
Right.
That's okay.
Okay. All right. Let's see. I think we have one here. I
Okay.
think Shannon. Give me one.
Shannon. Okay, Shannon. Shannon has dystonia. Is that right? Shannon, you had a question about dystonia.
Yeah, I do. Thank you for taking my question.
You're welcome.
Yep.
Dystonia, I just talked about actually, but you wouldn't have known that. And I see you're referred by Kate Kovich, who's she's here. We got a picture of her here on Porth. I call her G.I. Jane from Montana. She was referred by Dr. Thompson. Susan Thompson treats Lyme in Bozeman, right?
That's correct. Mm-hmm.
And we've had quite a few patients referred by her. But Kate moved to Tampa now. I guess you know that, right?
Yes, I do. It's very exciting for her. She's got some great
Yes.
opportunities.
Yeah, she pops in the clinic once in a while and does a little cleanup. The dystonia can come in various ways. What is it? It's about the motor regions. Those motor regions I talked about all night that break and control fine motor, they run on dopamine.
Mm-hmm.
When they're underactive from infection and toxins, they don't control, and you'll get different types of, you can get the torticollis, you can get various different things. What dystonia symptoms do you have?
Well, I got a dystonic storm 3 days into taking azithromycin, and it's face, eyes, arm, leg, tongue. It's everything except for vocal cords.
Wow. Well, what happened is the azithromycin, and this is, you took it PO, wow. We do it IV, I don't do anything PO. But you took it PO, and you had a big reaction. And the reason you had a big reaction is it actually began to kill some spirochetes or Bartonella,
Mm-hmm.
whatever we think you have. Now, I'm sure you're diagnosed with Lyme. Everybody's diagnosed with Lyme. Again, it's in both. You may have some other bugs. The azithromycin will kill Lyme. It's very good for Bart, et cetera, et cetera. But you definitely, even taking it orally, had good absorption. And when it starts blowing up, killing, you have to visualize inside your brain. When you have, let's say, the spirochetes, because that's what you've been diagnosed with so far, in those motor regions, there's an explosion in there, and there's inflammation. So what happens when you actually kill these bugs, there's more disruption. I always say there's no healing with the killing, it's a necessary evil. But there's a lot of pressure. Did you feel increased head pressure? I'll be shocked if you didn't.
Oh, it was horrid pressure. Yeah.
There you go. You had increased intracranial pressure, and if you had looked in the mirror at that time, you may have even seen your pupils dilated. I spoke earlier about increased ICP. What happened is you got an effective kill from PO azithromycin. I'm kind of amazed. It tells me you got massive infection in those motor regions. And when you started blowing up the bugs in there, the toxins released from the bugs, you shut down the motor regions more that control involuntary movement. And when you get more inflammation, and that all these cytokines go sky high, and they draw in more fluid. Like a bee sting, it hurts because you stretch the nerves because you draw in more fluid as the antibodies start attacking the foreign body, the venom. You see what I'm saying? So inside there, you start blowing up the bugs, and you got more inflammation and more swelling and more downregulation of the caudate nuclei, the substantia nigra Parkinson's region, and the lymphoid nucleus. They're all three in those basal ganglia, right?
Yeah.
So you lost control. So you had all kinds of involuntary muscle movements. I have to tell you, it's hard to impress me because we see everything here. You have severe neurological Lyme disease. Good Lord.
Yeah, well, I'm actually going to be in Florida at the end of the month, so I hope I can come to the clinic and check it out.
Please come by and meet some of the folks here. That's the best thing you can do is talk to the patients. You'll see a lot of these patients have been treated by some of the best Lyme doctors in the country. Look, it's not a slur against the Lyme doctors. It's just that when you have the brain infections, this is a whole different level. And you understand that now. Who got the zithromycin? Susan? Susan Thompson?
You know, I'm working with her now, but it was actually Dr. Rausch out of Helena. He's a naturopath.
Okay. Well, you know, I love naturopaths, and the chapters I've written have been more for naturopathic people, but they never worked at neuro ICU, did they?
No.
They never worked
clearly
at
didn't.
Yeah. This is serious stuff. And, you know, I've joked for years, I'd like to put a screw in the head. I'm joking. Measure intracranial pressure. But I can measure. You've seen me walk around the clinic looking at pupil dilatation, and I can tell when somebody needs to have the intracranial pressure treated. Look, we run this like an ICU, and you'll learn that when you come here. And when you have severe neuro Lyme, you need to be in a place where they know how to treat you. There's a girl here from Canada, Monique, and she'll tell you everything. And her family, they're wonderful people. And they're probably going here tonight, I hope, learn some more. But the first dose of doxycycline she got like 5 drops IV, and her right eye started bulging out.
Yeah.
I got a nurse from Canada who diagnosed a fungal infection. These people will all tell you, too. They all talk to you. Look, these people learn up front, and I tell them, share with each other. They all share with each other, and they learn from each other. Look, you need each other. The spiritual healing comes from meeting all these women. They're professionals. They articulate like you. They're people who are intelligent people. They work marketing, CPA, whatever, school teachers, whatever. And they're great people. You'll make the best friends of your life here. But the more you learn and you can share, they all share with each other. And, you know, it's like Susan, who wants to come here and work. She's a nurse in Canada. We have 2 Canadian nurses here. And you know, she was a cat rescue person, and I tease her about the Bartonella from all the cat rescue. But you know, she's a funny person. But she's become best friends with Julia. You know. But the point is that they all share, and Monique would share with you, and her family will share with you. Her sister's a PhD in toxicology, who convinced her to come here versus some center in Michigan. And you know, she was here the day that I started the first antibiotic. We like to get the immune system working first. And then we start the antibiotic, but when you see the right eye start to bulge, that's a scary thing. But I knew it was on the eye. We prove it. We can see it. This is, your dystonia is probably the worst I've heard of. When you're describing, was it dystonia or was it actually a seizure-like activity? Because you're describing the arms moving.
Yeah, it was, you know, it was right side of the face, arms. It's, you know, I get these storms and then I'll be fine for a while, but then I'll get, you know, it's just, it's a combination of a lot of different things, but the eye thing is, I mean, both of my eyes bulged out several times.
I was waiting for you to say that. That's why, without talking about somebody else, it's usually about you. I like to tell stories so people would speak up and talk about it. Look, you got severe infection. And we'll get, look, there's a girl who was here from Australia, and she'd been trying to kill the Lyme in the brain for 5 years. She'd been to Michigan. She'd been, these people are in and out of the country. In fact, there was an Australian doctor in the ILADS meeting. He followed me out like with the other 25 or 30 doctors after I spoke. Then I spoke to him for about 3 hours in the hallway. But he spent over $1 million on his wife He's been in and out of America, spending cash for 10 years. He's spent over $1 million at various centers. And he's a good old guy. He's a great guy. He's a family doctor, young guy. Looks like he's about 40. That's young for me. But, he's on a brainer here. You can't screw around with this kind of infection. This girl from Australia was one of the top branding people. And every time they tried to kill anything, she'd have these seizures. She'd flop out of the chair. I had to run 2 seizure medicines. Who does that in the doctor's office? 2 different seizure medicines I had to run at one time on her to get her through kills because she had so much brain infection. Guess where she is now?
Where?
In Australia, running around the country as one of the top branding experts. And she was only here, I think, 12 weeks or so. But they've been trying to kill infection in her brain for 5 years, multiple centers in America and Australia, whatever. And every time they tried to kill anything, she would start flopping all over the chair. And she did it here the very first day. But guess what? We had to get her through it. What I wanted, this is what I want to do, but you know what? I know how to get her better. And I'm wondering, did you say the face, did like the right side of your face kind of like cringe, like shrivel up a little bit, like it's contracting?
Yeah, like grimacing.
Yeah, we had a Canadian here, and she's not up here right now. She was in a wheelchair, but the grimacing, yeah, I've seen quite a bit of that. That's not really dystonia. Who told you had dystonia? Or whatever, it doesn't matter. They got lots of names for lots of things. You're having grand mal seizures because of increased ICP, intracranial pressure. I had this Canadian girl here. She's actually a big shot on the World Health Organization, and she had been all over the world trying to treat whatever. And she's fighting with the Canadian Health Organization right now because she's a big shot, whatever. And but she had the right side of the face was stripped. Just first day I met her, just all this grimacing, and it's just a scary looking thing. Monique was on that too. She's more part. And then the left arm was shaking and various things. And you know what I had to do? She had 3 different infections causing 3 different things. I'll guarantee you have way more than Lyme, but you definitely have neuro infections, and that's profound. So now that I know what you're having, we've seen it quite a bit. Is Lorraine on the website? There's a bunch of these people. I don't know. We got them. They're all. You'll see these things all over the clinic, but unfortunately, we don't have a webmaster right now. A bunch of these women they've written stories. Some of these people, God, they have these weird things every day. You can be a lot of work. I'll be honest with you. But we got to get you better. We got to get this infection out of your brain. So come up and visit us. The dystonia expert, I just got a note, is in Fort Lauderdale.
Yes, I do. I do have an appointment with a movement disorder specialist in Fort Lauderdale. So,
good luck.
but I will be driving. We will be.
I talked to Julia, who took out a wheelchair in 4 weeks, in Miami, who saw 20-some integrated doctors in Fort Lauderdale, Miami. You're kind of like wasting your time.
That's the more I learn from you, I do think that that's going to be the case.
That's not the way it is. If I sound arrogant, so be it. I hate to see you wasting your time.
Yeah.
So, for kicks and grins, I'd love to hear what he says, but you have to use some common sense, and you have to listen to the patient. And all the fancy numbers I use are powerful, but I tell my staff, go back to being a family doctor with common sense who has none of the fancy science, and ask questions. You reacted to an antibiotic. It's like the people that would react to an antibiotic pre-surgery and say they're allergic to the antibiotic. Some of them are, and some of them aren't. They actually had a big kill and a big histamine release. You, good Lord, you have a major reaction. We see this all the time. This is not dystonia. I'm not saying you don't have some kind of infection. The first thing I want on you is a PET scan. Why don't you save the money you're going to pay this dystonia expert and spend on a PET scan, or get a PET scan on your way down there, whatever, and go down and visit this person. I'd love to see that report. I'm sorry to sound so crass, but I'm just tired of seeing you people run around wasting your money for symptom diagnoses.
Yeah.
acid infection in your brain. You prove it through your story. And you get that because you have common sense. What do you do for a living?
I was an accountant, but now I can't work, so, it's just...
Smart person. So do you have any foot drop or weakness on one side or the other?
Yep, right side. My foot will drop or turn in and drag.
All right, so your left, oh, okay, there you go. That's not on you, that's not on, all they have here is you were diagnosed with dystonia. I'm sorry to laugh. You know, I see all this nonsense all the time. Was that a neurologist that diagnosed you with dystonia?
Yes.
Oh, yeah. They're always so...
But they have, and they don't, any way to help you, just, we can send you to physical medicine and get you leg braces.
You know why I have to treat all these seizure-like activities you're describing here? If I send you to the ER, the neurologists say it's not epilepsy, and they'll actually let you do this all night long. I have tried every hospital in Tampa, St. Joseph's, Morton Plant, Meese. They're such morons. And they don't. And when they do an EEG, and the entire brain is over-electrified, you women get on the internet, in 5 minutes you read about psychoneurotoxicity. I don't understand why not one neurologist in Tampa Bay, or for that matter in Chicago, actually has a clue about something that would give you global excess voltage. So they do the EEG on people like you. You go to the ER and they say there's no focal area, no one spot, hot spot, right? We call it. And so you don't have epilepsy. So they'll actually you have seizures all night long. It's so frustrating. So, I don't want to run an ER and an ICU. That's what I have to do with people like you. And you know what? I actually enjoy it. Julia, by the way, just gave her email number over chat so Shannon could call her. So Shannon, I'm sorry. You got Channing sitting in front of me and Shannon. Okay. You guys are confusing me. Okay. So Julia from Miami, who went to all these integrative doctors who didn't help her with anything, will give you her email or number so you can talk to her, okay? That's how it is. Right? Everybody here comes together as a family. And you're going to learn a lot. You know what spiritual healing starts? You immediately begin to meet all these women who have been misdiagnosed, been diagnosed bipolar. They go to Mayo, they see 15 specialists, and in the end they go to psychiatry and pain clinic. And whatever. But give Julia a call, whatever, you guys will figure that out. And I advise you not to waste your time going down there. The neurologist in Montana told you had dystonia and did what? Nothing.
Nothing. Yes. Flat out nothing.
And you've already figured out more tonight, and I can tell you're very smart. Look, I cannot treat patients who don't have the ability to comprehend deeper science. It just isn't. We can't do it. They're the ones who get through 90% of all this tough stuff. Then we go to a center in Naples where they just do a little cleanup, and they'll say that center helped them. In other words, you got to have people who understand. This is they're very sick. I will guarantee you that either your accountant office or your home has a black mold situation. Where do you live in Montana? What city?
Well, I lived in Helena, and we did find out with Dr. Thompson that there was Aspergillus niger heavy concentration.
Well, Aspergillus makes the ochre toxin. You probably have a dysfunctional kidneys. Your GFR, the liver filtration rate, is probably low. If you want to send in some labs, you had done by Susan Thompson or by somebody up there, you can look at it. But bring them when you come, and I'll do a little consult when you come here. But I want you to run around the clinic and meet some of the folks, and Julia and a bunch of folks here. They've already been everywhere else. Save your money. There's a lot of women here who spent $500,000 on wellness, integrative doctors and Lyme doctors, and it doesn't sound like you've seen that many doctors so far.
No, I haven't found one I've identified with or believe their outcomes, but except for you now. So I'm excited to come visit.
I'm excited for you because you're going to meet a lot of very intelligent women like you who are rock and roll, accountants, marketing, whatever. And, it's hard when you're a brilliant woman and you've been used to working and, good God, you women, you work and you raise the kids, and we've been in our workforce and all you guys do it all, and then it's hard when you do all that and then you get taken down. I got it that you're no longer working as an accountant. You probably have a lot of brain fog. If you do, we'll see what your 4-second memory looks like. You sound pretty quick on the phone though, but let's see. You definitely have a lot of infection in there, and wow, big response. But that's now that I know what happened and looking at this, it makes more sense. The right foot drops, the right leg is weak, and so you've got left-sided motor strip, and the facial twitching can be the cranial nerve 7. 12 cranial nerves in the brain. It can be the actual facial nerve itself. You didn't get a palsy where you're paralyzed. You just have this like seizure on the right side of the face, right?
Yeah.
It's a scary looking seizure, is it not?
Yeah, it's very, very scary. I've spent 2 hours in the ER last week just convulsing and spasming.
What the hell are they doing?
Nothing.
There you go. Thank you for validating what I said. That's why I don't send people to ER. That's why I have to have ER nurses and ICU nurses, and that's why I need doctors who can treat emergencies. And that's naturopaths. I love them, and I've written more stuff for them than I have other people. I should have 10 books. I may get time to do some books eventually, but I'd love to write some books. I'm tired of everybody else doing my research and putting in their books. But the deal is this: I love treating patients. And it's more fun to learn new things on Saturday than regurgitate what you already know. But the problem is, the average family doctor has no ability to treat these emergencies. They call 911. We can't call 911 because you'll go to the ER and exactly what will happen to you in Montana will happen to you here. And so when you get to this level of infection in your brain, you've got to have somebody who can handle all these seizures. We will treat your seizures in the clinic, and we will get you through this. Okay. I have a young kid who flopped and flipped over the bed for 4 weeks back in the summer of 15, and I had 2 paramedics that came here to work. I said, "Why are you doing all this?" Because I was running the seizure medicine on her, a catheter drip, to get her through the kills. And she had the mast cell deregulation, so her histamine would go sky high, and she'd try to go, ugh! So I had to retreat her with tricks you learn is ICU guy to block the histamine ring spasm, bronchospasm, and they came here and said, "Why are you doing this? Her mother's a bitch." I said, "I'm not doing it for the mother, I'm doing it for the kid." That kid was the last time I heard, backpacking Europe. Another one we should have is a wheelchair. I keep forgetting some of these people. But you know what? It's about getting you through it. It's not easy, but it's fun. It's a lot more rewarding than doing traditional medicine. I learned to keep dead people alive in the ICU, use a lot of medicine. I realize now a lot of the temporary pacemakers I put in people for heart block, probably half those people that had AV block had a Lyme carditis or Bartonella shutting down an AV node. I put a temporary pacer in an emergency situation. 5 days later, cardiologist puts a permanent pacer in. I've got a study from Germany and one for Sweden, where they're always ahead of America in this, but they say anybody 45 and under who develops AV block, it's Lyme carditis or proven otherwise. Well, it's also Bartonella, but that's not. And I saw an 18-year-old this week that had a first-degree AV block. It's called a Winky block. I used to teach a course on. We have young females here who actually have real chest pain and real cardiac ischemia, and they're ignored everywhere else before they get here. But we had it wrong for years. I remember as an intern and discharging a female had real cardiac stuff. Females have more heart attacks between age 20 and 40 than men, twice as many. Isn't that something? And there's some days here we'll do 5 EKGs. So we run this place like an ER, we treat the problem, and that's what you need to do. So anyway, you come by and meet my staff and me. Bring your previous testing and meet a bunch of these ladies here. You're going to enjoy meeting these folks, okay?
Awesome. Sounds good. Thank you for your time.
You bet. We'll get you better, I promise you.
Thank you.
Okay. We got an MS, Mississippi. Never mind. I thought that was MS. I'm looking at some other questions. If you have any question, there's no dumb question. I might have a dumb answer, so How many people are still in there?
58.
58 people still there in 11? Gee, I thought you people would go to bed. They must be the California people. Hey, I'll stay on here as long as you guys want to learn, but if you don't ask questions, I mean, I could go teach something different, but, you know, Shannon asked a question, and she had a great question. You learned. Some of you people out there, 58 of you still on here. How many people were on here tonight? 200?
Over 100.
You got a question?
Ask Linnea if she's available.
Linnea from Delaware. Oh, you saw me at ILADS. Okay. Very impressed. Has Lyme disease. Linnea from Delaware. If you'll unmute yourself,
She's unmuted.
Oh, you're unmuted.
I just did.
Hey, Linnea, did I meet you up there?
I did not meet you. I heard you speak.
Okay. Well, I was a little bit rushed, as you can tell.
Yes, I could have listened to you all day.
Well, thank you. I make most of this stuff up, but people believe it, so I just let you know. If you get way out there like we are, you just make it up and they believe it. It was very, you know, Leah, who was at PA, she said she'd never seen doctors flock like that. It usually happens. Look, I enjoy teaching, as you can tell, and I like teaching patients. And you can tell what we showed you tonight. You get to see a lot more of what we wanted to show you. They give you 45 minutes, and Dr. Moress, who's the new president of ILADS, he actually sends me patients, the thick neuro-Lyme people, and he apologized to me later in the evening. You know, they had a business meeting in there. Otherwise, we probably could have stayed longer. But I'm glad you enjoyed it. Are you a physician or a naturopath of some type? Or?
No, I am strictly a patient. I paid the $700 to go to the meetings to find help.
How long have you been diagnosed with Lyme disease?
I had been diagnosed in 2008, but I hadn't been bitten since 2003 that I know of. But I was living in Maryland at the time.
Okay.
And I am from Michigan on a dairy farm.
Well, I grew up on a cattle farm. You know, we used to think ticks were funny, you know.
I don't know if we had them in Michigan as a child. I don't remember them.
Well, I'll tell you the truth. Global warming, the latter-day pestilence the Bible talks about, there's two causation. The causation is twofold, in my opinion. A, global warming is happening. And ticks that were not in Canada, and the Canadian government just admitted this, ticks that were not in Ontario 2 years ago are in Ontario, and ticks that weren't in Michigan when you were a kid potentially are now.
Right.
There's a parasite called Chagas, and actually the first kudos email I got from Alan McDonald, one of my heroes, the brilliant pathologist from Yale, New Haven, who first talked about the bugs spinning the biofilm and was mocked and laughed at by a lot of people, who now is saying the ticks are carrying worms. He said, because I went on the ILADS email thing, these doctors email all night long, and I finally answered the question there. Well, they were saying how they wondered how this 30-year-old model in some guy up in New York got heart failure. And of course, they always focus on Lyme because that's the only thing they can see is Lyme on the tip of their nose. I said, well, they may well have Chagas. And I made a point that Chagas, a parasite that I would have told you a year and a half ago, and before, is only in Costa Rica, Panama. If you go to my Facebook, you have to scroll way down because things keep getting pushed down. But I put a map on there that Chagas is now halfway up the states. Good God. It's halfway up the states in latitude. It's of a parasite that they say the kissing bug gets on your face, and he goes near your lips, and he drops feces, and in the feces is this parasite. And if you have it greater than 6 months, it causes heart failure. Costa Rica's got the highest cardiac transplant rate per capita in the world. Well, it's up in Arkansas. It'll be in Michigan in another 2 years, and in Delaware in another 4. But so everything's moving north. And I diagnosed 2 kids here recently that had Chagas, and they've never been south of the border. So everything's moving north, and it takes you north. But wrap your head around mosquitoes. What I've learned from you folks, see, I used to think, going back to 2010, that the most mosquitoes were in Louisiana, Mississippi, And I joke the state bird in Louisiana is mosquito. But to tell you the truth, what I learned from Michigan and Minnesota folks is you got all those lakes. And by gosh, when it's warm enough to have a cookout, because you only get 3 months out of the year, right?
Right.
You're going to be out there, and you don't care how many mosquitoes are out there. And I've seen more. The pattern I started seeing in the lab, I mean, it's like, again, it's not like hard science. But you see folks from Minnesota, and they articulate so perfectly, don't they? They teach us Southerners how to move our tongue a little bit. But, you know, the Minnesota, Michigan people, you get all those lakes. You guys have way more mosquitoes buzzing around than anybody else. And we see way more protozoa on your blood smears than people in the South. It's fascinating. And so here's the deal. When you wrap your head around the fact that mosquitoes are carrying Lyme, horse Lyme,
That's what's fascinating is I just talked to your patient, your former patient, Leah, tonight.
you saw her brain scan earlier, right?
I spoke with her on the phone tonight.
Yeah.
And she just told me that you said that and that they proved it. That Lyme is in a mosquito.
Yeah, they proved it in University of Frankfurt. Study came out about a year ago. Actually, a tiny little lab in Orlando, Florida Research Lab, proved it about 4 years ago, but they were so tiny no one believed them. But now that the University of Frankfurt has proven it, it can't be denied. So you know, it could be mosquitoes, and I don't know. Here's the thing. You grew up on a dairy farm. You were outside more.
Yes.
You know, like, you know, we had to work, you know.
Yes.
And we were always outside getting bit by things. We had hay bales down, you know, whatever. Look,
Yeah.
you had more exposure than a lot of city girls.
Yeah.
And my guess would be that you probably had Lyme injections, an injection of Lyme when you were 5 or 10 years old. But you had an immune system that was working well.
Right.
You also had to work more than city girls.
I was very healthy then.
Sweating is good, and that's why infrared saunas are great. But you can just sweat your butt off working, you know?
I did.
And so when you were sweating toxins out, the other thing is, I'm guessing by your voice, I mean, are you 55?
45.
45. You just have that husky voice. Like Tina Turner, okay. So if like 45, you're kind of young. I'm 60. So here's the deal. You may or may not have had airtight windows and doors. If you were one of
Our house is 1820.
okay, circa 1820.
Yeah.
I'm not laughing at you. I'm laughing.
No,
at you.
seriously. And not all the windows have been replaced. So.
Yeah. Well, what happens is the basement was always full of mold. The gas would come up. Before the airtight windows were put in, it's like in Europe. They got these 1,600 buildings. These people work in these government buildings, and it's just incredible. So when you were a kid, you sweat the toxins out, and you probably had the windows open a lot in the summer. You probably aired out the house a lot more.
Right.
I suggest to you that you had a Lyme injection from a mosquito or tick as a kid, but a healthy immune system. It's like the chickenpox virus. I have kids in my clinic, 30-year-old females, had shingles 4 times by age 22. Is that normal? No. Why do we think old people should get it? Because they say their immune system shut down. It's just 7 decades of collecting toxins. Look, severely mold toxic kids will have shingles 4 times or 3 times by age 18. The virus is in the system. It's in the nerves. It's in the body. It's all about your Army's kill power. So, in my opinion, you would have already been injected with these bugs, just like cowboys were injected, sleeping on the prairie, sleeping against trees,
Right.
whatever. But they didn't have mycotoxin accumulation. You probably had the windows open in the summer. You probably didn't have airtight windows and doors when you were a kid.
No.
And so you
No
would
air conditioning.
thank God, the air conditioners are one of the biggest problems. At least when they leaked outside the window in the old days versus leaking above the ceiling tile, they didn't cause mold to grow above the ceiling tile. So I would suggest to you, if you've had these infections for a long time, it doesn't really matter. It's just that once you have your immune system shut down, suddenly those bugs that are, quote, dormant, like the shingles virus, chickenpox virus, they start to win. We're in a battle against, like Epstein-Barr, we're in a battle against these viruses. I say every kid by age 15 hit the door handle on the high school door or middle school door, and Epstein-Barr, if you do Epstein-Barr antibodies, 95% of Americans have them. But who goes down with mono? Only the kids with no immune system. So you probably have an immune system that worked very well throughout your childhood for multiple reasons we talked about. So, I just can't believe you escaped being infected with these things. So you probably had it. So in my opinion, when you started getting sick, and then you get diagnosed because everybody's looking for Lyme, it may not even be your biggest factor. But I would suggest to you that your immune system is shut down. The first patient I treated that was a non-family member, I treated my daughter first in 2009. The first patient I treated after my daughter is from Maryland. I pulled him out of a wheelchair, but he's the top NCIS clearance. When he retires, he'll be on my wheelchair page. I've treated 5 people in his family. His father, Howard, is on my Parkinson's page. His sister, an internal medicine doctor, was disabled at age 39. I treated her, Julia. Tried to hire her. What a sweet woman. Mold toxicity. Look, the entire family had Lyme and everything else. And Howard had major benzene toxicity. He was the top nuclear physicist in the Navy at one time. His son is in charge of the installations for all these fancy tech things that they can hear us talking right now. And I treated his nieces, his nephews, his brothers, and whatever. But the whole family suffered from severe mold toxicity from basements in Maryland. You probably had issues in your home in Maryland, or maybe.
Oh, I'm sure. Yeah, it was an old house in Maryland.
Was it an old house there? Are you a blonde or redhead?
Brunette.
Brunette. But let me rephrase that. Are you English, Irish, Welsh?
Yes.
Yeah.
Welsh.
Welsh.
English.
One of the highest prevalence of the mold toxin genetics is English, Irish, Welsh. I wrote a press release years ago. Remember when Catherine Zeta-Jones, she's Welsh.
Yes.
That's bipolar 2.
Yes.
Press release. Of course, it got no traction because nobody knows what I'm talking about. I said, she's not bipolar. She's mold toxic from the Upper West Side condos. I've had a lot of people from those Upper West Side condos, and they're all mold toxic from the people upstairs. It's all those women upstairs running the bathtub over, and the mold's in the floors. But anyway, you want to get some of these people and fix them. You guaranteed you got more toxic. Problem is, the symptoms of Lyme disease and mold toxicity are very much the same. What are your symptoms?
I have most of the class. See, I was diagnosed with depression and things like that at a very young age, and tried to suicidal, rageful, all that at a young age. But then later, I started the different, Lyme, the fatigue, the joint pain. I've had 20 surgeries.
I'm sorry. Hang on one second. I want to skip to some slides and teach you a little bit. What age was it the depression first hit?
I was 13.
Okay. Now hang on a minute.
Yeah.
When did your period start?
Probably around then.
Okay.
My mother took me to a nurse practitioner because PMS back then was laughed at by doctors. So she took me to a nurse practitioner that gave me progesterone.
Okay.
I've been on progesterone for all these years.
Well, here's the deal. Were you a heavy bleeder or a painful bleeder?
Not until later, no.
Okay. Estradiol turns on the bleeding, progesterone turns it off. Estradiol enhances the enzyme that converts tyrosine to dopamine. It's called tyrosine hydroxylase. Progesterone activates the GABA A receptor like Xanax. Go ahead and hit that, nucleus accumbens. I stay right there. Okay. So inside of the nucleus accumbens, go ahead and hit this one more time. Yeah, hit that slide. Okay. The nucleus accumbens is our pleasure center, reward center, and I've been talking about it since 2000. And actually, 50% of the depression is caused by an underactive nucleus accumbens. Now, and you can inherit less than normal, flip backwards to the D2 receptors. You can inherit less than normal D2 receptors. I call it the happy receptor. It's circled on the slide.
Right.
Now, I have proven, this woman's using cocaine. Cocaine is a spoon. Those wagons, they're called dopamine transporters. The way it works, electricity comes down to the first brain cell, nerve A. And dopamine and other neurotransmitters are released to the synapse, and it activates the D2 receptor inside of the reward center, and that's what turns on the electricity in the nucleus accumbens. Now, eating increases the D2 activity 3 times normal for 90 minutes, orgasm 10 times normal, and the cocaine she's using, which blocks the dopamine, oh, there you go, good deal. That's a UVA study from 2005. Flip back to the other one. Eating will, or cocaine will block the dopamine out, increases the electrical activity 100 times normal for as long as it lasts. Now, if you inherit less than normal D2 receptors, you're a little bit more of an Igor. You can inherit 10% less. The gene is called the DRD2A1 allele. I've been talking about this since 2000. They call it now reward deficiency. They got a lot of fancy names. Bottom line is you inherit less than normal receptors. If you have that, you were never as excitable about your high school graduation or your Christmas presents or Hanukkah presents or whatever.
No.
Were you that person that you actually didn't get as excited about things as other people?
No, I'm very, no. Because we weren't allowed to get excited at home.
Oh, you weren't allowed to get excited. Okay.
You know, my dad was very angry and rageful, and
Oh, okay.
we
Well,
were not allowed to be loud or,
okay.
yeah.
Well, here's the thing. You can inherit less than normal D2 receptors, but if you're in a home where you're kind of being abused a little bit, or you're feeling fear, then you can develop, you actually can, through acquire, you actually have diminished D2 receptors because you don't develop as much of the D2 receptors within the nucleus accumbens. But I haven't talked about this for 5 years. I've been talking about this since 2000. I love talking about the brain. The heart was my first love. I got bored with it. It's a 4-chamber water pump. The brain's fascinating. Look, did you get more of the seasonal affective disorder as a kid, as a teenager, where when the skies turn gray, you look more sad?
Probably, because like in the summer and stuff, we're always out. We were more outside. You know, your harvest. I mean, this is harvest season right now, so
Sure.
we would normally be outside. But I had to get up at 5:30 every morning to go out and milk cows, whether it was 20 below or whether it was 100. So
That'll make you depressed.
I was depressed. Yeah, and that was from 6 years old till I left for college.
Well.
So I was very depressed there anyway.
Yeah, I always wondered why those darn calves always came at 2 in the morning when it was 10 below.
Of course.
In Virginia. But anyway, here's the thing. You may or may not have inherited less than normal D2 receptors. But one of the things we've proven, let me go to another slide here. That's okay. Let me just go to, where are we? I'm trying to find the, let me go back up here. Okay. Now, where's the slideshow? No, they're here, right there. Okay, never mind. We switched. This is perfect. D1. No, that's not it. All right. Give me a second. Where is my D2? Right there. Okay. Here we go. So, what my research has proven is that trichothecene blocks the dopamine from the D2 receptor. Now, here's the way it works. When I measured over 6,000 trichothecene levels, when we have patients come in with a major tricho level, or they would pop big tricho out of their biofilm, they would go into a sudden black hole. And if I do a mega detox and grab those toxins out of the bloodstream, I can bring them out of a suicidal depression in 15 minutes. It's amazing. Now, you don't change the receptivity. You have to have optimal testosterone, by the way, and that's European science, for dopamine receptivity to be optimal, and optimal thyroid, etc. But we've seen this pattern over the years where big tricho hits will block the dopamine from the receptor. You suck it out quickly, and all of a sudden they're happy again. Now, to extrapolate back to what I've seen clinically, German scientists have proven that, where's the tyrosine? I need a slide. German scientists have proven that, let's see if we can find it. We got 700 slides, beautiful. That the T3 thyroid that activates the mitochondria is the trichothecene sits on the receptor and blocks the thyroid from the mitochondrial receptor. Another mechanism by which trichothecene can shut down the mitochondrial function. Tyrosine, if you add 4 iodines, becomes T4 thyroid. Okay. So bear with me. Tyrosine then looks like dopamine, almost identical in molecular structure.
Okay.
And it also, so tyrosine and dopamine and thyroid are almost identical in structure. So if a toxin can block the thyroid from a receptor, if a toxin will sit on a receptor, now, where do we get there now? Too many slides. If a toxin will block a certain molecule from a receptor,
Right.
it is very likely, is it not, that it will also block a similar molecule. A molecule with a similar structure would also be blocked.
Of course.
Does that make sense? Thank you. You
Yeah.
got obvious common sense. Farmers always do. All right, so here's the deal. If you were trichotoxic, and furthermore, trichothecene shuts down this enzyme, tyrosine hydroxylase, and I would see that years ago in neurotransmitter patterns where suddenly the tyrosine would go to phenylethylamine. Oh, I'm sorry, I forgot the microphone. But at any rate, we're moving around a little bit here. It's just exciting stuff. You got to know the biochemistry to know what's going on. But the Japanese neuroscientists recently proved that tyrosine hydroxylase is shut down by ochratoxin, which comes out of Aspergillus molds, and by the trichothecene. So you shut down the tyrosine hydroxylase enzyme, you make less dopamine, so your reward center will shut down.
Right.
But then you also get a blockade of the dopamine from the receptor, so that nucleus accumbens will shut down. And so, you know, all of a sudden, you've got depression. The winter and the seasonal affective disorder thing, and I wrote about this 6 years ago in a book called The Road to Perfect Health. It's in the depression chapter, which is on my website. And I wrote about the fact that the folks who inherit less than normal D2 receptors, and research which actually came out of America, out of the NIH, proved that you can inherit down to 50% less than normal through this gene, the DRD2, A1 allele, okay? But we see there's also research that proves if you're in a home, or even if you're in a marriage where you're being abused verbally, or you're being abused verbally as a child, even more so, when you're still developing the brain continues to develop in females to around age 21, in males till 25. We're a few years behind you, particularly in the frontal lobe where the judgment is the fact. But the fact, yes, ladies, by age 17, you're much more mature than we are. That's the way it is. Okay. Oh, by the way, I like to tell people in my workshops that you ladies will get a kick out of this. Since you stayed on here this long, you deserve to poke your husband with an elbow. Every brain starts as a female brain, and on day 56 with male chromosomes, there's a surge of testosterone that kills half the brain in all seriousness, and it becomes a male brain. So you see, we're supposed to be as goofy as we are. And so forth. So there's a lot of plays in this. You may have inherited 10 or 20% less D2s. You may have had less D2 development because you were in a home where you were in fear all the time.
Right.
If a child is not nurtured by a mother, they can actually have less D2. So that's called the plasticity of the brain.
Okay.
In fact, the studies were done on rhesus monkeys. Rhesus monkeys have the same brain as we do up to the prefrontal cortex. We have a larger prefrontal cortex, which is supposed to separate us from being animals. Our cats and dogs run on their emotional center in the midbrain, and we do if we don't have a good prefrontal cortex. But anyway, studies were done where they just moved the alpha male in a group of 13 monkeys down to be a regular guy, but bring in a bigger chest beater, and his D2 receptors will drop by 50% over a 6-month period. Is that fascinating?
Right.
So you're just moving a guy from president to one of the regular cells. I mean, it's ridiculous. But a bad relationship will drop the D2s. This is what happens, the D2 dropout I've talked about for years, when you lose a loved one, or you go through divorce, or you get a cancer diagnosis. So that's the plasticity. But if you were in a home where you were kind of afraid and you weren't allowed to show emotion, it's very oppressive. You know, the oppression can cause this as well. But then again, there's a big play going back to whether you acquired less D2 receptors or inherited, maybe you inherited 10% less. We don't know at this point. I mean, but by the time you graduated high school and you had 3 girlfriends and they're all going, ooh, ooh, and all, yeah, excited, and you kind of look at them like, well, why are they throwing the hat, but you threw it to fit in? One of my old questions years ago, you kind of threw the hat. You didn't really feel the excitement?
No, never.
Yeah. Okay, then you probably inherited less than normal D2 receptors. And what I explained in my workshop, which is much better than being here, where I can't see your faces and see if you're getting it, is that if you inherited less than the optimal level of D2 dopamine receptors in that pleasure center, then you are more prone to depression when you develop toxicity. Toxicity that will shut down the production of dopamine or block the dopamine from receptors. The other thing is, if we can find some nutritional, the other thing that happens with trichothecene, and the best researchers at the University of Marseille in France, I read the first studies in 2008. They got some repeat studies in 2010. Look at this woman, a sweet Mennonite woman from Kentucky. I treated in 2011. Look at her nutrition. She's in the bottom 0%. This was the fireplace flashing, a common cause up north of black mold in a family room wall. And you don't know it, but you're leaking around the fireplace flashing up on the chimney. So a family room wall full of black mold, and the tricho had destroyed her intestinal transporters. So these essential amino acids, the way God set it up, they're essential. It means you got to make them. You got to eat them. But you have to absorb them.
Right.
People in my clinic are down in here usually, a lot of them, and they're eating absolute perfection of proteins. Methionine becomes SAMe, and you need SAMe for a lot of things. You put a methyl group on there for detoxification pathways to make serotonin, dopamine, insulin. Phenylalanine becomes tyrosine, which becomes dopamine, but it also becomes endorphins.
Which is funny that you talk about nutrition, because obviously growing up I ate well, normal vegetables from home and our own meat that we did not put hormones in. But my dad used a lot of chemicals on the field.
Sure.
But when I was in the University of Michigan hospital and they gave me MSSA and with a shot, and they told me I was malnourished.
When was this?
From University of Michigan.
So how long ago was that?
This was probably 2012.
No kidding.
I had 2 hip replacements, and they gave me MSSA with a shot as a diagnosis, an intra-articular shot, as a diagnosis for my surgeon. And my sister works there. She didn't want them to give me the shot. She said, why can't you just do an MRI? Well, they gave me the shot, and 2 days later, I couldn't walk. I was in the ER with MSSA. But in the whole month, I was in and out of surgeries and washouts, and they said, some tests, they came back and said I was malnourished.
Well, here's the deal. The trichothecene destroys the transporters in the intestinal lining. In the French university, you have to study from all over the world, and I've got closets full of studies. The trichothecene gas, it destroys the transporters and destroys the intestinal lining more than any other toxin. And so I call this tricho gut. So you can eat proteins all day long, but you can't absorb them. And problematic with the phenylalanine, this is one of the lowest you'll ever see in my clinic, but it's ridiculous. I mean, it's the bottom 0 percentile. You want to be up here in the 100 percentile, and that wasn't God's high. God's high would be over off the slide somewhere. But anyway, this guy becomes tyrosine, becomes dopamine, if you inherited or acquired because you were oppressed a little bit, less than optimal D2 happy receptors, then you develop these nutritional deficiencies, and you can't absorb the phenylalanine to make the tyrosine to become the dopamine. Then you have less dopamine production. You go into a deeper black hole.
Right.
Now, let me talk to you about your hips. I had to read Chinese research on a Saturday night years ago to learn that trichothecene kills the chondrocytes and chondroblasts that repair the cartilage. And so when you read these things, you realize that these kids who break their wrist skateboarding and have 6 orthopedic surgeons because they have non-union, they won't heal their trichotoxic. I had a professional tennis player, and she was one of those hot shots. I should get her to go public now, but she comes here as a prima donna about 5 years ago, won't do testing. Well, I'm going to see if this guy's a smart guy. Anyway, she came out of 15 Grand Slams everywhere, broke her wrist 6 times playing tennis. And I looked at her, little narcissistic, which she was, and I said, you know what? You haven't served any harder or any more than any other 30-year-old girl on the circuit. Do you think? She goes, well, no, I guess I haven't. I said, I will prove that your Miami Beach condo, she lives on Hotty-Toddy Fisher Island, is saturated with black mold infestation, and any other house you own. She had a house in North Tampa up by where she trained years ago at Saddlebrook, and it was full of mold. Alan from Mold Matters said it's the 2 worst places ever seen. Now, point being, you had hip surgery at a very young age, dear, because you have weight-bearing joints. Now, Lyme doctors are so hyper-focused on Lyme, and the Lyme spirochete, again, does have an enzyme that destroys the cartilage. But I would see way more cartilaginous destruction in people who've had massive trichothecene exposure to hidden black mold, or not hidden, but I would guarantee you, Lyme disease does not do this.
Really?
The ILADS docs will try to convince you it does. Lyme does not destroy the gut lining.
I felt they were trying to. I heard somebody say something about that at the ILADS.
Oh my God! They think Lyme causes everything. Look, when you have somebody who does not have trichothecene toxicity, they've got the massive Lyme markers, which is rare. But when you do see it, their nutrition's up in here. Okay, in the 85th percentile, not down here. If you don't read research from all over the world, you don't have a clue what's really causing. They think the Lyme's shutting down the immune system. Well, it can. But the tricho shuts down the immune system way more, so you can't kill the Lyme. Then the Lyme does suppress the immune system. So there's a horse cart thing. Look, Lyme disease, take somebody who doesn't have trichothecene poisoning, but they've had massive tick bites, and they'll have great nutrition, eating perfectly, neurotically perfectly like you women do when you get sick, and they'll be up in here versus down here. So a lot of things are going on in you, and so see, there's a dopamine level that you would be, if the more of this malnutrition you have. So I would suggest to you your premature hip surgery. You had replacements on both sides.
Yes.
Now the problematic is then you got these general anesthetics. It sounds like you had numerous surgeries.
I had 20.
20 general anesthetics?
Yes.
Good God.
I had, they said I was born with hip dysplasia, and I was bone on both sides.
Well, they think you're born with it.
Right.
Really? Well, you know what?
Hip
When you're running
dysplasia.
around the farm throwing 40-pound hay bales, your hips worked pretty well, didn't they?
Yes, they did.
Did we just rule out that you were born with hip dysplasia?
That's what they said, yeah.
I'm saying to you, though, like the other lady, Shannon, let's use some common sense here.
Yeah.
If you were born
I was the best athlete at school. I was the strongest. I was the fastest because I worked every day.
Golly gee whiz, how'd you do that with no cartilage in your hips?
Right.
I'm sorry to sound so arrogant, but that's stupidity in American medicine. Now think about what you just said. You were born with hip dysplasia. You had no cartilage in your hip joints. And really? You could run and be the best athlete in school. They have no common sense.
Right, and he runs the trauma department. You of them.
You know, of course, the bigger the name, the dumber they are. That's the way it works. The bigger the name, the less they have to learn. Look, it's a lack of common sense. I don't know why it is. I think everybody should have to go to the military for 3 years before they're allowed to go to medical school or work on a farm. For God's sakes, work somewhere.
Work on a farm, yeah.
Go
It's
and
probably
sit-
worse than the medical.
I had medical school classmates that never worked a day in their life. They went to camp their whole life and they didn't study. I don't know. But common sense, see, if you had hip dysplasia, they told you had no cartilage from the time you were born. How the hell did you run and play all the sports?
Right.
All you got to do is have the common sense of a good old family doctor who would ask you questions. So you obviously didn't have a lack of cartilage in your weight-bearing hip joints from the time you were born, or you wouldn't have been able to run and do everything you did, basketball, whatever you did, you know. So you developed all this later. Now, I don't expect this person who's a chairman or whatever to know that to read any Chinese research on his Saturday nights or Saturdays. I'm sure he's playing golf or whatever, like normal people. But I would expect him to have enough common sense to ask you a question. Did you have trouble walking when you were a kid? And you'd have said, no, I played all these sports and I was the best athlete in high school. I mean, it just amazes me. So what happened is trichothecene started destroying the chondrocytes and chondroblasts that repair your cartilage. You can't make new cartilage. Then you get this nutritional. Guess what the number one herbal is that you need for repairing and manufacturing new cartilage? SAMe. Everybody knows what SAMe is, I hope. I can't see your faces.
No.
If you add a methyl group, like carbon and 3 hydrogens, to methionine, it becomes SAMe. And SAMe runs around the body and it donates to methyl group for various chemical reactions. Okay, and one of them is in the manufacturing of new repair and manufacturing of new cartilage, dear. So once the trichothecene has a direct destruction, killing the chondrocytes and chondroblasts. Then it destroys your gut lining, and you can't absorb methionine and all these other nutrients you need. And if I got below here on amino acids, and I don't know where we'd have to go to find the second page, but there's a lot of other things, obviously, that you need nutritionally to make the cartilage. We don't have, that's okay, we don't have to go there, I guess. But, you know, you're getting the picture now.
Yeah.
And then back to the depression thing. Now, the other thing that causes depression is the depression comes from 2 brain regions: an underactive nucleus accumbens or reward center, or an overactive. Find me if you can. The deep limbic. You know my cingulate slides. I did the best original research on the gut-brain connection, which is on my website. You see that emotional center? That's why we need to show the. Oh, good. Show this one. Okay.
Yes.
All right. So, thank you. This would be once I did all this research in 2006 and 2007, measuring the brain chemicals, the neurotransmitters, and using the specs, sending people to Amen Clinic. And actually, I didn't have to send that many people because you're kind of a dork if you can't add up all these things. You don't need to do a scan on everybody. You do a virtual scan. But bottom line is, the more overactive this deep limbic system, it's called,
Yes.
it stores our emotionally charged memories. And the more overactive it is, the more depressed you are. And that's why a lot of women develop these symptoms during the premenstrual period, because the premenstrual period is where estradiol falls to the lowest level. And so if your estradiol falls much below 60 pgs per ml, the serotonin doesn't fit the receptor. And you can develop this overactive deep limbic system, makes you moody, irritable, negative, depressed, less social. The Asperger kids are just on fire here, and they look at the ground when they talk to you. There's so much social anxiety. In fact, I had a girl from British Columbia who was going to drive 50-some hours because she couldn't get on a plane. She had such severe agoraphobia. It comes out here. Rain Man looked at the ground. Remember the movie Rain Man with Tom Cruise?
Right.
They look at the ground when they talk to you. Now, a lot of Lymies get the antibiotic debacle and the overgrowth of Klebsiella, Proteus, and Interbacteriaceae. In 2012, I wrote a chapter for naturopath Brenda Watson explaining how those 3 bacteria move in the small intestine and still the tryptophan and make a toxin called kynurenic acid, which we measure, but still the tryptophan gives you serotonin deficiency. The Lyme spirochete will still tryptophan and make quinolinic acid, which activates the glutamate receptor. But either way, you get serotonin deficiency, and it's taurine. Taurine deficiency, I had to figure it out years ago. I could quiet this cingulate Anterior cingulate that makes you worry, stubborn, hyperfocus on negative. It's about serotonin deficiency and or, in the female, estrogen deficiency. But couldn't get this guy quieted down, so I had to read deeper neuroscience. This is back in like 2006 and 7, to ascertain that these nerves within this region are GABAergic nerves, GABA nerves. Well, it turns out that GABA receptivity relies on serotonin and taurine. The mechanism by which serotonin and taurine calm the brain is more about enhancing GABA receptivity. So the GABA molecule, like say Xanax, activates the GABA-A receptor in Klonopin, in Valium, and so does progesterone, by the way. But at any rate, taurine deficiency, which is normally caused by candida, which I explained in a 2010 chapter I wrote for Brenda Watson on anxiety, and you have those chapters on the website.
Okay.
But the more deficient of serotonin and taurine you become, the more overactive this region becomes. Now, my question to you is, the more overactive or over-electrified it becomes, the more depressed you get. So when you became depressed around 13, my question to you is, did you have quite a few visits to a pediatrician because you had ear infections or throat infections, or were you healthy and didn't have those?
No, we went to the pediatrician a lot.
Okay, thank you. You answered my question. It's all my history and physical. I hope there's still people in there learning. So a few people on there? How many? 45. These are tough people, aren't they? It's midnight. Let's go. We're just getting warmed up here. All right. See what happens when you get your brain? I'm 60 and I got the energy of a 20-year-old. Okay, here we go. So this guy overheats the lower these guys get. And that's all research that I've done, and written. I gave Brenda lots of stuff. I give everybody stuff for their books that don't have time to write mine. So you went to the pediatrician enough. You got that sweet-tasting bubblegum amoxicillin, right?
Yeah. Yes. So
you developed SIBO, small intestinal bacterial overgrowth, as a kid. And the bacteria that I described in the chapter went into a book called The Heart of Perfect Health. And she had some brilliant doctors. Other brilliant doctors actually do some chapters in that book. But just go to my website and print out the chapter I wrote for her where I described the deeper biochemical mechanisms by which you develop from the bacteria serotonin deficiency, from tryptophan theft, and then candida caused taurine deficiency. And I explained that mechanism in a 2010 chapter. It's under your anxiety chapter. Print those out so you can circle things. But you'll see yourself in there. So the lower these guys get, the more overheated this gets. So by age 13, you had enough antibiotics. See, what happens, you start getting the antibiotics by age 4, 5, or 6, or 8. And once you start developing, they destroy, God's good bacteria, lactobacillus, bifidus, etc. And so then the lactic acid is no longer produced, the pH in the gut goes up, and the gangs move in, including the candida. The candida causes a taurine deficiency. The mechanism I won't get into. You guys can all read that going to my anxiety chapter on the website. So this is where the gut toxicity changes to brain chemistry and the brain scan. So you would have developed, see, once you start developing the overgrowth of these bad guys, unless you treat it, and diflucan will kill yeast, but diflucan's weak compared to, and toxic. So we don't use any of that. You can kill these things, these bad bugs, with the right combination of the proper herbs. We have no problem at all killing yeast and bad bacteria in the gut. It's like, it's a joke around here. With a product called Gut Cleanse that I developed. We're out of it because the company that made it for me in Vancouver sold to a bigger company, and suddenly when we spend all this money I didn't have to buy the herbs, we got another company that's going to make it for me to be here by December 27th. Everybody's saying, when's your gut cleanse coming back? But you got to clean out your gut. Once these yeast and bad bacteria get in the small intestine and the colon, they just keep having babies. And so you, over time, from age 6 to age 13, you would have had more, you continue to have the processes that are going on continue to get worse. It's like the woman who goes on Klonopin or Xanax from a doctor 5 years ago. Very common knee-jerk reflex we were all taught, treat the symptom when they're overactive here, and they always would come in and I detox thousands, and develop the painless detox, and they say, well, you know, I tried to go off that Klonopin that doctor put me on 5 years ago. It made my brain, it hurt my brain. I had way more anxiety after 5 years on the Klonopin. I would love to blame Big Pharma. It wasn't the Klonopin destroyed anything. I would love to blame them, okay? I hate Big Pharma. However, it's that the yeast and the bad bacteria in the gut, that process got worse every month and every year. So you develop more problems with more serotonin deficiency and more taurine deficiency in that 5-year period. And actually, GABA throughout the brain doesn't work well without the taurine. Taurine actually is 50% of the free amino acids in the heart. And when you have severe taurine deficiency, like a young kid I saw this week, you actually have cardiac palpitations. It calms the brain, and excuse me, the heart. It's a major. So when I see severe taurine deficiency, even in a 20-year-old female with major candida overgrowth, if she's got taurine deficiency and potassium and magnesium deficiency, which all come from excessive candida, and I've written all about that, guys, in the anxiety chapter, that young kid will have cardiac arrhythmias. She'll have palpitations, PVCs and stuff. It's fascinating.
So the antibiotics, so they put me on the antidepressants at 18, and I've been on every kind there is, and now I'm on 3 different ones.
Oh my God, that's my joke.
Top of Xanax and Zolpidem.
We'll get you off all that junk. Here's the deal. I love treating the brain. I love treating you.
Because, I mean, you know, it's like, it's really getting ridiculous how many pills I'm taking. And it's none of it's getting better. It's all getting worse.
If you read the chapter I wrote in 2010 for Brenda in The Road to Perfect Health, you got it. I explain how these drugs do not make one molecule of serotonin. Can you believe doctors actually think these drugs make serotonin? I explain in that chapter in her book, The Road to Perfect Health, that, again, print it out so you can circle it and use it like a workbook. All they do, see the green bulb?
Yes.
Okay. They just sit on the recycle wagon, the serotonin transporter, and block the serotonin from going back inside the storage unit. My dear, I used to get these women from Houston and Boston, and my God, they're on 3 of these things. Haven't seen that nonsense for a while. You're seeing some real morons. Here's the deal.
Well, I got off of one of them and went back to him 2 weeks ago, and he yelled at me.
Oh, yeah, I know. I
Told me to get back on.
I know. Here's what happens. If you can't make the serotonin, then you don't have any serotonin in the storage units. When electricity comes down this nerve, brain neuron, there's no serotonin to release. Now, here's the gig. They're so stupid. These women come in, they're on Lexapro, they're on Prozac, they're on all these. Look, they all sit in the same place on the same wagon. They keep adding more. I haven't seen this for a few years. Good God, you're in Delaware? Oh, forget it. It's just ridiculous. Here's the deal. They don't work because there's no serotonin to block out here to hit these receptors because you're not making it. Are you with me?
Right.
Now, I will tell you, before I became integrative in 2005, I was a top Lexapro physician in the state of Florida because I had all these people who had serotonin levels in the basement, but the highest I could get the serotonin level with Lexapro was about 160 on the neurotransmitter testing. I developed a product called Serenity it's a little chalky because I tried to save people money. I balanced milligram per milligram what I saw with the neurotransmitter testing. I put the 5-HTP, how far away is that slide? It should be right here. Beautiful. One slide back. How about that? Okay, so here's the deal. In the small intestine, inside the intrachromatin cells, and I explain all this in the depression chapter in 2010. You can read it. Tryptophan from your turkey converts to 5-hydroxy. 90% of this is made in the small intestine. You got tryptophan being stolen by bad bacteria and by Lyme spirochetes, okay? Now, 5-HTP, I put in my Serenity, high quality. It goes to the brain cell, inside the brain cell in 0.7 seconds. That's a new study. I'm not sure why we did that study, but someone spent money on it. In 0.7 seconds inside the brain cell, we really needed to know it was 0.7 seconds versus, 2 seconds. This 5-HTP becomes serotonin. but you have no 5-HTP to become serotonin. It's obvious to me from your history. So there's no serotonin in your vesicles or brain cell storage units. So there's no serotonin to come out to the synapse. So there's no serotonin to block the reuptake. So they put you on 2 or 3 of the bulbs. I mean, seriously. Now, the bigger problem is, I didn't think anybody still used these 2 guys. That phase 1 liver detox I talked about 3 hours ago, the cytochrome P450 enzymes, Paxil and Prozac shut it down 70%. People worry about the genetics, and these women come in here and their wellness doctor said, oh, goodness, you got 3 liver enzymes that don't work well. They can't tell you how much they're shut down. Well, guess what? Paxil and Prozac downregulate the activity of those 7 liver enzymes by 70%.
That's scary.
Lexapro 30, and Zell lost about 40. You think your psychiatrist knows that? He doesn't know jack squat.
No, he's a general.
Well, God bless him. You know what? I'll just leave it at that.
At University of Michigan.
Yeah, yeah, I know. So the deal is, I'm curious, which 3 are you on? Which 3 are you on?
Cymbalta,
Okay.
buspirone, and bupropion.
Okay. Bupropion, or Wellbutrin is a trade name, blocks the noradrenaline out in the synapse. Cymbalta is like Effexor. It blocks the serotonin and norepi out in the synapse. Now, the norepi lift may have helped you some because dopamine converts downstream through an enzyme, dopamine hydroxylase, to noradrenaline. The noradrenaline or norepinephrine that you're blocking out here where it works, instead of allowing it to go back inside the brain cells where it doesn't do anything, your Cymbalta and Wellbutrin are keeping it out here. The norepi, or noradrenaline, is made in a factory in the brain called the A5 nucleus. It is typically shut down in all my patients where you should have a level of 40. The average bear walking in this clinic is at 25 or 20, and I've seen it down to like 2 in the Teal Greens of the world who had narcolepsy. She was so shut down. So it may help you in that regard, give you some energy. It's the shutdown of the A5 nucleus in the brain from the toxins. And then the noradrenaline made up in the brain converts downstream to pure adrenaline made in the adrenals. So when the norepinephrine or noradrenaline and the pure adrenaline are down in the basement, you have severe fatigue. But you also will convert your dopamine downstream, and then you shut down your reward center more. So there's lots of things going on. Problematic is that, and if you go to my little ABC video, about 6 years ago, I did a story for this news anchor, a medical news anchor, on how these drugs cause suicidality in so many people. Now, the producer at ABC just wanted to focus on kids who become suicidal when they're given these drugs. And I said, it's not just kids, it's adults who inherit the underactive reward center, which it sounds like you did.
Yeah.
Because, and what the sad thing is, I do the story and I explain that the more serotonin you put out here, the more you prevent the release, inhibit the release of dopamine. It's an inverse relationship. So the producer, they're supposed to run this story a week later. And they didn't run it for 3 weeks, and I called the producer, Linda Hurtado, the medical news anchor. I said, what's the deal? The producer canceled. No, but he mandated I find a brain expert in Tampa Bay who will agree with what you said about the inverse relationship. It took her 6 weeks and 21 doctors. Is that sad? And she found a female, of course, who did 2 extra years of psych pharm after her psychiatry residency. She said, no, Sponaugle was right. So if you pump too much serotonin out here, and yet your depression is derived from a dopamine deficiency or a deficiency of happy receptors in your reward center, you will make that patient more depressed and more suicidal. But the Effexor Cymbalta effect and Wellbutrin effect, bupropion effect, would actually help. So I'm dying to see your neurotransmitters, but here's the deal. If your serotonin is low, and I have no doubt it is, then those drugs would have helped you some. But my research, going back years ago in the SPECT scans, let's see if I can go back to that. Where were we? where would if you can, get me back to, I'll let you do it. We got a touch screen here. Hang on. My research with SPECT scans going back, there we go, up top. Is one. Find the one that's got them both. Here you go, up here. Okay. We got, no, you got both right there. Perfect. This one. Okay. Perfect. Beautiful. Thank you. Good job. We have 700 slides. This girl's done a great job. All right. This is the brain you want, happy brain. This brain is miserable, overactive, cingulate from serotonin deficiency, worry. You're a worrywart, I would imagine.
Yes.
Were you a fingernail biter as a kid?
I still am.
Okay. It's just
Horrible. It's horrible.
If you read that chapter on anxiety I wrote in 10 for Brenda, these are just things I do, Sponaugle-isms, from paying attention. A kid that's worried all the time will bite their fingernails or they'll just pick. And
Yes.
so, yeah, you may not want to admit you're a little stubborn. But your husband might think you are or somebody else.
Extremely stubborn.
And you admit it. All right.
Extremely.
Just fun brain science can be. A little unforgiving. Now, look, you don't want to be. You're
Very unforgiving.
Wow. Usually they'll say, huh, and the husband's behind you going, uh-huh. But listen, you can't help it. Argumentative. If I ask you,
Extremely. I'm the most argumentative there is.
here's what happens. If your husband says, oh, you know, Tim McGraw's in town or so-and-so's in town, and by the way, for all my patients, Carrie Underwood's in town next Wednesday night. I never go to those things, but I saw it on the news. Anyway, so if your husband says, hey, what do you think about going here? You'll say no before you even think about it, and then you'll come back half an hour like, well, I guess we could do that.
Right.
Yeah, I used to do 5 hours just on the personalities that I figured out go on this. So anyway, this is from the cingulate being overactive, and you can't help it. So if any family is wanting to,
that's exactly it.
she cannot help it. She doesn't want to be this person, and you can't help it.
Exactly.
It's no fun to hyper focus on the negative and do all this. By the way, this is 90% of doctors. They can't see anything, and they don't want you put on here. Don't move my cheese. Okay, now don't change it. Now,
Yes.
the deep limbic system, overactive, makes you, let's go back one and see if we can find it, makes you depressed, negative, moody, irritable, less social.
Yes.
The more of this overactivity you develop here from more of the serotonin taurine deficiency, the less social. You may have been more of a social butterfly 20 years ago, but now you're just, rather go out and socialize. More hopelessness. See, the family members will see this.
Oh, yes.
They don't see your hopelessness.
Never. I tell them about it,
Well, good for you.
but they don't know what to do with it.
No, but I do. You know what? I'll bring you out of the hole in 3 days. I'll bet you right now. I'll bet you $10 or the title to my red Rubicon Wrangler Jeep, to your title. I get a lot of patients tell me their car titles. I never make them pay. I'll bet you I can bring you out of the hole in 3 days.
I never thought that would be possible.
I know. I want you to look for a video testimony on a woman named Heather
Okay.
on my YouTube channel where she talked about buying a white snowsuit so she could kill herself in a snowdrift and make it look like an accident. Didn't want anybody to find her. She didn't want her kids to know she was going to kill herself. San Francisco woman. I didn't think she'd say all that on a video testimony, but it'll help you tremendously. There's a lot of testimonials on my YouTube channel of people who were suicidal. They'll all talk to you. Listen, you need to get down here sooner than later. You're also easily offended. Look, we can laugh. You know why we can laugh? Because I can change all this.
Well, and I again, with all that, it went into the Lyme and Babesia and Mycoplasma, and then it went into I'm probably positively toxic with industrial because I'm a flight attendant.
Oh, you're a flight attendant.
For 22 years.
Good God, you're full of those methylbenzenes. That jet fuel is deadly.
So I think that all of that put together, I need you. I don't want you, I just need you.
Well, when you're sitting on that tarmac and you smell that jet fuel all the time, my flight attendants and pilots are some of the most petrotoxic people I treat. And actually, there's a play that I figured out in 2008. First in Body Shop guys, but yeah, I'm going the wrong way. I'll find it. It's right here somewhere. Don't worry about it. I'm just
hoping it's not going to take like 10 years to get this all out of me.
Well, I get toxins out of you pretty quickly. Actually,
it's like that could be a little long.
So you're worried ahead of time.
See, I'm way ahead of you.
Things to worry about. Yep.
Worried.
I'm trying to figure out. Well, I was going to show you again the second step for making serotonin in the brain cell, where the 5-HTP becomes serotonin inside the brain cell. I was able to prove in 2008, first in 2 Body Shop guys that were full of the benzene toluene chemicals, that when there's enough of that stuff in your brain, it shuts down this enzyme. It converts the 5-HTP to serotonin inside the brain cell. But most people, the problem is here. Look, you'll be fun to play with. The brain stuff. What I do.
And how long do you stay detoxed? Do you know, like how? You know what I mean? That's a question.
You know, when I did a thing with Suzanne Summers in 2012, after that's on my website, I explained deeper level of how these toxins shut down the brain and the hormones and all this stuff. And she said, well, geez, how do we stay detoxed? Right. A lot of people come back here twice a year for a week for me to, quote, change their oil. Now, look, it doesn't, you may not have to, but if you're going to remain on jets,
right.
That tarmac,
that worries
you guys sit there. You're on there for a lot of time before we are. And in the morning particularly, tell me how you crank up those engines to cool down the plane, especially in the summer, and it's nasty.
Well, the problem is the airlines know about it, and they know it's killing people and flight attendants and pilots, and they're pushing it all under the rug.
Oh, I didn't know they knew. I mean, I think
they know. They're very well aware because my friend sued them and took a buyout, and he's on Aricept for the rest of his life.
Oh,
and
good Lord.
It took him $60,000 in speech therapy just to get his speech back.
Aricept, can you get me a amino acid deal that's got the ethanolamine? Let me show you how you beat Aricept. I showed a couple of new ladies this today. I love this biochemistry. Aricept, for you folks who don't know, it blocks the breakdown of acetylcholine, which runs the 4-day memory. I've begged different companies, it might be there, click that and see. No, we may not have it in the PowerPoint. This amino acid test goes for, see if that's one. Nah, that's the other one. Anyway, on this testing, maybe we'll find it on one of those. Look at some of those right there. Here we go, beautiful. There we go. I love it. All right, it's all about the deeper biochemistry. If you don't know biochemical pathways, you can't heal anybody from the inside out. Ethanolamine becomes phosphoroethanolamine unless you're magnesium deficient. The differential in 50 percentile to 10 percentile, that differential is a magnesium deficiency. Simply giving intravenous magnesium and getting the magnesium pumped up will bring this guy up. So ethanolamine becomes phosphoethanolamine. This guy becomes acetylcholine. So Bass Ackwood Big Pharma wants you to use Aricept to block the breakdown of acetylcholine. Why don't we just fix the nutrition and get this guy sky high? Then you make tons of acetylcholine. You see what I'm talking about? Isn't that cool?
Wow.
Oh yeah.
And he's a nurse now.
Yeah. Well, he won't know anything. He learned what I learned.
I wish he would.
Yeah. We'll get him on a webinar next week. So if he wants to get off the Aricept, let's just fix the nutritional issues.
Yeah.
I mean, I could spend 10 hours just on this alone.
Yeah.
But this cystathione becomes glutathione. You think this person can make any glutathione? No. So the more toxic you get, the more nutritional deficiencies you get, the less nutrition you have to make the cystathione that becomes a glutathione. Look at that. I mean, is that ridiculous? I mean, seriously. The worst 5% of people tested are 8, and my page is 0.96. So there's no cystathione to make glutathione. So the more toxic you get, the more malnourished you get, the less ability you have to make the glutathione to grab the toxins. You see, so the dominoes just keep rolling the wrong way. I just push the dominoes back the way they're supposed to go. and you
Okay.
guys kill yourself. So anyway,
You need to go to bed at some point, don't you?
so anyway,
You need to go to bed at some point, don't you?
yeah, I'm just going to stay and go to work in a couple hours. So anyway, I hope I helped you out a lot. You learn a
Yes.
lot. And
I'm
look,
planning on probably January.
okay, that's a great time to come. You get back with the folks you've talked to, and they'll get you in there. We're already booking people in January now, so it's
Wonderful.
it's wonderful. It's been a pleasure talking with you. I want
Thank
you to
you.
know that I can get you out of this depression and get you off those medications. And look, there was a time when I used those medications. We don't need to do that. We're going to
I
fix the
know.
cause.
I don't want to do that.
Okay. All right. Listen, you hang in there for January.
Thank
All
you.
right. Take care.
Thank you.
You're welcome. All right. I think we'll wrap it up unless there's somebody got a burning question there. I hope all you folks learn from that. Depression. We have 1/3 of Americans fighting depression, and 50% of it is from the overactive deep limbic system, but 50% of that depression is from an underactive reward center. And some of you have been placed on the antidepressants and made more suicidal. It's because your reward center was shut down more. And I've treated thousands of patients who were screamed at by the psychiatrists like this lady because they went off of an antidepressant that actually was making them worse. And you have to understand the brain physiology. And so you cannot optimize serotonin without optimizing it. You have to protect the dopamine. You have to know you cannot raise one without the other. You can cause a problem. It's about a physiological balance. So anyway. All right, so are there any questions, or what time is it? 1 o'clock. Well, I guess we'll, all right. We'll take the rest of the questions next week. Please come back next Thursday if I didn't get to your questions. And I hope you learned a lot of good stuff tonight. Look, one last thing. The brain is the computer that runs every other system in your body. The brain runs the immune system. If you can't optimize brain function, you can't not optimize immune function. And I've been saying that for 5 years. Neuroimmunologists, since we got all you folks that think you're dying of Lyme disease and whatever infections you are, whatever. The deal is, if you do not know how to optimize the brain function, you will not optimize immune function. Neuroimmunologists have said since 2011 that the immune system is simply the tail end of the neurological system, and obviously the brain is the computer that runs the neurological system. And last year, the chairman of neuroscience at University of Virginia said, oh my God, we have to rewrite all the textbooks. One of his scientists found a new link between the brain and the immune system through the lymphatic system, something that has been missed worldwide by all the MRIs. You know, thank God for software engineers and all the technology getting better, MRIs get better. So it's a new finding that's revolutionary, but the bottom line is the brain runs the endocrine system, the cardiovascular system, and definitely the immune system. And it's just part of the piece. So it's horse, cart, cart, horse. Anyway, so with that, we'll call tonight. We appreciate your patience. I hope you guys learned a lot. We'll come back next Thursday, and we'll take questions, and we will not teach. We will only teach with each question, and we'll do mini consults all night long. So we'll say good night, and thank you guys for coming on. Go ahead, tell me.
All right, everyone. Well, thank you so much for joining us this evening, and so impressed that all of you that have such stamina, you stuck in there a long time. If we did not get a chance to take your question this evening, rest assured that we will be scheduling another webinar, like you said, just to focus on getting a chance to specifically focus on the questions that you have. I do apologize for the technical difficulties we had earlier that sort of put us back a bit as far as getting to take those questions. However, we'll rest assured we will get to you. So, in the meantime, tomorrow you can expect a follow-up email. It will include some of the information that Dr. Sponaugle has referenced tonight, some of the links and articles that he said you might find pertinent or beneficial. So if you if you have questions prior to that time, or if you have questions that you would like answered prior to the next webinar, please feel free to reach out to one of our patient coordinators. We will send that information in the email as well, but you're also welcome to go to our website and reach out on the phone number on the home page and ask for one of our patient coordinators. So thank you so much for everything, and let us know what we can do to answer your questions, and we will get that information out to you tomorrow. Thank you so much, and have a wonderful night.